with various types of penetration, the inheritance. That is the reason why, even within a community, you can have areas that are more commoner than others. In Nigeria, this countrywide study was done in 2005 to 2007, where it was found that this condition is not even common amongst the Ijaw, the very riverine people. It's not common. Glaucoma is not common among them. But it's common among the Southeasterners and the Yorubas. But the inheritance is the problem. Now, somebody mentioned that why is it commoner in the South than in the North? Because Northerners tend to be having more blind people. Yes, blindness can be caused by so many various things. And the one that is commonly caused in the North, one of them is due to lack of water supply, something as basic as water. In fact, water causes a condition called trachoma. And trachoma is a ravaging, blinding condition in many parts of the North. All of us can understand that water supply can be a problem in vast areas of the Sahel and the savannas in the North. So they have a lot of trachoma. The second commonest cause of blindness in that part of the country is onchocerciasis. Onchocerciasis is related to fast-flowing rivers, because black fly, that is the agent of onchocerciasis, likes fast-flowing rivers. The rivers in the South are not fast anymore. They are close to the sea. So you don't have fast-flowing rivers commonly in the South. So up to the middle belt, onchocerciasis is very, very common because they have a lot of fast-flowing rivers. So let me not digress to that. So glaucoma is hereditary, it is inherited, and studies have shown that the Yorubas and the Igbos lead. In fact, Igbos come first, then the Yorubas. People have assigned it to so many things, but the truth of the matter is that it is inheritance. Some families will have it, some families will not even have it at all. It's not all Igbos and Yorubas. When you go to Igbo land, you will discover that it is commoner in Anambra than Imo and things like that. Inside, for example, I will mention areas in Ogun State so that you don't demonize them. In Ogun State, we've done a lot of studies too. There are some parts of Ogun State where it is commoner than others. In fact, in areas that glaucoma is common in Ogun State, some towns have more burden than others. So what we do is that those areas that we discover that the thing is more common, we concentrate our outreaches there to catch early cases. Actually, the key to glaucoma management is early detection. And that's why we thought we should sensitize primary care physicians because they see the load of patients. You see, over 70% of Nigerians has first call for orthodox care. I'm not saying first call for care. We all know that before they come for you, they've gone some other places before. But at least they will eventually come to you. And if your own knowledge of glaucoma is high, then you will pick those who have high risk factors, and any suspicion you will refer on time, so diagnosis can be made on time, and management can start on time, because glaucoma is incurable. As of today, it's still incurable. So the best management is to catch it early, and so that management can start early so that we can prevent blindness. Because if nothing is done, blindness is the end result. The second reason is because even us as doctors, we deserve to catch glaucoma early amongst us. All of us are blacks. Being black is one major risk factor. The second risk factor is age. In Nigeria, anybody above the age of 30 should learn to check their eyes at least once a year, even if you don't have a family history. If you have a family history of glaucoma, check it twice a year. If you check it frequently, you will catch it early, and you can start treatment early, and therefore can prevent blindness. Because when blindness has been caused by glaucoma, it's irreversible. What we found is that majority of patients they come already blind in at least one eye. In fact, a good number will have come when even the second eye is almost gone. And it's usually very devastating. It's usually it's an unhappy thing that most of your patients are blind before coming. So that's why we need to be, not only to know, we should know for our own interest, so that doctors should approach their colleagues and check their eyes regularly. Thank you very much.
Thank you very much for the response. I think there's another person. Where is the other person with the mic? Can you help me give to you?
My question, if one is having both glaucoma and cataract, is it possible to still go ahead and operate the cataract after the glaucoma is we have commenced treatment on a glaucoma, or it is no longer possible to operate the cataract once you are diagnosed with glaucoma?
Do you have any questions? Presenter can take the questions together. Do you have another question? Okay, thank you. Okay, sorry. No.
Good morning. Good morning.
Go ahead, sir.
I'm Dr. Fadipe. I'm from Osun State. We do blood pressure to check for hypertension. When people come complaining of eye problems, and we may be thinking of this fellow may have glaucoma, are there some simple gadgets that one can use for one to pick the intraocular pressure that is, or we just refer to the ophthalmologist straight? Thank you, sir.
Thank you. That's a very good question. Very relevant to practitioners. Okay, that's another one. Okay, thank you, sir.
Thank you very much, sir. Please, I would like to know, after commencement of treatment for glaucoma patients, how long will it take for them to still go blind? The reason I'm asking is that there's a patient I know who has been on treatment for glaucoma for the past 30 years, but currently he's blind. So how long does it take to become blind from glaucoma?
Thank you. Other questions?
Thank you very much, sir. I'm Clement Imoda. This question is part of Dr. Iyamu's question, because in Warri, we had a very renowned ENT surgeon who had the privilege of having medical treatment for his glaucoma in Europe. Eventually, he got blind before he passed on. Although that was not the reason he passed on, but he still got blind. He was having his treatment in Switzerland. Thank you.
Thank you very much. I'm happy for all these reactions. It is very much welcome. I will start from the first that talked about if a patient has both cataract and glaucoma, and can the cataract be operated upon eventually? Of course, it can. In fact, but the glaucoma must first of all be controlled before any eye surgeries. That's the reason why glaucoma is the first step. You lower the intraocular pressure so that your surgery can be successful. So that's the reason. So you can still have both cataract surgery, you can still have glaucoma surgery. Of course, Maybe I will explain a little bit. Maybe we've started the CPD this morning, because my advocacy this morning was to encourage us to include glaucoma as one of future CPD. Now, glaucoma is largely symptomless. So it's difficult for you to know you have any eye problem when it starts. It can take 5 to 10 years before you realize that I have blurry vision. In fact, the funny thing about glaucoma is that that blurry vision can be deceitful. It will be blurry at this minute, next minute it's very clear. So some people will say, maybe I didn't eat well this morning, that's why it was blurry. So they won't do much about it. Some of them will be changing their glasses because the thing is blurry. They keep changing it. So that is why it is quite common. And because it occurs in elderly people, those above the age of 40 mostly, cataract and glaucoma can coexist because these two conditions are also related to age. So that takes care of glaucoma and cataract. Now, coming to how long does it take to treat glaucoma before one can become blind is unknown. It is unknown. What we know for sure is that glaucoma can cause blindness irreversibly. But the whole essence of early diagnosis is that if it is diagnosed before visual loss has started, then you can prevent visual loss. But if visual loss has already started, your treatment is to slow down glaucoma damage. Because even when you control the intraocular pressure, there's no guarantee that damage will stop. The reason being that the only thing you are controlling is intraocular pressure. You are not controlling other component problems associated with glaucoma. For example, it can be associated with apneic attacks, which many people have overnight. Snorers, be careful, you may be having apneic attacks overnight, and things like that. Hypertensives who are on treatment, if you overtreat, you reduce blood supply to the optic nerve head, and it causes further damage in glaucoma patients. So many other risks, but the one that is controllable is the intraocular pressure. It is commoner amongst diabetes, it's commoner amongst myopes, and so many other groups. So the risk factors are a number, but the most important risk factor is high intraocular pressure. So anybody that is screened and found to have high intraocular pressure must be treated as a matter of priority before the high intraocular pressure leads to glaucoma. Glaucoma is not the same thing as high intraocular pressure. High intraocular pressure is actually ocular hypertension. You can have ocular hypertension without optic nerve damage, at least in the early stages. So some patients present like that, and if you have screened and know that it doesn't have glaucoma, even though the intraocular pressure is high, it's good. We lower the intraocular pressure as much as possible, so we prevent the thing progressing to becoming glaucoma. So treatment early is the key, and that treatment must not stop, must not be haphazard. The other information given is that someone who even have access to care outside Nigeria, in Europe, in Switzerland, eventually went blind. Just to tell you that that glaucoma was diagnosed probably later, not at the earliest possible time. And where you go in the world, you cannot guarantee prevention of blindness if the presentation is discovered late. All surgeries can be done, everything can be done. What they can do is to delay the eventual blindness if the person lives long enough. Because if you live long enough, and even if you are on treatment, there's no guarantee that blindness can still not occur. Because even when you lower the intraocular pressure, what about other things that support glaucoma that you are not controlling? For example, you can control your age. Can you treat your age? Can you treat your race? You cannot. You can't treat your race, you can't treat your age, you can't treat your ethnicity. You can imagine, if you are diabetic, can you just remove diabetes just like that? Although I know that in some people it's reversible, but it increases your risk. Hypertension. We all know that it is very ravaging, very common. So if a patient comes to you, is black, just like you, is over the age of 30, he has a family history of glaucoma, he is diabetic, maybe he was even hypertensive, it is compulsory to refer ophthalmologist, at least to be checking the eye. That's the information. The risk factors, if it is more than 2, in fact, even if it is 2, there's no harm in saying, see your ophthalmologist once a year. That's information. So that you can tell the patient, please go to. So the important thing is for you to know ophthalmologists surrounding your area of practice, so that you can choose where to refer patients who have many risk factors. So that is the information.
Thank you very much. I think let's give him a round of applause, please. I'm very sure and positive that we've all added, if it's just one thing or another, to our knowledge on glaucoma. So we want to sincerely appreciate our elder for giving us that discussion, and we had a robust interaction after us. So we will go to the next presentation now. Yeah. The next presentation, please, can we have the slide on? It's on immigration. So I want to call on Dr. Vicky Odogu, please. Come forward.
From the east down.
And please, if you have another presenter in the hall, please, let's move to the front street here. If you have another presenter in the hall, please move to the front street. So this morning, yes, please. We'll be asking for all of you.
To the west and south and north, we are the gatekeepers of our
This slide, please.
health. We work every day and night that Nigeria may be healthy. We are available. We are accessible. We are the largest providers of healthcare. We are available.
All right. So we'll be having the next presentation now in the next 7 minutes. So I can have question and answer. Thank you.
7 minutes. Well, good morning, everybody. It's nice to be here in Ogun State. My name is Mr. Odugu from Bayelsa State. We also have a practice in Port Harcourt. Next slide, please. So, this morning I'm going to be talking not about ophthalmology, but the individual challenges that people get when they leave this country, which is part of the sub-theme of this AGM. What I'll be saying will be a general thing to every individual that leaves this country, and some of it will be related to the medical professionals. Next slide, please. So, I just wanted to pose this question. I hear people use this word, which has come into popular Nigerian lexicon in the last few years. I think it's called japa. And I don't know if it's used pejoratively or in a jest or as a word of endearment. Somebody will tell us in this audience. Next slide, please. And then, of course, the other question I want to pose is when this particular word came into popular lexicon in Nigeria, whether it was after COVID or before COVID. Next slide. Emigration, which you spell with an E, means when a patient is actually leaving his normal place to move to another country to set up a new life. And it's typically to seek better opportunities. Next slide. So these countries where these people are moving to, the question is, what is it in it for them? What is attracting so many people there? Why are these people having so much capacity to take in people from other parts of the country. And I've listed some of them there, the benefits to the emigrate. A lot of people from the outset want to move to somewhere else. And some have an aura, have developed an aura around qualifications from developed countries, and they feel that they want to avail themselves of that opportunity. They want better education for their children, and of course the elephant in the room is the wages that they feel they will be earning when they get there. Next slide. So, like I mentioned, what is actually driving this? Why are these people having so much capacity to take in doctors from other countries? This whole thing started after the Second World War, when the governments in those countries felt it was a social responsibility to care for its people, so they expanded their healthcare. They were not producing enough doctors. The standards to go into medical school in a lot of developed countries is very high. So the numbers going in were not enough. And so many people are retiring. In the USA, in 2023, 27,000 people left the medical workforce. So 27,000. So all those people needed to be replaced. In the UK, in the next 5 years, in the next 2 years, 5,000 doctors will leave the general practice. And the workforce planning is not sufficient to cover all of this. This is why they have the capacity to keep poaching doctors from developing countries. Next slide. So like I mentioned before, when they take these doctors from this country, they are saving on education. It costs £250,000, not naira, £1,000 to train one doctor in the UK. If you can get it cheaper from another country, why not? So, and then of course the immigrants, a lot of them come and they take whatever wage you offer them initially. They don't bother about the cost. They feel it's better than what they were earning where they were. And the migrants will be paying taxes to their country. And these are the things that allow them to get these patients in. Next slide. So this is the UK nursing register. I got this information from them. These are the top 3 countries that in 2023 registered nurses. India was top with over 48,000. The Philippines, over 45,000. In case of Philippines, there is a direct agreement between the 2 governments. So the immigration there is very well managed. And then Nigeria comes next, over 10,000. Next slide. So this is an exponential increase in the number of nurses from Nigeria that have registered with the Nursing Council since COVID. So you can see at the bottom in 2018 was just 56 nurses. And then fast forward to 2023, 3,457 Nigerian nurses were registered. Next slide. So this is some information which I'm sure you probably all know about. Nigeria needs over 300,000 doctors to meet the WHO standards, which it doesn't have at the moment. 700 doctors were lost to the developed world, and there are 3.8 doctors per 1,000 in 2019, according to WHO. Even this is, in terms of distribution, is skewed. Next slide. So this is another report from the GMC workforce in 2023. 68% of all registrations with the Medical Council in the UK was from overseas doctors. And 52% of these doctors were from these top 5 countries: India, Pakistan, Nigeria, Egypt, and Bangladesh, in that order. Overseas doctors have now overtaken the UK-trained doctors as the largest single group route to registration. Next slide. And what is the ages of these people coming? Most of them have probably less than 7 years post-graduation before they leave these countries. A lot of them are 5 years, 4 years post-graduation, and they depart from their original countries. Next slide. So the challenges to the challenges to the emigre are subdivided into these headings, and as we go along, I will explain. Next slide, please. The main challenge is the fact that whatever qualification you're coming with, is most cases is not recognized because the employers doubt the qualifications people coming from developing countries have. There's also the racial discrimination and the prejudice about this. There's also the likelihood to work below the level of experience. Next slide. And what specialties are these people going into when they come? They are going into specialties that most of the people... Okay. Well, I've been told to round up in 2 minutes. I think probably you might need to push the boat out a bit to 5 minutes. I won't be long. So general practice has exploded. That's where they need people. The idea of this slide is just to show you that people are going into psychiatry and going into general practice because that's where the need is. Next slide. And economic challenges that people face, unless you have family there, you find it difficult to sort out accommodation because you have no access to financial services. And the cost of living in these countries are very high, and a lot of people, there's a big culture shock when they get there. Next slide. And because of these challenges that people face, they do get into legal difficulties because they want to cut corners. For example, 1 in 5 female prisoners in the UK are from West Africa. And you ask yourself, why is this so? Next slide. So the essence of this slide is just to show you that the cost of renting a one-bedroom flat at the moment in London is £2,190, and the average nurse arriving from a developing country is only paid £1,766 per month. So it doesn't add up. People face these severe accommodation challenges when they get there. Next slide. This is just a depiction of regret from the... next slide. Next slide. So, next slide, please. Next slide. Now, there's a recent study that has just been published amongst recent arrivals that within 15 years, the divorce rate amongst the arrivals is more than 40%. This cuts across all socio-economic groups and because of the pressures of living abroad. Next slide. And indicated in red, the figures for sub-Saharan Africans, which includes Nigerians. Next slide. This is a very big issue. There's a disproportionate number of immigrants using mental health services because of the difficulties that they face when they get there. The commonest is depressive illness. Next slide. I'm just rounding up now. There was a study that determined what actually constitutes life satisfaction for these emigres. it's most likely that they'll be more satisfied if they are with their families, ability to secure employment, the educated ones do better, and maintenance of connection with their home countries. Next slide. So I'm just going to round up now. Next slide. So, whether we like it or not, there's still going to be a lot of people leaving this country. International medical graduates are needed by all these countries. It's whether we can actually, as a country, manage the outflow of people. Should there be a bond scheme with, just as we have the NYSC, where people can serve their country probably longer than the 12 months? Should we have an agreement with these countries, just like the Philippines has, to export manpower in a managed way so that when they get there, they don't face unnecessary problems? And, you know, should we be asking for compensation from these developed countries for taking, you know, ready-made manpower from here? Like I say, it costs them £250,000 to train one doctor, and they are getting it for a fraction of that. Thank you very much.
Thank you very much. Let's appreciate our presenter once more. Without doubt, it's a topic that will generate a lot of questions, a lot of response without doubt. And unfortunately, equally, these are not the target of population for this type of topic. We all know the target population, those that, whether you like it or not, I don't know whether they will still resonate with this, despite all the challenges we have there. Be that as it may, we maybe just take one or two feedback before we move to the next presentation. Just one or two feedback before we move to the next presentation. So, do you have any comment? Okay. Just take two. Any other person? Wait, please. Any other person?
Felix Iyamo is my name from
Okay,
Edo.
so just take that one.
I want to thank the presenter for the lucid presentation. The fact remains that until we fix our country, the problem will continue. All what he has said, they are very true, but be that as it may, some still succeed somehow. Some others, they have regrets, but because of all that they have sold, all that they have left, they are unable to return. And so they continue to strive it out right there. Many people travel without having the right information. And once they get there, they are unable to return back. However, like I said, the answer really lies in fixing our country. If things are okay and the doctors are well paid, I don't think any person will want to go out there. The weather condition alone is sufficient to discourage any person. But when you look at where you are coming from, things are so bad with all the problems, other problems, insecurity and other things. People just say, well, let me go and be suffering there. I know of many consultants that left here and take up a medical officer's job over there. And they are paid less than what they are supposed to be paid. They don't recognize them properly. However, until this country is better, all these problems will continue. Thank you so much.
Thank you very much.
Thank you. Thank you for this beautiful lecture.
Thank you very much.
I want to say that usually we say there is no place like home. But when the home is not good, what happens? People will want to find a way out. And why is our home not good? I think it's the fault of all of us. It's the fault of all of us. And until we are ready to allow things to change in this country, people will move out. And the moving out is going rapidly. And if we don't take precaution that is necessary to make sure that this country gets to where it's supposed to be. In those days, when we travel out to train and come back home. A good job. And I maintain that until we retire. So the fault of our people going out is the fault of all of us, the government and the rest of us. When the government is not doing too well, we should stand up and protest. Trump told us that we are not doing well because the people who are leading us are not doing well. And we kept quiet. In Turkey, in those days, when the military wanted to take over, the ordinary people went to the street that we don't want you to take over. If you want, you can kill all of us. And they didn't allow them to take over. Until we get to that stage that we want our nation to be good, things cannot change. And we must have that initiative to start thinking of how we can make Nigeria a better nation. As far as I'm concerned, Nigeria is the best country that we can have. But until we all work towards it, things will not get better.
Thank you very much. We quite appreciate the contributions from our elders. We can't take any more contribution now because we are pressed for time. And there's a slight modification to the programs of events. Now, we will be taking one of our sub-team lecture. Please, can we have the slide up? We'll be taking one of our sub-team lecture, and our lecturer is around, seated, and we should understand the reason why we are bringing it forward. Please, can we have the slide? So the okay, while we are sorting out the logistics there, let's quickly take one more abstract again. It's 10 minutes. So we'll be Dr. Francis Achebe is here.
Can you link
on
Can you link out where they are doing?
Abstract. No, abstract.
Understanding of the one going back.
Biomarkers.
We are the Association of Nigerian Private Medical Practitioners, ANPMP forever. ANPMP, we are greater together. We are many, but we are one. From the east down to the west, the south and north. We are the gatekeepers of our people's health. We work every day and night that Nigeria may be healthy. We are available, we are accessible, we are the largest providers of health. We are.
Thank you very much. So we have the next presentation now, while we sort out the logistics on the sub-team lecture. So we'll be calling on Dr. Francis Achebe, who will be taking us in the next 8 minutes through his presentation. So please, where is it? Okay. So,
President
slide, please. So the next 10 minutes will be.
The president I'm the national president.
Okay, now. So, taking up on the biomarkers of CRMS, revealing the present and futuristic benefits of charting the CRMS. Within the next 10 minutes, we should round up this topic before we go to our sub-team lecture. Thank you.
We are available, we are accessible, we are the largest providers of healthcare. From up above the river Niger and Benway.
Good morning, my teachers, senior colleagues and colleagues. It's my pleasure to be in your midst today, and I celebrate all of us for our 47th consecutive annual International Scientific Conference. My name is Dr. Achebe Francis, like introduced. I am here to make this presentation on the biomarkers of the Cretin model fertility care system, revealing the present, the futuristic benefits of charting the Cretin model system. Next slide, please. Biomarkers are objective science based on discrete criteria that reveals an individual or group of pathophysiological events. Next slide, please. So when women chart their menstrual cycle, it may sound very simplistic, but with the Cretin model system, over 27 years of research, we have found out that it's a basic thing that has been neglected. We gloss over it, and it holds information that can help us to manage our women and couples from menarche to menopause, dealing with all gynecological conditions in a way that is cooperative with the woman's menstrual cycle. So those biomarkers that I'm going to be talking about, when they chart, we talk about the cycle length, the pre-peak phase and the post-peak phase, the mucus cycle length, the quality and quantity of the mucus, unusual bleedings like premenstrual bleeding, tail membrane bleeding, estrogen stroke breakthrough bleeding, estrogen withdrawal bleeding, very heavy menstrual flows, menstrual flow completely or partially brownish or dark. Something as simple as that is very significant. And scanty menstrual flow, implantation bleedings. Then we have the abnormal discharges or other discharges like frequent wet without lubrication discharge, gummy mucus discharges, post-peak peak type mucus, non-peak type mucus discharges, pre-peak non-peak type mucus discharges, implantation mucus discharge, continuous peak type mucus or non-peak type mucus, and sometimes women will come with dry cycles. Next slide. This is a typical Cretin model chart. I take you through it. The red stamps represents the days of those women's bleeding in this particular chart, after which she had her early dry days, which we represent with the green stamp. Then she started to observe the cervical mucus discharge, which we represent with the white baby stamp. Then later she now had her late dry days. This chart is normal. If you look at this chart too, sorry, I don't know if we can get a pointer. If you look at, go back to the first chart. Okay, if you look at the black bars, they represent the pre-ovulatory estrogen production before ovulation. And you can see that it correlates with what the woman is observing. As the woman is observing her menstrual cycle on a daily basis, we also collected blood samples to check what they call the pre-ovulatory estrogen. And we see that when she achieves her peak estrogen, that is the highest black bar, within 24 to 48 hours, the woman will rupture her follicle, she will ovulate. And then she will go into the post-ovulatory phase, where she is now having the predominant hormone progesterone. And that is the red bar. Next slide. So we could have regular cycles, short cycles, or long cycle. And I want to put it here that the length of a menstrual cycle does not dictate pathology. The length of a woman's menstrual cycle. You cannot use it to know if that cycle is pathologic or not. 2 women can have cycles of 25 days. One is pathologic, the other is not. And also 2 women can have cycles of consistently 28 days. One is pathologic, one is not. To be able to identify which of your menstrual cycle is pathologic, we must be able to identify the woman's peak day. The peak day gives us a very clear guide on the location of the woman's ovulation. The pre-ovulatory phase, or what some people call the pre-peak phase, is relatively variable in length. But the post-ovulatory phase is relatively constant. So it is in the pre-ovulatory phase you can determine a cycle length. So a woman can have a 25-day cycle, and she ovulates, say, for example, on day 20. That woman will have a short luteal phase. Another woman can have a cycle length of 25 days, and she's ovulating on day 14. That woman will have a normal luteal phase. So just looking at the cycle length, what is your cycle length? 28 days is normal. May not be so. Next slide. Here we are looking at a long cycle, 51-day cycle. In a couple that is normal, 51-day cycle. Sometimes a woman will come to you 51-day cycle, you want to regulate her cycle. You want to start giving her progesterone so that you can regulate her cycle. Some people give oral contraceptive pills. You want to regulate her cycle. Are you sure that cycle is pathologic? Before regulating it, let her chart her creative model system and look at the biomarkers. If the biomarkers come out fine, leave her alone. Next slide. Here we are showing the slide of a woman with polycystic ovary disease. You can see the biomarker she expressed. She has very long mucous cycle. And you can see the periovulatory estrogen is low. And that is the ultrasound interposed there to show you the peripheral, arrangement of the follicles during ultrasound. Next slide. And here is another woman with a polycystic ovary disease. After a wedge resection, she recovered her cycle. The hyperandrogenicity was recovered, and she also achieved pregnancy. In NAPRO technology, we do wedge resection. Some persons don't want to do it because they say it's prone to adhesion. We've been able to handle that. With pelvic excision repair surgery technique, we have made sure that when we do wedge resections, there is no adhesion. Because the adhesion comes about in the technique of closing the cortex of the ovary. So when you tuck in the cortex of the ovary and you use non-absorbable sutures, like 40 or 50 proline to close the cortex of the ovary, there will be no adhesion. It is far better than doing ovarian drilling, which of course also is prone to adhesions. Next slide. Here we are showing some women that have polycystic ovary, how their cycle length could be. A mean of 44.6. Post-peak phase of 15 days. They usually have limited mucus. Next slide. This is I would say a retrospective study. This patient have been presenting this slide, and we didn't know what it is. She had tail membrane bleeding, premenstrual bleeding, intermenstrual bleeding, frequent 2Ws on her chart. Eventually, she conceived and had a miscarriage. You have 3 minutes. Eventually, she delivered and had a miscarriage. So, but if we see this now, we'll be able to intervene in time. That is the value of knowing the biomarkers of the creative model. Next slide. Next slide. Okay, please go back to that slide. This is a woman that have a long cycle, and we wanted to correct or regulate the cycle using progesterone. In NAPRO technology, we use isomolecular bioidentical progesterone, hormones that behave exactly like progesterone. We don't use progesterones that are not 21 carbon. And we give progesterone only when the woman needs progesterone. Post-peak. Progesterone is a predominantly post-ovulatory hormone. So you should be giving when you have confirmed that the woman has ovulated. You can't do that except you have a charting system. Probably you do an ultrasound, but will you do ultrasound for everybody? You won't. But if you tell them to chart the creative model system from peak +3, no woman ovulates again. In the study that I've done in NAPRO technology. And from that time, you can start progesterone. So we don't start progesterone day 16, day 18, day 14, day 17. If you do so, sometimes you are giving progesterone when the woman is still in her pre-ovulatory phase. And that will be counterproductive. Next slide. Next slide. Next slide, because I don't have time. Next slide. I can share this slide with all of us if I have the email of all our members. Next slide. So this is the NAPRO tracking. In the first slide, you see the woman have limited mucus. This is what we see in people with infertility. Second one, so I can tell a woman you are at risk of miscarriage, even when she has not conceived. I don't wait for my patient to have 3 consecutive miscarriages. When she charts the creative model system and she have a short post-peak phase, she's a candidate of miscarriage. When women have premenstrual bleeding, they have low progesterone. It's either they will miscarry or they will have premature delivery. Next slide. Next slide. Here is a woman that is having premenstrual bleeding. She was treated and the premenstrual bleeding resolved. Next slide. This is a woman that is having premenstrual bleeding, tail membrane bleeding. She was treated and it's also resolved. Next slide. Next slide. This is a woman with premenstrual bleeding with limited mucus, and this woman has been having recurrent miscarriages and also endometriosis. Next slide. I want to say premenstrual bleeding is always pathological. Always. 100% pathological. How do we define premenstrual bleeding? When a woman is having 3 days or more of very light or brown bleeding before the first day of moderate or heavy flow. So it's not when a patient comes to you and said, I have been bleeding for 8 days. You say menstrual bleeding time, 8 days. You need to ask on a daily basis, what happened on day 1, day 2, day 3, till day 8? And you find out she's having premenstrual bleeding. You don't manage it. You are exposing her to a pathology. Next slide. Okay. Next slide. Next slide. I'll just be showing the slide. Next slide. All these are the biomarkers that you can look in this pathology. Next slide. Biomarkers for this pathology. Next slide. Biomarkers for this pathology. Next slide. Biomarkers for this pathology. Next slide. Long mucus cycle is always PCOD. Next slide. Women that are at risk of breast cancer. These are the biomarkers that we see in them. We are not saying they are having the breast cancer already. But if a woman is expressing this biomarker and you don't do anything about it, they will end up with this pathology. So the creative model system is a screening tool. If you give me 5,000 women to screen them for breast cancer risk, I'll tell them to chart the creative model system if they are still in their pre-ovulatory state. And if they are still in their premenopausal state. And if they chart, I can get those that should go for mammography and those that should not go. By that way, I reduce the burden on the instrument that is being used. Next slide. These are literatures that confirm the relationship of recurrent pregnancy loss with breast cancer. Next slide. More literatures, endometriosis and breast cancer. Next slide. Endometriosis, breast cancer. Next slide. Progesterone deficiency and breast cancer. Next slide. Next slide. Next slide. This is a woman that have been chatting for years at the institute. By that time, the institute have not developed this concept very well. This woman ended up with a cancer. So the institute went back to look at her chart. She's been telling us since that I'm having unstable post-peak phase. I'm at risk of breast cancer. I'm at risk of breast cancer. Nobody did anything and she ended up with it. It's no more happening now. Next slide. Those that have risk of ovarian cancer, these are the biomarkers we have seen. Next slide. Literature showing endometriosis and ovarian cancer. Next slide. Next slide. Next slide. I'm just doing next slide. Next slide. Endometrial cancer risk. These are the biomarkers. Next. Next slide. Next slide. The use of progesterone has been found to be very safe. Please, it is not Primolut N. It's not hydroxyprogesterone acetate or midroxyprogesterone caproate. Those are not progesterones. They are progestogens. Progesterone is a 21 carbon. A molecule that is 24 carbon. So nanotechnology principle is to supplement with hormones should be natural, isomolecular, and bioidentical 21 carbon. Count the carbons. If it's 24, it's not progesterone. It will have androgenic effect. It will have estrogenic effect. That's why when you use progesterone to maintain pregnancy in some women that are carrying a baby child, when they deliver, they will have hyperclitoria. Because that molecule you use have androgenic effect. But if you give isomolecular bioidentical progesterone to a pregnant woman carrying a baby child, there will be nothing wrong with the clitoria. And you see in literature, progesterone support in pregnancy causes hyperclitoria. No way. It is when you use 24 carbon or 18 carbon or 22 carbon. This is what the pharmaceutical companies are doing. They want to patent it to own progesterone. So they will add something. It becomes their own. And it will start having side effects that progesterone don't have. Next slide. Thank you very much. So if you are interested, if I can get your emails, I can still send this slide to you. Keep you posted on what we do in NAPRO technology. The reason why I came is that I want our members to pick interest to be trained. I am the head of the American Academy of Fertility Care Professionals Research Committee. I'm the first Africa to sit on that chair. And we need a lot of us. Somebody was talking about japa. I'm bringing them to Nigeria. I'm not going to them. They are coming to us. Thank you very much.
Thank you very much.
We
Let's give a
are
round of
the
applause.
Association of Nigerian Private Medical Practitioners.
Our time is fast spent. As I've said earlier. Thank you. You are press of them. Now, as I've said earlier on, that we're making a slight adjustment to the program of events. We are bringing forward one of our sub-team to this morning for a reason that is very, very important. And the sub-team is a vision for the future, transforming Nigeria healthcare through innovation policy and partnership. And our presenter has been here with us in person of Dr. Richardson Adedayo Ajayi, the chairman, Bridge Clinics, Nigeria, and the United Kingdom. Please let us welcome him to come and deliver his lecture, which I believe we will all enjoy. Thank you very much. Welcome, sir.
Good morning, and thank you very much for this opportunity to give this presentation. And I also like to appreciate Dr. Faribi and his team for the opportunity to present earlier than I was originally scheduled to speak. Is there a slide sorter? No, okay. So do I ask for the change of slide? So, a very quick overview of who I am. I'm a gynecologist, fellow of the Royal College of Obstetricians and Gynecologists, as well as West African College of Surgeons. And many years ago, I realized the challenges of navigating the investment minefield as a doctor. So in addition to my medical training, I'm an alumnus of the Harvard Business School, Lagos Business School, as well as the London Business School. I'm a chartered director with the IOD UK. So I have been involved in many healthcare businesses, notably Bridge Clinic, and also Path Care, which is now running as SynLab, that we've exited from. So I'm here today I would also like to thank Dr. Tomi Koka, the Honorable Commissioner for Health for Ogun State. I chaired a committee with her where we were tasked with the responsibility of looking into setting up a national health facility regulation agency. So it is the work that we've done in that agency that I would like to give you. Public sector dominance from a policy point of view, even though there's a very large and growing private sector, where most of us here are practitioners, and we know how important we are. There's significant infrastructural challenges in terms of facilities and the capacity of our facilities to meet the needs of our patients. And the speakers before me talked about the workforce challenges with the japa syndrome, with people leaving. But I will also take this opportunity to add that there is a silent revolution going on in private healthcare in Nigeria, with a lot of people that are jackbarred who are now jackbarding significantly. And there are a lot of procedures that couldn't be done in Nigeria that we are now doing. So it's a big change going on, and I think that's a positive sign. So we shouldn't stop them from going, provided they come back. I think that's the gain that we have. Next slide, please. So there are many opportunities for innovation in our industry. Telemedicine, digital health records, point of care diagnosis, medication tracking. I'll talk a bit more about this, but I think what is missing is an oversight of sure that we're able to implement properly. Next slide, please. Government, but in particular for us in the private sector, because you have the people who may not share the same vision, and it really limits our progress. We've talked about workforce development and of course quality assurance. Next slide, please. So there's a need for a national health regulation agency, and this is something we've been talking about for a long time. Because there's a need to have a policy development, stakeholder coordination, regulatory oversight, performance monitoring. And when the idea of NEFRA started, a lot of feeling is, why do we regulatory agency? And I think by the end of my presentation, the need will be clear. What industry regulation important? The first is patient safety. It ensures healthcare providers maintain minimum quality and standard to prevent harm and protect vulnerable patients from unsafe practices. Quality assurance. It establishes consistent standards across all healthcare facilities, ensuring equal access to quality care regardless of location or socioeconomic status. We need to build trust in our healthcare system. A lot of people are trapped, not because they have the money, but just because they feel in our system, build trust. There's a need to create market stability, prevent market failure by addressing information asymmetry between providers and patients. This is one of the reasons, because at the end of the day, don't really know what they're buying. They have to trust the doctor to tell them, I am looking after your interests. And we thank God most doctors do look after patients' interests, but there are occasional doctors who will exploit patients. And so what systems can we put around the system to create that reassurance so that patients know that they are being looked after? And of course, we need to align with international standards. We all know what has happened to some industries where regulation is taking place. The banking industry in Nigeria has been transformed by regulation. Before the regulation that increased the share capital to 25 billion, there were banks in every corner failing every day, but now we have robust banking system, and on this platform, financial inclusivity has expanded. Same thing has happened with pensions, with PenCom, and same thing has happened with the insurance industry with the new Insurance Act. So regulation is critical. Oversight regulation is critical to transform industries, and what we hope is that with NEFRA, we will lead to a transformation in health as well. Next slide, please. The current state is very fragmented. The Nigerian Health Act 2014 states explicitly facility must have a set of standards. This has never been implemented in Nigeria. The Health Act also states that tertiary hospitals should be looked after by the National Tertiary Standards Committee, and all other hospitals, private and secondary, to be looked after by the state ministries of health. So that is the structure from an oversight point of view. Next slide, please. Only 2 states have taken this mandate seriously. Lagos State with EFEMA and Yobe State with YOFIMA. All the other states are working within the ministry and trying to do the best that they can with the limited resources that they have. I'm pleased to say there is now inaugurated a National Tertiary Institutions Standards Committee, and they are trying to organize the tertiary facilities in Nigeria. And the erstwhile Minister of State for Health, Dr. Tunji Alausa, felt there was a need to have an oversight body to look after primary and secondary care facilities, and that was what led to him the birth of NEFRA subcommittee, like I said earlier, which I was the chairman of that committee. Next slide, please. So why do we need a NEFRA in Nigeria? If we look at all of us in this room, we all have a license from the Medical and Dental Council to allow us to operate as doctors. But there is nobody that defines where we operate. So what is a hospital? What are the standards that define hospitals? Now, Lagos State, I know, as well as Yobe State with their EFEMA and YOFEMA respectively, are working on trying to define these standards. But until we do that nationally, then we have an uneven playing field in terms of what we call a hospital. At the moment, any doctor with a license can rent a flat, a hut, he can build an edifice. It's what he calls a doctor, a hospital. That is what a hospital is. And that does not create that playing field that is level to define standards. So I think it's important that we have a clear definition of a hospital. It's also important to implement the certificate of standards. Certificate of standard is a national requirement. Now, unless there's a national body that defines what it means to have a certificate of standards, then it's very difficult to get implementation on that part as well. There are many other areas, that we need in terms of integration. We have urban concentration of healthcare facilities. We have urban concentration of healthcare facilities, so there's a need for us to look at how we can manage that as well. So, there are a lot of, next slide please. Let me not go into all these details. So, NEFRA was born with the view of trying to look, oh, sorry, we have the important visitor. How are you, sir? So NEFRA was born out of the need to look at our healthcare landscape and say what it is that we're going to do to improve things. So next slide, please. So the committee was inaugurated with very clear terms of reference in terms of what it is we need to do to make sure things work. Next slide, please. Very clear governance structure, and we had very, very seasoned professionals. Please. Right, please. just to summarize the work done, we were inaugurated on the 4th of September, and very seasoned professionals, 24 members in the committee, worked very hard over 6 months to put an organizational structure to look at the terms that we would engage with hospitals. They looked very clearly at the standards for healthcare. We looked at operational guidelines, and we put together a bill which we hope will be considered. And I'm very proud to say, and I'm very happy to see our Honorable Minister of State for Health, Dr. Salako, here with us, because I very happily handed over our work to him last month. We submitted the framework of how we think NEF work, as well as a proposed bill. Now, the important thing that we decided is that since the National Health Act states clearly responsible of health facilities within their state, NEFRA has to work as a consulting body, signing service level agreements with the different states, because we can't go into a state and start to infringe on the rights of the State Ministry of Health. So NEFRA would always work to support the State Ministries of Health in the fulfillment of their own objectives. So the vision really is that working with a national framework and cascading this within the states, we should come up with a national policy that defines our healthcare landscape in a way that allows us to drive our vision of universal health coverage for every Nigerian. Next slide, please. So, next slide. I won't go into all of this. So, the overall message that I want to leave us with is, number one, it is absolutely critical that we all work together and get this national health facility regulation authority working. Second, once this works, we need to obviously work with the states and make sure that we support the states and making this platform achieve the objectives that we've set it out to be. I know that I only have 20 minutes, so I've not gone into the full details. Anybody who wants the details of what we submitted, I'm very happy to share, but I think I would like to leave the floor open to take some questions. Thank you very much.
Thank you very much. A round of applause for our prisoner, please. We appreciate, as you can see, this is a policy issue, something that will transform the healthcare services in this country. That has been discussed. Without doubt, the time at our disposal for this type of discussion, without that, is not adequate, because it's something that requires the contribution of each and every one of us. But be that as it may, we are gradually approaching the opening ceremony of this particular occasion, but we will still have to give room for feedback, because the policy issue, if it's just one or two, we can be able to take this time at our disposal. We'll take it before we proceed to the next agenda in our program. So if we have comments, contribution, or questions, as the case may be, can we identify, please? Okay, so we'll just take two. One.
Private medical practitioners. ANPMP forever.
No.
ANPMP.
We are greater together. We are many, but we are one. From the
Thank you, our erudite presenter, Dr. Richard Ajayi. Yes, for a while, we all heard about this paneling or burden of the national health facilities to me, monitoring and accreditation committee, which to me looks like an extension of our Lagos EFAMA to now a national EFAMA, if I'm not mistaken, sir. Yes, I would, apart from this gathering here, I would suggest that to disseminate information concerning the necessary awareness for this body, you might need to do regional contact. Because if not for this particular session here now, it's not likely that a good number of us will have known about this body. And it is so important to us because apart from you coming to even regulators, we have a lot of things we need from you, sir. Because you are well traveled, you know quite well how even the private practitioners or those in advanced climes, how they are encouraged. Say you have 1,000 patients or 1,000 or 100 bedded or whatever. No motivation as far as we are concerned. That's number one, sir. Number two, sir, I want you to address the issue that government will not be competing with us, but collaborating with us. What we are seeing now is competition, not collaboration. And I know with someone like you there, you have tasted on the right, you have tasted on the left. You know where the shoe pinches. Thank you, sir. It's a comment, not a question. Thank you.
Thank you very much. Now, before you respond, I think we have another contributor. Before that, the information for us, the FAGP and the DMP, I should please go to the back. I think they said you should come for their gown. And they're supposed to put it on because there will be a procession before the opening ceremony proper. So number 2, yes.
Thank you very much. My name is Dr. Babasanya from Ogun State. I have listened to the presentation. Thank you very much. It was a brilliant, but a lot of it are in summaries. So maybe when we get the whole slide, we will see it. But I want to find out, one, with the coming of this NAFRA, how do we juxtapose that with the fact that the federal government has already empowered the alternate medical practitioners board by making a law for them? So they are now empowered to exist. And what that means is that if you have hypertension or diabetes or malaria and you go to that corner and they give you unripe oranges, lime and cashew fruits and you drink it, they are empowered to do so. And they did that without a concordance scientific backing, despite the fact that most of the people that are here and elsewhere were like, we don't have the foundation to allow an alternate practice. We are orthodox medicine based. We still have problems. Well, now you are introducing a new dimension into it now. And Ogun State has gone ahead now to even issue licenses. So in Ogun State now, even as I am now, I don't have to register with the health board to practice. I can register with the alternate medicine board and nobody comes back to supervise you. That's one thing that I hope somebody is going to look at critically. Now that we're talking about overstandard, standardization, quality of care, patient safety, if someone has glaucoma and is not managed with the appropriate drugs and they believe in scarification marks and some whatever, that is one. 2, second question, how are we going to have the health insurance? Hello, sir. How do we get the health insurance people to go into this project? For us as private practitioners, yes, it's a beautiful calling.
And all our dignitaries are already arriving, so they are already seated here. The person that will be in charge of the opening ceremony is presently here, and I would like to hand over the mic to him for due recognition of our dignitaries. Thank you very much.
We are the Association of Nigerian Private Medical Practitioners, ANPMP forever. ANPMP, we are greater together.
We are many, but we are one. From the east down to the west and south and north. We are the gatekeepers of our people's health. We work every day and night.
Your Excellencies, Honorable Minister, Royal Fathers, leaders of thought, eminent Nigerians, medical practitioners, other distinguished guests, ladies and gentlemen, on behalf of the National and Local Organizing Committee, 47th International Conference and the Annual General Meeting of the Association of Private Medical Practitioners of Nigeria, a full member of WONCA, to welcome you all to this hall. Well, let me first of all say welcome you to Ogun State, by extension to Abeokuta, and by far extension to the opening ceremony of this conference. I'm very sure that people from other states of the Federation, other 35 states, or perhaps let me remove the southwestern states, people from the 31 states and the FCT here in Ogun State, you've been enjoying yourself since your arrival. I may need to tell you a few things about Ogun State, but as time goes on, we will be doing that. You need to know that Ogun State is the industrial capital of Nigeria. Ogun State is presently playing host to the highest number of industries, and this includes companies where medical equipments and pharmaceutical products are being made. A lot of them are here with us in Ogun State. Equally, I want to let you know that when we are talking about medical practitioners, most especially in the private sector, the private practice of medicine begins in Ogun State. Let's put our hands together very well for that. Except those people that don't know, but I will tell you today, Sacred Heart Hospital here in Abeokuta is the first recognized medical institution in Nigeria, and it is right here in Abeokuta. And the good news is that it is still thriving. Let's put our hands together very well for that. After that, medical establishment now begin to go to other parts of the country. Equally, Ogun State has enjoyed the highest frequency of high-level ministerial appointment in the Federal Ministry of Health. Is somebody clapping for that as well? Let me take you down the memory lane. Ogun State produces the Minister of Health, Professor Olikoye Ransom Kuti. We are blessed to produce Professor Eyitayo Lambo. Some times ago, Ogun State produces the Honorable Minister of State of Health, Dr. Olorunimbe Mamora. And right now, as we speak, Ogun State has blessed the nation Nigeria with the sitting Minister of State of Health and Social Welfare. And the good news is that he is here with us this morning. Can we please put our hands together very well once again? Dr. Isiaq Kunle Salako, thank you so much for being part of this conference. We are blessed to have you. You know, when I grow up, I want to be like this man. He has contributed very immensely to the development of healthcare services in Ogun State. Having been Commissioner for Health in time past, he was at another time the chairman of the Ogun State Hospitals Management Board, and now Honorable Minister of State of Health. Thank you so much. You're most welcome.
Olúkúnlé ọmọ Zàlà kọ́kù kalẹ̀ níbẹ̀ ọmọ wọn níye wa. Ọ̀kárẹ̀ láyé ọkù àdúró tí ìwà Kúnlé Zàlà kó lóhùn oníjẹ́ kókú máa lójú. Láàmú owó yẹlé ọmọ Ògún rí ẹ̀ta òtòṣì wọn ìyọ́mọ èèyàn. Òtòṣì ṣubú lọ́jà abẹ́rin sí Kúnlé olówó ṣubú ariwo ẹ̀kún àìsà ẹni ìjẹun wá wí.
All our awardees, kindly listen to this announcement. You are expected to go and gown now, because in a moment of time, we're going to see the procession into this arena. All awardees, kindly go forth and gown. And right from there, we will have them in a procession into the hall. Ladies and gentlemen, having recognized the presence of the Honorable Minister of State of Health, we are equally blessed to have here in our midst the presence of the Alake of Egbaland and the paramount of Egbaland is Dr. Michael Adedotun Aremu Gbadebo CFR. Thank you very much, sir. Kabiesi is represented here today by an erudite professor, a practitioner and teacher, a university done in public health. We recognize the presence of the Bamowe of Egbaland, who is representing the Alayelua. I recognize Professor Ajao Adelekon. Let's welcome our elder professor. Thank you very much, sir. We're blessed to have you. In the same vein, the Olowu of Owu Kingdom, yet another erudite professor, Oba Saka Adelola Matemilola. The Oba Matemilola, Oba Owu Kingdom, and the paramount ruler of the ancient kingdom is represented by two amiable chiefs from the kingdom. First is represented by the Baashegun of Owu Kingdom. Professor Maruf Adelekon is here with us this morning representing the Olowu. And also Chief Bola Adeyemi is also here representing the Olowu of Owu.
Bola Adeyemi, Oma Sokogade, Oma Polese Bialari.
Ladies and
gentlemen, Polese Wole Omo Banilia Oma Bewuri Kobi Oje, Beti Malese Sobi Babaye Bati Loboto ni won so game.
Thank you very much. My name is Olugbenga Owolabi, MCG. I will be the main anchor of today's program. And I equally have here with us Ashebami. Thank you so much. I am not going to be the only person holding the microphone up here. There is a brother of mine here. The members of the association I've met him probably yesterday, and he's equally here with us today to do these things together. So I want to bring to the microphone our ace broadcaster, comedian of high repute, another Egba export to Lagos. MC Coded is in the house. Let's put our hands together very well as he will be joining me on the podium here. Thank you very much. He's here.
Dr. Laoye Kukale níbẹ̀ wọ̀n ọ̀ràngúnlé láwọn
All right, we want to hear your voice.
Èmi ọmọ pé bí mo bá sọnù nílẹ̀ yìí, mo lẹ́ni tó lè wá mi ọ̀ràngún ọmọ ògo ìbọlá, ọmọ akógun àkótó ìlàládé wa òkòwòrà dérí. Ọmọ ẹlẹ́mọ̀ gùn níta àpèrè, ọ̀ràngún mọ ògbóyè. Ọmọ ògbìn igun ògbìn láọmọ ògbìn lágbìn igun ìlànṣọ lóko ògùn àmì dùgbẹ̀dùgbẹ̀dùgbẹ̀dùgbẹ̀ lókè àjà. Ogun lẹ́yìn lánàá lérí. Ogun tẹ̀lé ó lẹ́yìn láàmúlájìyàn ká mọ́ògùn wọn mọ́ ládàgbà.
Thank you so much. Ladies and gentlemen, Your Excellencies, very distinguished. I have the honor to introduce and to make welcome my father. He's a man that is well-traveled, a philanthropist, a scholar, a professor of high repute. I'm sure as he's listening to my voice, he knows I'm the one talking. Daddy, you're very much welcome, sir. Ladies, I have the honor to welcome our very great professor, our Professor Abayomi Arigbabu. He is the Commissioner for Education of Ogun State. Please celebrate the words. You're welcome.
Abayomi Arigbabu Kukale níbẹ̀ ọ̀káàbọ̀ ṣe dáadáa lẹ́dẹ́. Ẹ̀kọ́ àtìlẹ́yìn ìwẹ̀ ìfẹ́ àdúpẹ́ gidi sake.
Thank you. To my honorable minister, sir. Honorable Minister, sir, I was greeting you on television 2 weeks ago. You didn't answer me. So I am glad. I'm sure you are going to greet me before you go officially. God bless you, sir. Ladies and gentlemen, he is the official MC. I'm just going to be chipping in so that your smile will come out a little bit. I was so glad. Yesterday, I met so many of you. I am here today. We're seeing tonight again. We did it yesterday. We're doing it today again, tomorrow night, as usual. God bless you. Thank you very much. MC Coded is my name. I'm still very much around.
Thank you very much, MC Coded. Ladies and gentlemen, we do.
Yage ọmọ Káyọ̀dé mi ó Yage. Ọmọ Káyọ̀dé Adéọlá ṣe bí wọ́n ní ń pè wọ́n mọ́ wọn ní kóró Èkìtì sanilé bàbá rẹ̀ ńlẹ́ ọmọ olókè méjì ìtakọ̀tàbò lórí ara wọn ogun kè lábọ́ bá gùn lé ìjọsìn. Ọmọ eégún lọ́kùn ọmọ oró lọ sí.
Thank you very much. Let me recognize the presence of the Akarigo and paramount ruler of Remoland, His Royal Majesty, Dr. Adewale Babatunde Ajayi, a commander of the Federal Republic, is represented by the Ologere of Ogere, Oba James Obafemi Salau. Let's say KBSU. Thank you very much. I want to inform that a former governor of Cross River State is here with us. Our father, he was the most handsome governor when he was reigning, and he's still the most handsome former governor. Welcome His Excellency Donald Duke into our midst. Let's put our hands together very well to welcome him. Thank you very much. Welcome.
Your Excellency, sir, Donald Duke, I'm sure you remember me, sir. MC Coded, I anchored an event where you came for an AIG retirement in Lagos. You remember me, sir? I'm pleased. The money you gave me that time has finished. So, all right, ladies and gentlemen, I have the honor to recognize Dr. Ogunubi, Special Assistant to the Ogun State on Health. Please, a round of applause for him. Thank you very much, sir.
Donald Duke wàláì bó bá lè jẹ́ pé pọ́pùpọ̀bìnrin ni ń bá yá fẹ́ ni. Àbọ̀ lè máa mú mi lọ lé ọ̀bá ẹ̀.
Special Assistant to the Ogun State Governor on Health Matters. Thank you very much.
Jacques. Ọmọ Káyọ̀dé mi ò Zake, Zake olórí ẹgbẹ́ rẹ̀ ò Zake.
Thank you very much. Ladies and gentlemen, right now, can we have some of us? We will be bringing some of our passion to the high table after the procession. Ẹjọ́ ẹ bá wa já kínní yẹn sínú kínní yẹn bó ṣe ń bírèkì yẹn kò ní jẹ́ kẹ́ gbádùn wa dáadáa. Thank you so much. First on the list, ladies and gentlemen, I will bring in the high table the Honorable Minister of State of Health, my father, the one who MC Coded was greeting on TV. He responded, but it could not. Is here with us this morning.
Zake ọmọ Káyọ̀dé mi ò Zake. Adéọlá ọmọ Káyọ̀dé máa rí bá lọ́dọ̀ bàbá rẹ̀. Wọ́n mi nígbó wọ́n mi nígbó mọ́wọ́. Ọmọ nígbó kan àjèjì wọ́ àjèjì tó bá wọ́ pòrò yóò dẹni ẹbọra.
Thank you so much. We will be bringing some of our leaders to the high table. Let me begin by bringing the Honorable Minister of State of Health and Social Welfare to the high table. Please join me as I bring up Dr. Isiaq Kunle Salako to take his seat on the high table. Your hands together for our Honorable Minister of Health.
Kunle ọmọ Salako gbéra lé òdìdé.
Ladies and gentlemen, you call him the king of boys.
Ọmọ owó yẹlé ọmọ òtíyẹ ẹ̀ta òtòsí wọn yọmọ èèyàn òtòsí ṣubú lọ́jà abẹ́rin sí olówó ṣubú àríwé ẹ̀kún àta ẹni ìṣẹ̀wò ọwá wí ìṣẹ̀wò mi ṣe bọ́ọ̀rọ̀ lówó mi adìyẹ òtòsí ní jẹ́ láàrin ìpínlẹ̀ bàbá yìí tó lówó bàbá yìí ní jẹ́ gbangba oko lẹ́ọ̀mọ eré ààrẹ ọmọ Káyọ̀dé ọmọ Sàlàkọ́ kúlékúlé Sàlàkọ́. Eri ààrẹ ni ọ ìdí ọ̀lẹ́ ọ̀pọ̀ṣọ́ àbùwọ̀n tágìrì ṣòwò ọ̀bùn tí ó tètè ṣòwò.
Next up, ladies and gentlemen, I want to bring upstage the Honorable Commissioner for Health in Ogun State, and is here represented by the Special Advisor to the Governor of Ogun State, Prince Dapo Abiodun CON on Health. I welcome Dr. Abdul Latif Tayo Lawal. Let's put our hands together as a will be coming up.
Abdul Latif ọmọ ni ọmọ mú bí ayá máa wọlé mọ̀rọ̀ sí àdúgbò. Wọ́n bá délé bá mi kí dàpọ̀ ọmọ Abíọ́dún. Ìpẹ̀rù àkẹsàn ọmọ balẹ̀ ọjà. Ọmọ ọlọ́jà kan ànádàlẹ́ ọmọ ọlọ́jà kan ànádòrú kẹdẹrẹ lé bàbá tó bí wọn lọ́mọ ìpẹ̀rù àkẹsàn bá alẹ́ ọjà. Kábíyèsí ọba Kárìgbò.
Ladies and gentlemen, next to that, I will be bringing to the high table the Secretary to the Government of the Federation, Distinguished Senator George Akumen, who is represented here today by Dr. Oladipo Ajose. Let's put it together for Dr.
Oladipo Ajose,
representing the SGF.
àjọṣe yìí máa gbẹ́sẹ̀ ní kọ̀ọ̀kan gbogbo yín là kí pátápátá. èmi ti rí bàbá mi kí n tó máa ń lọ Olúkáyọ̀dé Adéọlá olórí ẹgbẹ́ gbogbo káàkiri Nàìjíríà yìí pátápátá.
Gentlemen, in my village, they said only Nigeria. So we'll be bringing someone to the high table now. I hand the microphone over to MC Coded.
Ladies and gentlemen, Your Excellencies, I stand in front of all of you, fiber, nerves, and hormones, to say I am privileged, I am honored, I am delighted to bring the man of the moment, our Presido, a very handsome, intelligent gentleman. And please, with a round of applause, on stage, Association of Nigeria Private Medical MP
Your hands together for our national president.
Nigerian private medical practitioner.
ọmọ Káyọ̀dé Adéọlá máa gbẹ́sẹ̀ ní kọ̀ọ̀kan. Adéọlá máa Káyọ̀dé mi ikú nílé nípa ọlọ́ àwa.
From the east down to the west and south and north, we are the gatekeepers of our
Káyọ̀dé ní president ìgbà wa ní gbogbo wa.
Nigeria may be healthy.
Thank you very much. Ladies and gentlemen, it is now time to bring to the high table our highly revered royal fathers here in Ogun State. Leading the pack, I will be bringing to the high table the Alake and the paramount ruler of Egbaland, His Royal Majesty Oba Dr. Michael Adedotun Aremugbadebo CFR, and he is represented here today by the Biomarkers of Egbaland, erudite Professor Ajao Adelekon. Let's bring him to the high table.
Ajao Adelekon Ademi, ara kemajo, àwa la nígbè wò, àwa la nígbè yóò títí lóde mò.
Thank you very much. Next, I bring to the high table the Akaribo of Remo Kingdom, His Royal Majesty
Kábíyèsí Ọba Akaribo.
Oba Dr. Babatunde Adewale Ajayi CFR is ably represented by the Ologere of Ogere, Oba James of
Akaribo Ọba gbogbo Remo.
Ẹ jẹ́ ká ṣe kábíyèsí o. Thank you so much, Oba James Obafemi Saliu.
Kábíyèsí Ọba James Obafemi máa wọlé ẹsẹ̀ ẹkú àgbótì ìwà.
And I will
Ọba lóde ọmọ onípàkàtà tèmi ni.
The Olowu of Owu Kingdom, Oba Professor Saka Adelola Matemilola.
Ọmọ Matemilola ọ̀lẹ̀ wí.
Represented by the Ba Shegun of Owu Kingdom, Professor Maruf Adelekon. We want to welcome the erudite.
Ọ̀pọ̀ pé èso wulọ̀ ń lọ. Ẹ̀ẹ́dẹ́bí tó burẹ́ wà léwu. Mo mọ iye èèyàn tí a wú náà pè nílé ewu. Ìyá Àdòwú wọ́n wú náà pé wọ́n léwu ni. Bàbá Àdòwú wọ́n wú náà pé wọ́n léwu. Ìdòwú ń kọ́ wọ́n pé wọ́n léwu ni òdòdó ọmọ àgbò orógùn mọ̀.
Ladies and gentlemen, I will also be introducing and probably will be changing his seat. You know, this microphone is very, very powerful. When we were in school, we dare not challenge our lecturers. But as I'm holding the microphone, see the way I'm calling professors to change their seat. So I will now be introducing the Honorable Commissioner for Education, Science and Technology in Ogun State. You know, when a man is very strong, he will be given more than 2 assignments: education, science, and technology, only him. An erudite professor of mathematics, a former vice chancellor of the first university of education in Nigeria, and that is Taishola University of Education, which is just metamorphosing to a federal university. That has to do with the legacies they left behind when he was the VC. And he is the Commissioner for Education in Ogun State as we speak. Please join me as I recognize Professor Abayomi Arigbabu, the Honorable Commissioner for Education.
Please, let's keep clapping as it's coming up. Thank you very much. Ladies and gentlemen, I have the honor and the privilege on stage and on the high table to join us, the most handsome governor back then in Nigeria, presently the most handsome political gladiator, a man that has God in his heart, a giver, and is a philanthropist extraordinary. Ladies and gentlemen, please join me in a round of applause. I want a chubby round of applause. His Excellency, the former Governor of our state, Dr. A round of applause for him as he's coming up. Please, let's keep clapping. Thank you very much. The reason why I'm begging you to really clap for him is because he's going to see me when he's going. So thank you for clapping. God bless you.
Thank you very much, ladies and gentlemen. Encoded said to be the most handsome governor in his time. But as we speak, the governor of Ogun State is the most handsome governor in this era. Epatewo na epatewo.
Dona gbajúmọ̀ ọkùnrin, fine boy, handsome boy. Ó wù mí, ojú bàjákà lónìí wà láì dóná kú ọlọ́mọ oníjókòó wọn lójú. Wàlàyé ẹ má bu ẹ̀kọ́sà ẹ má sọ̀rọ̀ ẹ̀ lẹ́yìn.
I want to recognize the presence of the President, Guild of Medical Directors. Let's put our hands together for Dr. Raymond Kuti, who's also here to be part of this conference. Thank you very much. Thank you so much, sir. The Bridge Clinic founder is also here. We can see that delivered their paper the last time. I recognize Dr. Richardson Ajayi. Let's put our hands together very well for him. The president of KFSPN, Professor Oyibola Ajose, we are glad to have you. Thank you so much. So right now, ladies and gentlemen, we recognize the presence of the special advisor, Governor of Ogun State on health. You know, Ogun State pays very good attention to health matters. That's why we are not having one special advisor, we are not having two, and I want to tell you we are not even having three. So another special advisor is here, Dr. Rotimi Ogungbe, special advisor to the governor on health. Thank you very much. Thank you. Your Excellencies, we do not take your presence for granted whatsoever. With line of time, it is about time we do the procession of awardees. So ladies and gentlemen, it is time for the procession. Thank you.
Dr. Nimo Lada, ọmọ wọn ní Kogi, ọmọ ń fẹ́ àbúrò ọmọ àdádé owó rẹ̀ ọmọ àbúntẹ́yẹ ọmọ rẹ̀ nífẹ̀ẹ́.
We want to appreciate our father and senior colleague, the Akewi. In this time of procession, please kindly hold on with us and let us have the procession as it's supposed to be. Now the procession of the awardees, we're waiting for you. be coming in. Thank you so much.
Immediately
after the procession of the awardees, we have the parade of flags and the opening prayer
the
and the
Association
national
of Nigerian
anthem.
Private Medical
Thank you.
Practitioners. ANPMP forever. ANPMP.
We're getting closer to the middle of the event as the program has commenced. Thank you so much for your time. MMA President, Professor Bala Aldo, proudly represented by Dr. Benjamin Olowo Jabutu. Please, a round of applause for Dr. Benjamin Olowo Jabutu as he's coming up. Thank you very much. All right, to all of us with a tag, you can easily scan your tag on your phone, and of course you get all informations even to the WhatsApp group or Telegram and the rest. So on your tags, you can easily scan the program of events. You can scan it on your phone, even with your tags. Those tags that has the barcodes, you can easily check your tag and scan it with your phone, and you get the programs lined up for the event. Thank you very much, ladies and gentlemen. Dr. Benjamin Olowo Jabutu, please, where are you, sir? It's all. You're welcome, sir. God bless you. Thank you so much. We await the procession of awardees.
We are the largest providers of healthcare. We are available. We are accessible. We are the largest providers of healthcare.
Greatest measure of a nation's wealth is the health of.
Ladies and gentlemen, here comes the procession of the awardees. Thank you.
We are
I want to sincerely use this opportunity to say thank you to all our doctors here present. After God, you people are next. Because what we cannot see, you people are seeing it. We are ordinary people. So we appreciate all the doctors here, all the caregivers, and everybody in medical practicing at the moment. I found out that I must make sure that one of my son or my daughter becomes a doctor. Because the way they separate us in NYSC is a good motivation for me. They will say, oh yeah, doctors, you people that are in medical line, come to this side. The rest, come to this side. So I will not forget the way they separated us. That thing pain me. It pain me. I will never forget. It really pain me. They treat you people specially. It is while I grew up, I knew the reason why you people are treated specially. You know, I would have been a doctor too, but they told me in school to come and do mathematics. I did not know maths. Somebody now say I should come and do further maths. I don't know, I don't know maths. I should come and further it. So me, I entered commercial and art. I don't want.
Ladies and gentlemen, while the procession is coming in, we are expected to be on our feet. Let's please rise to welcome the procession into this hall.
Points of our AGM, the procession being led by the Secretary General, followed by Dr. Sagoya and Ernest Topical, the VP. They are closely followed by the old fellows of the association. After the fellows, we will have the ODMPs. I'll quickly tell you about the history of our awards. The FAGP, which is the first award that we obtained in ANPMP. For you to be a fellow, you must have practiced for at least 15 years as a medical practitioner, of which 10 must be in private practice. So the ladies and gentlemen before you now would have spent at least 15 years post-graduation. I must have been in private practice for 10 solid years, a decade. So we present the FAGPs to you, and they are closely followed by the distinguished medical practitioners, the DMPs, which is the highest award of the Association of Nigeria Private Medical Practitioners. For you to be a DMP holder, you must have been a doctor, a medical practitioner for at least 25 years, a quarter of a century. Of these 25 years of being a medical practitioner, 15 of those years must be in medical practice. And that's not all. You must have distinguished yourself in the field of medicine. You must have distinguished yourself in the area of private medical practice in Nigeria. And so that's why you see that our DLPs are robed in red, to show how important they are. The DMPs are equivalent to the highest honor that you can have in any association or society in Nigeria. We have a couple of DMPs, and so we hold our DMPs very dearly. Aside the ones who are down, we also have some DMPs in the crowd who are not down. The association was founded in 1920. More than 100 years ago, and our awards have been on for more than 50 years. So we present to you our awardees, and following the awardees, we will have the new fellows who are going to be inducted. They have just attained the status of a fellow of the association, and so they will be inducted at this gathering. They are differentiated from other awardees here present because they are not putting on their caps. So that will make you differentiate them. During the course of this program, you get to witness what we do to induct our fellows. After the fellows, we will now have the new fellows. We will now have the past presidents of the association, past secretary generals, and they will be followed by the Miss Pierre, who is the Assistant Secretary General, and then our President will end the procession. Having said this, the FAGPs and the DMPs should take a bow before the crowd and also face the high table and take a bow and exit to your seat to give room for others to come. So please take a bow, FAGPs. Thank you. You can turn around and take a bow before the dignitary. Take a bow. Thank you very much. You may proceed to your seats. The DMPs, ODMPs, you can take the position of the FAGP so you can leave the stage. Move forward a bit, please. The GMPs. Move forward a bit. Thank you. Good. So some of them look so young, but they are not that young. To have practiced medicine for a quarter of a century is no joke. It's no joke, and they have been very in practice for minimum 50 years. Some of them have been in practice for more than 30 years. Yes, thank you, my DMPs. You may take a bow before the audience and face the dignitaries and take another bow. Let's go. Thank you. Now, yeah, we turn around and take a bow, and you may go to your seat. Thank you very much. Please appreciate them. It's not easy to be a DMP holder. Okay. Okay.
Ladies and gentlemen, please give them a round of applause. Thank you so much. It is with great time. It was a great day. The day our present governor of Ogun State, Prince Dr. Dapo Abiodun, appointed our very own SSG Olatokunbo Joseph Talabi. Please, a round of applause for him. He is here. Please celebrate the SSG of Ogun State government. Thank you very much, sir. Daddy, you're very much welcome. God bless you.
Thank you very much. So, move on with the procession. The mace bearer, the mace bearer, please. The new FHGP, come forward, please. Make it snappy. We need to move on. The new FHGPs, they are going to be inducted in a matter of minutes. They are closely followed by the AGM anthem, please. Yes. Make it snappy. Face the crowd, take a bow. Face the audience and take a bow. And following, take a bow, please. Yeah, let's go. 1, 2. Face the dignitaries and take a bow. Face the crowd, the dignitaries.
We are greater together. We are many, but we are one.
You may go to your seat. Thank you.
East down to the west and south.
Following is our immediate past president, Ambassador Ike Odo, the immediate past president of the Association of Nigeria Private Medical Practitioners. And following the past president is our mace bearer, who will be leading the president in. Thank you, Dr. Odo, our immediate past president. Yeah, okay. You may face the high table. Take a bow, and the mace bearer will place the mace on the stand, and Mr. President will take his seat. Thank you. Place the mace. Place the mace. The mace is a symbol of authority in ANPMP. It is specially designed for this association. It bears is our signal, and the president will take a bow and may approach his seat. Mr. President, thank you.
We are available. We are accessible. We are the largest provider.
So following that, ladies and gentlemen, we quickly introduce to you our various branches. ANPMP is a national association with members attending this conference from various states of the Federation. So we're going to parade our flags before you to intimate you of the association, how widespread we are. Parade your flags, please.
We are the association.
We are going to start with Abia State.
ANPMP forever.
Abia State.
ANPMP.
We are greater together.
We are the Association of Nigerian Private Medical Practitioners. ANPMP forever. ANPMP.
Abia State.
We are greater together.
One of our states of ANPMP and is God's own state. To follow Abia State is Adamawa State.
which is the land of beauty. Then we're going to have Akwa Ibom State, the land of fulfillment. Abia State, we are still waiting for your flag. Following Akwa Ibom is Anambra State, the light of the nation. Abia State, we are waiting. God's own state. We're going to do it very fast. In 5 minutes, we are done with this. And we'll go to the next item on our agenda for the day. Abia State, Olu, coordinate this as fast as you can. Okay, we stopped at Anambra State. Then we're going to have Bayelsa State, the glory of the land. Following that, we're going to have Benue State.
We are the Association of Nigerian Private Medical Practitioners. ANPMP forever.
Then Delta will follow the big heart.
We are greater together. We are many, but we are one.
Adamawa State, land of beauty.
Of our people's health, we work every day and night.
Show the item, move on. Show the item, move on.
We are accessible. We are the
land of beauty. Okay, that's the next.
We are available. We are accessible. We are the largest providers of health. Our programs, the river, and bandway.
Land of fulfillment, Akwa Ibom State. Next.
And to the mangrove of the Niger Delta.
Anambra State should be following. Make it snappy. Anambra State, light of the nation. Next, don't wait for me to check the call, just move fast. Bayelsa State, the glory of all the land. Bayelsa, the glory of all the next.
We are accessible. We are the
the food market of the nation.
We are accessible. We are the largest providers of health.
Food basket of the nation. Make it snappy.
Greatest measure of a nation's wealth is
Now
the
be
health
followed
of
by
the people.
Delta State. Come fast.
We are
Cross River.
the Association of Nigerian Private Medical Practitioners. ANPMP forever. ANPMP.
We are together. We are many, but we are one.
The people's paradise.
We are the gatekeepers of our people's health. We work every day and night that Nigeria may be held. We are available.
Delta State, the big heart.
We are the largest providers of health care. We are available. We are accessible.
Followed by Edo.
We are the largest providers of health care.
The heart of the nation. Ekiti should follow.
To our confluence, can retain.
Ekiti State, fountain of knowledge. Members, you're not appreciating your state. Are you not here? You have to allow to know that you are here. Enugu State, the coast city state. The coast city state. FCT, come fast. Our center of unity.
We are available. We are accessible. We We are the largest providers of healthcare needs. We are available.
Please appreciate your state. FCT, I can see you appreciating your state. You can stand up, you can clap. And Imo State is following the Eastern Heartland.
We are the Association of
Imo,
Nigerian Private
appreciate
Medical
your own.
Practitioners. ANPMP forever.
Good.
ANPMP.
Kano State, we have Kano in the house. The Center of Commerce.
From the east up to the
Center of Commerce. Kano State.
We are the gatekeepers of our people.
Kebbi. We have Kebbi. Yes. The land of equity. Kebbi State, the land of equity. Last week followed by Kaduna State. Which is the liberal state. The liberal state, Kaduna State. Katsina, come over. Thank you, Kaduna State, Utah State. Katsina State of Hospitality. Katsina State of Hospitality. Togi, where are you? The conference state.
East and west and north and south.
Conference state. Togi conference state. That's not a good one.
Affordable healthcare is our desire. Equitable
followed by Kwara. Our state of harmony. Yes, Kwara state. State of harmony. And that is followed by the Center of Excellence, Lagos State. We go for show. We go for show. Lagos State, the Center of Excellence. Thank you, Lagos. Thank you, Lagos.
Greatest measure of a nation's wealth is the health of people.
The home of solid minerals, Nasarawa State.
We are the Association of Nigerian Private Medical Practitioners. ANPMP forever.
And now we closely followed by Niger State.
ANPMP.
Thank you, Nasarawa. The Power State. Niger State, the Power State. Thank you, Niger State. Ogun State, our whole state. The Gateway State. The hosting state. The only state that borders Lagos. Somebody said this at Lagos, the government that boundary state. That the only boundary Lagos has is Ogun State and Ocean. Thank you, Ogun State. Ondo State, Sunshine State. Sunshine State. Yes, move. Ondo State. Thank you, Ondo. And we're going to be having the land of virtue. The land of virtue. Osun State, the land of virtue. The land of virtue. Osun State, and that is followed by Oyo State. The Space Center State. The Space Center State. You are welcome to our state.
We are available. We are accessible. We are the
state of peace and tourism.
We are available.
Peace and tourism. I think we have two more states after this.
We are the largest provider
of peace and tourism. And that will be followed by Rivers State. Rivers State.
The Association of Nigerian Private Medical
The treasure base of the nation.
ANPMP
The treasure base of the nation. Rivers State. Rivers State, welcome Rivers. Papa Rivers, you're welcome. Welcome Rivers. And that will be followed by Sokoto State. Sokoto State. Sokoto State, the seat of the caliphate. The seat of the caliphate. Thank you.
And the last but not the least, from Kwara State, family our pride. The state that takes pride in family. Thank you. Ladies and gentlemen, thank you for our parade of flags. Thank you, music. God bless you. Thank you so much. Before we push forward to the national anthem, I want to duly recognize a very high repute district young man. When I say he's a young man, I mean he's a young man. Dr. Oluwole Olujude Kukoyi, the present governor of Rotaract International, District 911, Rotary International. Of course, he is the former chairman of NMA Ogun State, and of course, he has the largest single private medical practice in Ogun State and beyond. Please, a round of applause for him. Thank you very much, sir. You're very much welcome. I have the honor to recognize Dr. Uche Odionyema, President, Association of Medical Laboratory Scientists. Anywhere you are, sir, please, we recognize you. God bless you. Thank you very much. And of course, ladies and gentlemen, to push forward, so, ladies and gentlemen, I want to really recognize my very own Dr. Ogunjimi Lukman, Chairman, Nigeria Medical Association, Ogun State, NMA. Please a round of applause for him. You're very welcome, sir. Thank you. I want to recognize Dr. Oyinlola Felix Odusoya, Nigeria Society of Physiotherapy. Please a round of applause for him. You're very much welcome, sir. Thank you so much.
Thank you very much. I want to recognize the presence of the Chief of Defense Staff, General C.G. Musa, who is ably represented here today by Surgeon Commander Momo Jimo Salihu. Let's put our hands together. Very well. Thank you so much. Permit me to also recognize the Executive Secretary of the Ogun State Health Insurance Agency, Dr. Afolabi Dosumo. He is also in the house. Thank you so much. You are most welcome. Right now, we will start the program officially, and that is by way of rendering the Nigeria National Anthem. We will all rise as we take the national anthem. If DJ is rolling it, please the first stanza alone. And if it's not going to be rolled, we're going to take only the first stanza. Shall we all rise as we take the national anthem?
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians all and proud to serve our sovereign fatherland.
Thank you very much. We also recite the national pledge together. I pledge to Nigeria, my country, to be faithful, loyal, and honest, to serve Nigeria with all my strength, to defend our unity, and uphold our honor and glory. So help me God. So we take the Ogun State Anthem, Isheya Omo Ogun. Isheya. Please, DJ. Thank you very much. We move the physician pledge. All members of the medical profession, open your pamphlet of program to page 3, and then you take the physician pledge. Please, all other professionals here, you can take your seat. Only the medical professionals should stand to take this pledge.
To take the physician's pledge, Dr. Omolola, past president, please, and board of trustees. Thank you very much, sir. You're very much welcome.
Let all the doctors stand up, and our spouses who are not doctors can sit down, and every other person who is not a doctor can sit down. The physician pledge. You repeat after me. I solemnly pledge to dedicate my life to the service of humanity, the health and well-being of my patients should be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit consideration of age, disease, and disability, creed, ethnic origin, gender, nationality, and political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me even after the patient has died. I will practice my profession with conscience and dignity and in accordance with good medical practice. I will foster the honor and noble traditions of the medical profession. I will give to my teachers and colleagues and students the respect and gratitude that is their due. I will share my medical knowledge for the benefit of the patient and the advancement of healthcare. I will attend to my own health, well-being, and abilities in order to provide care of the highest standard. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I make these promises solemnly, freely, and upon my honor. So help me God. Okay. Please, all members of ANPMP should stand. Keep standing for our creed. ANPMP, ANPMP, ANPMP from north, south, you say after me. ANPMP from north, south, east or west, we are the gatekeepers of the people's head. will work every day and night that Nigerians may be healthy. From up above, the river Niger and Benue to our confluence heritage, to the mangroves of the Niger Delta, we are bound. We are with Nigerians everywhere they are found in the land. We are available, accessible. We are the largest providers of the healthcare needs of Nigeria. We are the private doctors, generalists, and specialists. A healthy Nigeria is our goal. Affordable healthcare is our desire. Universal health coverage is our vision. In love and care, we serve. In unity and faith, we prevail. In hope and determination, we triumph. We are greater together. We are, yes, we are, but God is. God bless Nigeria, God bless Nigerians, and God bless ANPMP.
Thank you very much. We can have our seats like kings and queens that we are. Thank you. Thank you so much, sir. We push forward in this wonderful event.
Thank you very much, and once again, you're welcome to this conference. While we're having a parading of flags the other time, we are having stepping into this hall the #1 citizen in the Gateway State, the Chief Security Officer of the most industrialized state among the Committee of State in Nigeria, the most handsome governor among the sitting ones. You are laughing instead of you to clap. The governor of Ogun State, His Excellency Prince Dapo Abiodun CON, is ably represented here this morning by the 50-cylinder engine that powers the operation of the Gateway State. You know, the SSG is the operation room of the government. So the SSG is here this morning to represent the governor. Please put your hands together as I recognize Mr. Olatokunbo Joseph Talabi, the SSG of Ogun State, representing the governor. Thank you very much. Sir, when you were coming in, MC Kudet said, Ore mommy mini. But I now begin to wonder, why are you not Ore daddy me? Why are you Ore mommy me? You will tell me later. Thank you very much, sir. I equally want to recognize the presence of the Director General of NIGRAT, Professor Othman Malano. Is represented by Mr. Arusegi Sharafuddin. Let's put our hands together to welcome him. Thank you very much, sir.
The question you asked, I'm going to help the SSG, sir. My mom is actually a political gladiator. She is a woman leader in Ogun State, very, very active in politics. So my dad is just an accountant. So that is why he is a friend to my mom. I hope I have answered your question. All right. So, ladies and gentlemen, we push forward. I need to do this quickly to recognize our very own Dr. Sunday Malomo, consultant, family physician, and national secretary of West African College of Physicians, Nigerian chapter, representing the president of SOFPON, Society of Family Physicians of Nigeria. I think you should clap. Thank you. To buttress more on the question he asked, I am when I say I'm delighted, I'm privileged to be standing here. He is my oga on the microphone, but I started like 10 years ago to hold the microphone. That's why my great Professor Aribabu is proud to see me where I am standing, because when he was my vice chancellor, I was in 100 level, and he see me grow from my childhood up to this level. So if you can see me here, he's proud to see me. Even the SSG is proud to see me. All of them knew when I was growing up. So I am glad I am standing in front of them today. Thank you very much. Okay, I need to recognize Surgeon Commodore MJ.
Thank you very much. Now coded is before is VC and a friend of your mom, but yet I will still report him. When he came in, they said, "Are you a doctor?" Only no, me a doctor, me teach a PhD. But when they are doing the pledge, they said only medical professionals should be standing. Why are you standing? Right now, ladies and gentlemen, we move on in the program, and that's by way of receiving the welcome address. Everything we have been doing is informal, so this is formal welcome address. So we're going to have it in two stages. The first one will be coming from the chairman local organizing committee of this conference. I welcome Farayibi to please step up podium and deliver the welcome address. A round of applause for the chairman LOC. Thank you.
LOC Chairman's welcome address. It's on page 35 on our brochure. Distinguished ladies and gentlemen, all existing protocol duly observed. It gives me great pleasure to welcome you to the 47th International Conference of the Association of Private Medical Practitioners of Nigeria, ANPMP, holding in the ancient city of Abeokuta. The last time the Ogun State branch hosted the conference in this same city was in 2007. Our chairman of today's occasion, we're still expecting him, was the then executive governor of the state, and his contribution to the success of the conference was immeasurable. In a similar vein, we have enjoyed immense support from the present government in Ogun State, led by His Excellency Prince Dapo Abiodun. Today marks the hallmark of preparations that commenced in December 2023. I want to welcome all our distinguished guests and our members from all over the country. The LOC has worked hard and made sacrifices to package this event for you. It is filled with educational activities, entertainment, opportunities to network and see the city of Abeokuta. Therefore, relax and enjoy the next few days with us, and don't be in a hurry to go back to the four walls of the consulting room. Our spouses, led by Mrs. Olushola Kukoyi, has packaged a fun-filled program for their members. Finally, I want to thank members of the LOC and the entire membership of ANPMP Ogun State for putting this together. Thank you very much.
Ilé ń kọ́ sílé ń bẹ lálàáfíà ara fara ibi ọmọ olóríire ọkúnlékúnlé ọmọ oníjẹ́ kọ́ parẹ́ máyé lójú. Fara ibi dúró náà bó ní sórí kì í bàbá rẹ̀. Ọ̀rí ìjọba bẹni ọmọ ilẹ̀ òbí bẹ́ẹ̀ ní pọ̀lá ọmọ àkókò ìlẹ̀ lórí ẹlẹ́fà.
Thank you, sir. Ladies and gentlemen, Your Excellencies, very distinguished guests, I have the honor to recognize the presence of MDCAN, Medical and Dental Consultants Association of Nigeria, Professor Muhammad A. Muhammad, President, all the way from Kano. Please a round of applause for him. He is a gentleman.
Professor Muhammad Kabo.
Thank you, music. I know I met him yesterday.
Sunday, sure.
Even for the fact that he's from the north, I was able to crack jokes and he was able to laugh yesterday. You're welcome, sir.
Muhammad Wali.
Nice to see you again.
ọmọ akẹgbẹrú ọmọ àgbàgbà àgbòrè ọmọ ajífi kálámù dáwọn lẹ́ẹ̀kan.
Surgeon Commodore MJ Salihu, Director Medical Service Defense Headquarters, representing our very own Chief of Defense Staff. Daddy, please, you need to come upstairs. Please, a round of applause. Please let him come up. Let him, a round of applause, please. I'm asked to bring you up, sir. I'm asked to bring you up. Thank you, sir. Thank you. Thank you. Thank you very much. Please, yes, thank you.
Thank you very much. We're moving on to the second leg of the welcome address. And this will be delivered by the state chairman. But before then, let me tell you that Ogun State is a land of opportunities. It is the emerging economy of the Federal Republic of Nigeria. The name Gateway is not just being given, it is by divine providence. Lagos is the center of excellence, and you cannot connect Lagos from any part of the country without passing through Ogun State, either by air, by land, or by sea. You must necessarily go through Ogun State. And Ogun State is equally the open door to the West Africa sub-region by our boundary with the Republic of Benin. And you cannot overemphasize the contribution of Ogun State to the socio-political emergence of Nigeria, having produced one president 2 times, talking about General Olusegun Obasanjo and Chief Olusegun Obasanjo, the only interim national government in Nigeria is headed by our Ogun State-born late Chief Ernest Shonekan. The first professor of medicine in Nigeria, Professor Ogunlesi, is an Ogun State-born. I can go mentioning like that, and I will still mention before you leave this place. Well, if you are clapping, you can do better than that. And on that note, I will be inviting the state chairman of this association, Dr. Oluwakayode Oyelade, to also come up, take this microphone and deliver his own welcome address. Let's put our hands together very well for the chairman.
Welcome address of the chairman, ANPMP Ogun State, is on page 36, and I'm standing on all existing protocol. Distinguished guests, eminent colleagues, ladies and gentlemen, it is with great pleasure and a deep sense of responsibility that I welcome you all to the 47th Annual International Scientific Conference and Annual General Meeting of the Association of Nigerian Private Medical Practitioners, ANPMP, that is taking place here in the city of Abeokuta, Ogun State. This gathering marks yet another milestone in our collective efforts to advance medical practice, foster professional excellence, and address the evolving challenges in private healthcare delivery. We are honored to have amongst us distinguished medical and non-medical professionals, researchers, policymakers, and industry stakeholders whose insights will undoubtedly enrich our deliberation. The theme of this year's conference, Nigerian Healthcare System, Unlocking the Value Chain, the role of government and private medical practitioners, is timely and relevant as it reflects our commitment to improving healthcare delivery, embracing innovations, and advocating for policies that support private medical practice in Nigeria. Through this conference, we aim to exchange ideas, share best practices, and explore scientific advancement that will not only enhance our profession, but also improve patient care outcomes. I extend my heartfelt appreciation to our esteemed speakers, panelists, and all participants who have taken the time to be here today. Your presence underscores the importance of collaboration in achieving sustainable healthcare solutions. I also want to commend the organizing committee for their dedication in ensuring the success of this event. Their hard work has made it possible for us to convene under such an intellectually stimulating and professional atmosphere. I also want to salute distinguished members of Ogun State ANPMP for their selfless contribution, financial, physical, spiritual, even for this conference. As we engage in discussions, presentations, and networking, I encourage everyone to contribute actively and make the most of this opportunity to learn, share, and strengthen our professional bonds. Once again, welcome to the 47th Annual International Scientific Conference and AGM. May this event be fruitful and inspiring for all of us. Thank you, and God bless you all.
Ọmọ Oyèládé ipò onílé gbà wọ́lọ́ mi ò di ara rẹ̀ sà.
Thank you very much.
Abẹ́lẹ̀ pupa ara náà àbọ̀mọ̀ ọmọ ìlú rẹ̀ dẹ́ ojú omi mọ́pọ̀ rẹ̀ jẹ́ tí mo bọ́ lọ́rùn kó visa.
Thank you, sir. I sincerely don't like the way we are rendering our round of applause when any speaker leaves. Please, a round of applause for him one more time. Thank you very much. Very distinguished guests, ladies and gentlemen, still standing on the existing protocol, it is time for us to bring to the microphone our main host, even though Ogun State is the host of all the states. So we need to welcome everybody from the south, from the north, from the east, from the west, everywhere, all over Nigeria. You're very much welcome. Please, with all gratitude to our Lord Jesus Christ, creator of heaven and earth, I am glad, with joy in my heart, to bring to the microphone the President, ANPMP, for his welcome speech, Dr. K.A. Adeshola. Please, let's keep clapping till he gets to the microphone. Let's keep clapping, please. Another gentleman that I know.
Adeshola Kurugale níbẹ̀.
ANPMP forever. My people, let's proudly interact the way we normally do. ANPMP. That's better. Forever. Forever we are greater together. Your Excellencies, distinguished guests, esteemed colleagues, ladies and gentlemen, it is with great honor and privilege that I stand before you today at the 47th International Scientific Conference and the annual general meeting of the Association of Nigerian Private Medical Practitioners, ANPMP. I extend my deepest gratitude to His Excellency, the Prince Dapo Abiodun, the Executive Governor of Ogun State, who is ably represented here today by the one and only Secretary to the State Government, who has been described as a man firing with 50 cylinders. Mr. Tokumbo Talabi, welcome, sir, and thank you for representing the Executive Governor. We also want to greet the Senator Otumba Engineer Gbenga Daniel, the former governor of Ogun State and the Senator of the Federal Republic of Nigeria, who is the chairman of this occasion today. He's been hanged up somewhere in Lagos, but he's been sending messages upon messages that he's going to come in any moment from now. So we are expecting him. That's why the seat is there, and he will soon be here with us. The former governor of Cross River State, His Excellency Dr. Donald Duke, and then to our esteemed keynote speaker, the Honorable Minister of State for Health, and my very good brother and friend, Dr. Isiaq Kunle Salako, and others distinguished guests, including Dr. Kelechi Oire, the DG and the CEO of the National Health Insurance Authority, who is still on his way with his team. And they've called this morning that they have arrived in Lagos. I'm sure they'll be joining us during this program. Dr. Tomi Koka sent in apology. We recognize the fact that she associates with us. That's the Honorable Commissioner for Health in Ogun State. She's somewhere in Turkey as we are talking now, left the country yesterday to represent the country. And other dignitaries, I extend my sincere appreciation To all our royal fathers of the day, His Royal Majesty Babatunde Adewale Ajayi, CFR, Akarigbo, and the Paramount Ruler of Remo Land, and His Royal Majesty, our father Oba Akarigbo is here represented today by the Ologere of Ogere, Oba James Obafemi Saliu. Please, a round of applause for Oba Saliu. We also want to appreciate His Royal Majesty Oba Professor Saka Adelola Adisa Matemilola, PhD, a seasoned mathematician who hosted us very well yesterday at his palace. Is today here represented by Professor Ajao Adelekon, the Biomarkers of Egbaland. Please a round of applause for. And then we have also in our midst Professor Moruf Adelekon Baashegun of Owul, Chief Bola Adeyemi. Both of them are here with us. The Jagun Owu and Baashegun of Owu. You're welcome, sirs. Please a round of applause for our royal fathers. Our board of trustee members here present, Dr. Anthony A. Omolola. I saw him earlier. I'm sure he's somewhere. He's ever actively participating in our activities. And of course, another board of trustee members seated there is our own AE of Abia, who has been promoted to be AE of Africa. Dr. Kingsley Enwermado is also a former first vice president of the Nigerian Medical Association. Please a round of applause for him. We also want to represent our past presidents present in the presence of, I can see my IPP. I've recognized the Dr. Anthony Omolola, my IPP ambassador, Dr. Ike Odo, seated on that side. Please a round of applause for IPP Odo. All our patrons present, you are well recognized. DMPs, FAGP award holders, distinguished colleagues, our corporate partners, gentlemen of the press, ladies and gentlemen, I welcome you all. Let me especially appreciate the president of the Spousal Support Group, my darling wife and the first lady of this great association, Mrs. Olubukola Adeshola, and all our beautiful spouses who have continued to be pillars behind us. Your pet project of great benevolence to orphanage homes at every state where we hold our conferences remains a unique initiative and is well appreciated. God Almighty rewards you all. I'm talking about the spouses program now. Every state we go, they visit the orphanage and donate materials, freezers, television, and they adopt some of them and sponsor their education. A round of applause for our spouses. Ogun State, our host, is not just the second most industrialized state in Nigeria after Lagos. It is a land of rich cultural heritage and immense contribution to national development. It is the home of the renowned father rice and also produces in high quantities other things such as cocoa, palms, kola nuts, cotton, etc. Ogun State is also home to large deposits of limestone, phosphates, chalk, and clay. No wonder we have the Lafarge, the Dangotes, and all the rest of them struggling to have spaces in Ogun State. The state is populated by many groups, leading among which are the Egba, Yewa, Remo, Awori, and Egun people. Abeokuta, its capital, is famous for the historic Olumo Rock, a fortress that played a very pivotal shielding role during the 19th century intertribal wars. This great state has produced numerous luminaries across various fields, including statesmen like Chief Obafemi Awolowo, Nobel laureate Professor Wole Soyinka, business magnates such as Mike Adenuga, and legendary figures like Chief M.K. Abiola, late, former President Olusegun Obasanjo, of course, former President interim government Ernest Shonekan, and the indefatigable Ransom Kuti family. The contributions of Ogun State, of their sons and daughters in medicine, business, entertainment, governance continue to shape Nigeria's progress. The theme of this conference, unlocking the value chain in the Nigerian health system. The theme of this year's conference, the Nigerian healthcare system, unlocking the value chain, the roles of the government and private medical practitioners, is both timely and crucial. It highlights the need for a well-defined synergy between the government at all levels and private medical practitioners. A collaborative approach will enhance the efficiency of our healthcare system and expedite Nigeria's attainment of the universal health coverage. Private medical practitioners remain the chief custodians of the healthcare for the Nigerian people. Our commitment to service is unwavering, and we stand as the closest healthcare providers to the people, ensuring that medical services are always within reach. Unlike others, we do not engage in strike actions, yet we are often overlooked and underserved in several ways. Some of our key challenges will include funding for emergency services in the health space in Nigeria. Despite the National Emergency Medical Services and Ambulance Sector fund being established since 2018 under the Basic Health Care Provision Fund, private practitioners remain unpaid for emergency treatments rendered. We demand that these long overdue payments be promptly disbursed to genuinely show fairness to the Nigerian private practitioners who have continued to deliver emergency health care to the citizens. Electricity tariff reduction. Private hospitals and clinics have long appealed to the federal government for a rebate on electricity tariff, as energy costs constitute over 40% of our overhead expenses. This relief will make healthcare more affordable and align with the government's Renew Hope agenda and commitment to easing the financial burden on citizens. We express our gratitude to the Director General and the Chief Executive Officer of the National Health Insurance Authority, Dr. Kelechi Oyiri, and his team for the recent improvement on the tariff. We believe the health insurance scheme remains the shortest route to our attaining the universal health coverage we all desire, but this will only be possible when stakeholders are equitably and appropriately treated. We urge the relevant authorities to prioritize these issues, ensuring that private medical practitioners are adequately supported in delivering quality health care to Nigerians. Being the largest providers of health care through our spread and reach, we make available the invaluable platform for reaching the people. A conference of science and leisure. Distinguished colleagues, this year's conference is designed to blend scientific knowledge with moments of relaxation. As we engage in insightful discussions and deliberate on transformative policies, let us also take time to network, unwind, and celebrate the progress we have made. As we embark on this journey, we redefine the Nigerian healthcare landscape. Let us work together to unlock the value chain in the Nigerian healthcare system and create a brighter future for all Nigerians. I wish to appreciate the Ogun State Chairman, Dr. Kayode Oyelade, and his state officers, the local organizing committee chairman, Dr. Kunle Faraibi, and his numerous lieutenants, as well as other members, for all the moral, spiritual, and financial support given the hosting of this conference. I must make it clear, let us know that Ogun State members have actually committed so much towards the successful hosting of this. Personal donations alone among our members in Ogun State has crossed 30 million naira as of last night. 30 million naira coming from the coffers of individual doctors, private doctors in Ogun State. It's been a very, very well dedicated to organization, and we really appreciate this. As we move forward, I want to quickly recognize once more the representative of the Chief of Defense Staff, because about a week ago, he reached out to me and said he had some national assignment that will prevent him from coming. So please, we welcome, please, a round of applause for the representative of the Chief of Defense Staff. Appreciate you. Let him know we do that. Thank you very much, and God bless us all. Long live ANPMP, long live Ogun State, long live Nigeria. Thank you all.
Please, that round of applause is way too low, please, for our Presido. Thank you so much. Thank you. To the absolute men of worth, women of value, I have the honor to bring up and recognize specially our very own, one of the most handsome commissioners that I know, ladies and gentlemen, Dr. Babatunde Ikpaye, Commissioner, former Commissioner of Health, Ogun State. Please, let him come up. Please, a round of applause for him as he's coming up. Thank you too much. Thank you. Thank you.
Thank you very much. We want to appreciate the President for that welcome address. He admonishes us that we should enjoy ourselves and explore Ogun State. Dr. Babatunde Ikpaye, former Commissioner for Health, thank you so much, sir. Obasanjo Presidential Library is one of the places where you can chill and enjoy yourself. But I know many of you have heard about Bobrisky. Anyway, next time you are visiting Ogun State, you will have put him in a museum. You will be able to see him as well. He is born in Ogun but trained in Lagos. Because Unilag is his alma mater, so I don't know what you inject in him that make him to be like that. Ogun State is actually not represented like that. How many of you know Portable? Portable is also from Ogun State. So if you want to see people like that too, we can take you there. Thank you very much. Ladies and gentlemen, let me also tell you one thing about Ogun State. When I say Ogun State is a land of opportunity, there are two states in Nigeria that can survive without the federal government allocation. The first is Lagos and the second is Ogun State. Have you heard about that before? So come here. We have the people, we have the opportunity, you have the patronage, and you should pay your tax as you operate. Thank you very much.
Ìpàyẹ́ Babátúndé Ìjẹ̀bú ọmọ èrè nìwà. Ọmọ àfíjú Ìjẹ̀bú ti fọkọ rẹ̀ ìjà pé náà. Bó bá wù Ìjẹ̀bú àwọn ní ẹni wìnì, bó wù Ìjẹ̀bú àwọn ní ẹni wìnì. Bó bá wù Ìjẹ̀bú afẹ́ni rẹ̀ yòókù sọ̀dọ̀ àgẹ̀mọ̀ bàbá yé lọ́mọ alágẹ̀mọ̀ àbí ìjó wìnì. Ìpàyẹ́ Babátúndé. Ọmọ Sàlàkọ́ kí ló dé? Àbí mo ṣe ọjọ́ yẹn ni rán mi sí mi. Èmi ó mọ̀ kọrin ìwọ́ wọn yẹ ránṣẹ́ sí mi. Adékúnlé ọmọ Sàlàkọ́. Ọmọ wọn díye wa owó yẹn lẹ́sẹ̀ bí wọ́n ní ń pè ń bó bá wù mí máa tún ní ògùn mọ̀kúmọ̀ tọ̀run ògbórí tún ní ọ́ màlédì igbó ní ọmọ bàbá tẹ̀bí tààrẹ ògùn ọmọ àríndéwò òkú lọ́yọ̀ lẹ́jọ́ bàbá wọn kú sóko dápọn òkú sọ́nà orí òkú dọ̀rọ̀ síbalẹ̀ lọ́rùn Bọ́délé. Bank President Àkànbí ń kọ́sẹ̀ ń bẹ lálàáfíà ara mọ́ Tinubu Àkànbí bá mi.
Thank you very much.
Sàlàkọ́.
We are moving on to the session of goodwill messages, and we are going to have just 4 in that category. We are going to start from the Chief of Defense Staff. The Chief of Defense Staff is represented by Surgeon Commander MJ Salihu. He will be leading the pack in the order of the goodwill messages. MC Kudet said you should help us clap. Help us clap, please. Thank you very much.
Fine boy. Handsome boy. Handsome boy.
Your Excellency, the Governor of Ogun State, ably represented by the Secretary to the State Government, the Minister of State for Health and Social Welfare, who is also the keynote speaker on this event, Royal Majesties present, distinguished invited guests. I am Surgeon Commodore M.J. Salihu, the Director of Medical Services, Defense Headquarters, representing the Chief of Defense Staff, General Christopher Gwabin Musa, Officer of the Order of the Federal Republic. I am a consultant psychiatrist and a fellow of the West African College of Physicians. Please note that as I read the speech of the Chief of Defense Staff, I shall use the pronoun I, which refers to the Chief of Defense Staff, whom I'm representing. It is with great pleasure that I extend my warm greetings to you all on behalf of the Armed Forces of Nigeria on the occasion of the 47th Annual General Meeting and International Scientific Conference of the Associations of Nigerian Private Medical Practitioners. First and foremost, I would like to congratulate the Association of Nigerian Private Medical Practitioners on the achievement of this year's milestone. The theme of this year's conference, the Nigerian Healthcare System, Unlocking the Value Chain, the Role of the Government, and the Association of Nigerian Private Medical Practitioners, highlights the importance of the individual and collective responsibilities of the public and private sectors in bolstering Nigerian healthcare system. The Nigerian military healthcare system does not function in isolation from the society. As an arm of the public sector of Nigerian healthcare, many medical formations of the Armed Forces of Nigeria interact with private medical practitioners to save lives of troops and their family who suffer one medical condition or another. It is in view of these continuous collaborations over the years between the medical corps in the Nigerian Armed Forces the Armed Forces of Nigeria and private medical practitioners that has been considered important that I lend my voice on topical issues at this forum on behalf of the members of the Armed Forces of Nigeria. The theme of this conference is considered very apt in the face of current challenges that are plaguing the Nigerian healthcare system, especially the problem of brain drains. There is a need to unlock the immense potential inherent in the current structure of our health system and make adjustment whenever there is need. The Armed Forces of Nigeria is primarily tasked with protecting the territorial integrity of the country, either by land, sea, or air. And the various platforms of these Armed Forces of Nigeria are manned by gallant officers and men of different cadre and specialization to achieve the set objective of national security. These officers and men are subjected to daily
high pressure demands of the military job in addition to demand of everyday life. One of the most important factors that affect the psyche and performance of a military personnel at his duty post is the welfare of his family. And that is why troops welfare is one of the 3 critical components of my leadership concepts. The remaining 2 being people-centric approach and deepening jointness and interagency collaboration. A soldier is strongly motivated in the job if he is rest assured that his family's welfare needs, especially health care, is adequately taken care of. As you know, some families of personnel do not stay in barracks or close to military health formations. Thus, there's the challenge of assessing proper health care by these family members who stay far away from military health institutions and government hospitals whenever the need for emergency care arises. To bridge this gap in healthcare delivery to personnel and their family who find themselves in this peculiar situation, members of the associations of Nigerian private medical practitioners are hereby implored to obtain accreditation from the National Health Insurance Authority and to ensure that accesses are granted via the health maintenance organizations, which is the Defense Health Maintenance Organizations. This will greatly boost access to healthcare by personnel and their families wherever they may find themselves. By obtaining this accreditation, the ANPMP would have played a satisfactory role well in unlocking the value chain in the Nigerian healthcare system as it concerns access by military personnel and their family. A proper feedback mechanism is an important step in the value chain process of any system. As of today, the healthcare system in Nigeria is structured along 3 tiers, namely primary, secondary, and tertiary levels of healthcare. The Association of Nigerian Private Medical Practitioners is largely represented in the first 2 tiers of our healthcare system. These are the most important levels in public health, and they are at these levels where the impact is made in the life of majority of Nigerians. However, it has been observed that referral cycles within the 3 tiers of healthcare is usually incomplete. Referral centers, mostly secondary and tertiary hospitals, do not give feedback on patients referred from lower level hospitals, mostly primary healthcare centers. This incomplete referral chain does not afford the lower centers the opportunity to learn and receive feedback on the patient referred. Furthermore, it makes follow-up on patients quite cumbersome. Majority of the health formations in the Armed Forces of Nigeria, which fall within the primary healthcare level, refer patients to higher level of government and private facilities for care without adequate feedback. To address this unsatisfactory practice, members of the Association of Nigerian Private and Medical Practitioners are urged to ensure that referral cycles are complete, regardless of whether the facility is a government or private one. Entrenching this standard practice will enable us as medical practitioners to learn much more, follow up on patients better, and ultimately unlock the value chain regarding feedback mechanism in Nigerian health system. The current problem of brain drain in Nigerian healthcare system is one that seems to be worsening day by day. The Armed Forces of Nigeria, being a microcosm of the larger Nigerian society, is not spared of the negative effects of the prevalent japa syndrome amongst its medical personnel. The exodus of medical practitioners seeking greener pastures abroad is one of the greatest impediments to unlocking the value chain in the Nigerian healthcare system. While the government is playing its role in addressing this challenge, the Association of Nigerian Private Medical Practitioners could also look inward and contribute its quota to solving the problem. The ANPMP could look into a standardized upward review of the remunerations package for its employees, especially junior doctors, Better pay could translate into better quality of life, which could enhance retainment of practitioners within health system. Secondly, the association could also make concerted effort to upgrade some of its biggest and most influential member hospitals to training centers for certain specialties. This could be done in collaboration with well-established government teaching hospitals like a public-private partnership. Such collaboration will guarantee more training slots for young doctors and could reduce the need to leave country for training. Thirdly, the ANPMP could look into a review of the standard working hours of Nigerian doctors. The current length of working hours and conditions found in Nigerian hospitals, both public and private, does not augur well for the patients and health system. This review could be done in collaboration with other medical bodies such as Medical and Dental Council of Nigeria, the Medical and Dental Consultant Association of Nigeria, and the Nigerian Association of Resident Doctors to ensure a holistic and generally acceptable outcome. The association's role in improving practitioners' welfare across board cannot be overemphasized. This is extremely key to unlocking the value chain in the Nigerian healthcare system. On that note, I implore everyone present at this ceremony to approach the deliberations with firm mindsets to bring in the theme of the conference to reality in our society. It is noteworthy to state that an institution like the Association of Nigerian Private Medical Practitioners should not work in isolation, but carry other healthcare professionals' bodies along in their effort in unlocking the value chain in the Nigerian healthcare system. Once again, please accept my heartfelt felicitations to the Association of Nigerian Private Medical Practitioners on this momentous occasion, and I look forward to life-changing resolutions. Thank you, and God bless you. Ladies and gentlemen, please, one more time, let us celebrate our sojourn with a round of applause. A beautiful speech, well delivered. Sojourn Commodore MJ Saliu, Director of Medical Service Defense Headquarters, representing. The President and the Sojourn has implied us that we should extend our enrollment to the military HMO. Thank you so much. All right, ladies and gentlemen, at this time, at this moment, at this hour, it is with joy that we're about to welcome our very own NMA President. Ladies and gentlemen, Professor Bala Audu, ably represented by our very own Muhammad all the way from Kano. Please, a round of applause for him. As please, let's keep clapping for him as he's coming forward. Thank you. Thank you very much, sir. My name is Dr. Benjamin Oluwatosinlo Jebutu. I'm the first Vice President of NMA, and ANPMP is my primary focus. Thank you. I will just stand on the existing protocols and say thank you, distinguished guests, for coming today. I bring greetings from Professor Bala Audu, the NMA President. It is with great respect and admiration that I extend this goodwill message to you today. Our nation healers, innovators, and frontline defenders of life, as we gather today to explore a very powerful theme today, vision for the future, the Nigerian healthcare system, unlocking a value chain, the role of government and the Nigerian private medical practitioner, we are reminded of the collective responsibility we share in shaping a healthier and a stronger Nigerian healthcare space. It is a necessity. As medical professionals, you witness firsthand the gaps, the pressure, and the potentials that is within our healthcare system. But today, we are not just discussing challenges, we are casting a bold vision for the future, one driven by creativity, sound policy, and strategic collaboration. Innovation is the heartbeat of modern medicine. From remote diagnostics and digital record keeping to artificial intelligence and mobile health intervention, the possibilities are endless. These tools can extend your reach, enhance decision making, and improve patient outcome. If we create this enabling environment for them to thrive, a strong, a very clear and responsive policy framework is the backbone of any sustainable healthcare reform in our country. We must advocate for policies that prioritize healthcare financing and healthcare funding, reward research and innovation, and remove bottlenecks in service delivery. We need legislation that supports telemedicine, expands health insurance coverage, and ensures equitable access across all regions of our nation. Most importantly, the future of healthcare rests on partnership. No single entity, government, private sector, academia, professional bodies can do it alone. We must work together to build bridges between sectors and discipline, thereby fostering innovation and implementation. As doctors and practitioners today, your voice is critical in these collaborations. You bring the insight, we bring the experience and compassion that turn ideas into impact. Let this gathering of ANPMP at this time, let this gathering bring innovation, bring commitment to innovate, responsible advocate for progressive policy, and partner purposefully. Together, we can transform not only our system, but the very lives of the people we serve. Thank you for your relentless service for our nation, and may this vision become our shared reality. God bless you, and God bless the Federal Republic of Nigeria. Thank you.
Donald Duke sent somebody to me.
Thank you very much. A better round of applause.
Donald Duke.
To the NMA president represented. Thank you very much. Ladies and gentlemen, for the exigency of duty, the governor of the Gateway State will be delivering his speech now and at the same time be declaring the conference open. And you will recall that the governor of Ogun State, His Excellency Prince Dr. Abiodun CON, is ably represented here today by the engine room of the activities of the government of Ogun State. On that note, I'd like you to join me as I welcome to the microphone the Secretary to the State Government, Mr. Olatokunbo Joseph Talabi, the SSD of Ogun State, the governor of Ogun State.
You are clapping
for the governor, not for the SSG. Even the SGF as represented is on his feet and we are still sitting down. Let's put our hands together for the governor of Ogun State.
Okay, sir. Please, let's be seated. First, I'd like to just welcome all of you to this gathering. But while doing that, I'd like to take into cognizance some of those who have left everything to be with us today. Because no matter how you look at it, we are the ones hosting you. As the company had said, His Excellency is otherwise engaged, actually outside of the state, and he had made it mandatory for me to be here. And so Let me also appreciate the Secretary to the Government of the Federation, as ably represented by Dr. Oladipo Ajose, the Honorable Minister of State for Health, my brother and friend, Dr. Kunle Salako, who also happens to be the keynote speaker for today. The National President of the NMA, Professor Bala Audu, was presented. The President of the Association of Nigerian Private Medical Practitioners, ANPMP, Dr. K. Adeshola, my big brother and friend, the former governor of Cross River State, Dr. Donald Duke. You are very well appreciated. Unfortunately, Dr. Duke decided not to understand English during this session. So he only understands his native language, because the gentleman that has been talking spoke in Yoruba. After some time, he moved to English, and I was watching the countenance of Dr. Duke. He didn't show any understanding of the whatever, but now that I have your attention, so he was hailing you and says that what you carry. The Special Advisor on Health, Dr. Tayo Lawal, and the Commissioner for Education and Science and Technology, Professor Biomarkers Arigwabo, the State Chairman of both NMA and ANPMP, all our guest speakers, facilitators from various segments of the conference, the past presidents, and former National Executive Council members of ANPMP, both at the national and at the state level, national and local organizing committee members, partners, investors, exhibitors, medical professionals from all states, and professionals from sister and allied fields of human endeavor, and other distinguished personalities here present. I also cannot but also recognize the traditional rulers amongst us, and I'm going to use the representative of the Alake and the paramount ruler of Egbaland, Dr. Bamowe of Egbaland, the Professor Ajao Adenekon, as a point of contact. We also have representative of the Olowu of Owu Kingdom, Bashegun of Owu, Professor Maruf Adenekon, and also the representative of Caribou of Remoland, the Olugere of Ogere, Oba James Obafemi Sali. I want to please welcome all of you and all those journalists, members of the Fifth Realm. I think I must have missed out Dr. Ikwaye, who came in a little bit late. My recognition to you as well. The topic for today, first, so I'd like to welcome everybody here today, and I'm hoping that, generally outside, people see doctors as very serious people. Anytime you come for a meeting like this, please leave the seriousness in the hall. And then when you go outside the hall, just try and be human and mix with each other, and tour your environment. Make sure you enjoy yourself and have some memories to take back home. Memories, and try not to, apart from technical sessions, try to talk about things of life. Don't talk about stents and heart surgeries, and leave that one for, just try and relax and enjoy yourself. That is what Ogun State is there. So we're called the Gateway State. Let us be the gateway to better life for doctors, for all of you. The topic today is very apt, and I'm going to take it from a different perspective in my charge to you, which is the Nigerian healthcare system, unlocking the value chain. And the real issue for me is the value chain. And I've seen some of the subtopics that has to do with japa syndrome and all that and all that. But one of the first things that we needed to look at in the value chain is the lack of collaborations, one, between two healthcare facilities of two different dispensations. We need, I know you are in private practice, but if you look at our environment, sometimes, let's look at what happened during COVID. We had issues and trepidations as to where vaccines is going to be stored because nobody is looking at the value chain. I don't want us to look at value chain as people who japa or don't japa. The infrastructure that you need to make sure that your work is done well. Once there is, there was no facility to be able to retain those vaccines when they come into town, and we have to. It's not a crime that we didn't have it in place, but you can see how people rose up and created facilities, and today, but there are many more of that we could have done anticipatorily, and it could be led by the real users, which are the doctors who use these things. In a couple of days, weeks back, there was a gentleman who started manufacturing syringes in Nigeria. The basic things, these are things that facilitate the value chain, not that there's a closure of the port and you cannot get syringes to use, lives will be lost. The other thing that I also see in the value chain is the level of collaboration. Sometimes we doctors, you doctors, by the way, I'm also a small health practitioner from where I'm coming from. I graduated as a physiotherapist from Ife, and Great Ife, yes. The original Ife, not the, yes, because some of you here that graduated from the OOU type of thing will ask you to stand up and sit on the other side. The original Ife will but for me, part of so generally people don't see you as corporate men. They see you as men that is more of social service oriented. And you have it also in your understanding, in your creed, that you're a social service provider. Yes, we'll take it. But you can also create excellence even in providing that service and living to the creed of your profession. There's nothing wrong in 2-3 medical doctors or medical houses or hospitals to say, look, what are we missing here? We don't have an MRI. 3-4, let's come together and set up an MRI center and make it just because you are the doctors, you can synergize the reading, the interpretation, the whatever, and you still make money. But when you speak to them, they say, oh, we are going to make a lot of money from investigation, whatever. But why don't you just come together? And this is where the value chain is improved. If you have a city like maybe a small city, 5,000, 10,000, set a yardstick for it, and you know that the business will come. But we never address our minds to it, and so we keep complaining about things not being done. Unfortunately for medical, I was on the board of Reddington Hospital for almost 10, 12 years. The level of discussion and engagement for specialists who wants to come back is for real. But how much are we doing for those who are here to get the visibility that is required? So I'm really worried as a businessman about the value chain, and I'm saying that within your discussions, within your whatever, take hold of it. Don't leave it to outsiders. Don't leave it to anybody else but you yourself. And you're all coming from all parts of Nigeria. In some places, just an X-ray machine with collaboration from 3 or 4 of the private hospitals in that place will change the healthcare delivery in that neighborhood. A small lab that will do joint whatever will change the collab. But we're always very protective of the things we want to do. I don't even want to take it to you so that you won't know who my client is. Please, let us Let us get out of that and get into it, because the market is there. Even in places like Abeokuta or any of the Ibadan or whatever, if we have 3-4 operating MRIs in that, functioning in that area, everybody knows that it's going to be profitable, but how many of us are taking charge of it? So these are the kind of things that I want us to please look at when we meet in our various sessions. If you don't have it, collaboration is, for me, a very big issue. Yes, you can find ways to address the japa syndrome. Japa syndrome has only one thing to address it: good remuneration. Let's not deceive ourselves about japa or no japa, whatever. If what they are getting over there, some of them are suffering. I know that some European countries, for some of our children of our doctors to become consultants, even when they have all the prerequisites, they still put them on a queue somewhere. And then you now find that they are not being optimized. And after some times, they get frustrated, they want to come back. So it is good for our institutions to also allow people to come back so that they can tell their experience to those who thinks that japa is the only way to go. But for me, and I've always done that with my own the medical team in whatever, that remuneration is key. The japa we are looking at japa in the, I don't know whether there is a jimpa, because if your japa is outside, if your jimpa is inside, the mobility of doctors, even within the country, is high. You just wake up one day, this one has gone to AAC, this one has gone to QMC, this one has gone to GMC, this one, everybody just moving around anyhow. It shows that the demand is there, and those of us that are responsible for these things, and I want us to carry it back, and also the benefit of the SGF being here, because these are the areas where policies and whatever will be made. And I'm sure that we're doing something. For Ogun State, we are open for business. We are open for healthcare. I remember that part of the issues that we had, especially with our own tertiary institution, the first time we went there, I was privileged to go with the governor on his first trip. The first institution he visited was OUTH. And we couldn't even get near the mortuary because of the state of it. It's not something to be proud of, but it's something that we met. And today, you can see all the yes. First, we got people who are well established in private medical business to come and give us a blueprint for that place. And then we got Dr. Yemi Onoboale, who is the chief at Reddington Hospital, to head that team. And they made all that. And then we got Dr. Hassan, the Eye Foundation #1 person, to also administer that process. And you can see, and please, it shows one thing, that there's so much potential even in private hospital when we put them in a public environment. So as a mark of appreciation for the labors of these guys, please give Dr. Onoboale and Dr. Hassan a big round of applause. There's no way that we will talk about medical service without the private practitioners taking the major part of it, because I would like to see the statistics. I bet to say that maybe only 20% of patients actually go to government hospitals. Most of them participate in private, whatever, even the native doctors. But for me, what is more important, for His Excellency, especially Prince Dr. Abiodun, CON, is how we will develop together to raise the healthcare service. And we're open. And that is why, on our own part, the 250 bed, we're saying, look, for that level of excellence that is required, let us give it to people who are, and I'm very happy to say to you that within a couple of months, that place is going to be relaunched, and we have a 250 bed of a first-class tertiary institution available for everybody in Ogun State.
ọba mi tí ọmọ ọlọ́jà gba ìnáwó orúkẹdẹrẹ akẹsànbalẹ̀ ọjà rí ọjà tó ti pé ẹ̀wọ̀ gbọ́dọ̀ náà lé bàbá wọn ìwọ̀ fà gbọ́dọ̀ tí ó jà.
It's enough.
ọmọ ní ó náà jà náà táwọn ọba ní ilé wọn.
It's enough. I'm beginning to sound like the guest lecturer now.
Dàpọ̀ ẹsẹ̀ jìnnà sẹ́sì.
I'm beginning to sound like the lecturer himself. So on this note, I'd like to, on a soft note, welcome you. It's always a delight to have everybody from Nigeria come to have a taste of Ogun. And as you can see me, I'm very proud to let you see what I'm wearing, because this is one of the symbols of Ogun State. When His Excellency came during our first time, the Adire market in Ogun State was dying, because the Chinese will take this pattern and take it to China and turn it into a regular print and bring it back. And His Excellency thought wisely that how can we revive that industry? So the first thing he did was to make sure that on Friday, everybody adorned an Adire attire. So you can imagine for us, 60,000 government workers wearing Adire on a Friday. And of course, I don't want to talk about our female counterparts who are watching which color they wear. You know, men, we can wear 3 of these forever. But women, once they wear one, they say, I wore it yesterday, I can't wear it. So it was good for business. The multiplier became very good. So you can imagine 70,000 people, multiple dresses, going into that market. It transformed that market. And you can see the heritage that is inherent in that market. The dyeing pits, everything is there. So right now, the whole value chain, and it comes to, I'm saying this because the effect of value chain here. The whole value chain of the Adire, the man who is doing the cut, the clothing himself, the people who are dyeing it, those who are pounding it to give it the stay, those who are sewing, those who are doing fashion parade, all the value chain has been so heightened now that we can say that at least we have created a whole lot of stability in that market. And so for some of you who are here, I think we have 2 Adire markets, and then we have it online. So people order from everywhere around the world, and they have it. So very soon, I hope that the NMA will take you to the market, and so that when you go back home, at least you can show them that these are real African prints and this is African design. Thank you very much for listening to me. I hope that you will really enjoy yourself and go out and see the city. The first church is here. The Olumo Rock is there. So many tourist attractions here. At least let your social diary have something that you can say you are taking away from our visitation. Thank you. Have a nice deliberation. God bless. I also have a responsibility as a representative of the governor to also declare open this gathering. So to the glory of God and to the benefit of mankind, I hereby declare your session open. Thank you. God bless.
Let's keep clapping, please, ladies and gentlemen. When you see the SSG, you see the governor. Beautiful speech, wonderful comments. Thank you so much. Ladies and gentlemen, to take up the microphone is our very own Dr. Oladapo Ajose. He is ably representing His Excellency, the Senator of the Federal Republic of Nigeria, Secretary to the Government of the Federation. Ladies and gentlemen, Senator George Akume. Please, a round of applause for him. Thank you so much. Please, let's keep clapping, please. Thank you.
Please, let's be seated. His Excellency, the Executive Governor of Ogun State, Prince Dr. Dapo Abiodun, CON, represented by the SSG, the Honorable Minister of State for Health and Social Welfare, Dr. Adekunle Sadako, who is also the keynote speaker, the chairman of the occasion, His Excellency Senator Otumba Benga Daniel, the former governor of Cross River State, Mr. Donald Duke, who is also the guest lecturer, the representative of the Chief of Defense Staff, Honorable Commissioners for Health and Education, Science and Technology, Ogun State, here present, the Special Assistant to Ogun State Governor on Health, the NMA President, as represented, the ANPMP President, ASPON President, President of MD Khan, President of Guild of Medical Directors, our Royal Fathers who are here today, the Alake of Eberland as represented, the Olowo of Owu Kingdom as represented, and the Akarigo of Remo Land as represented. The Board of Trustees of this association, medical elders and giants of the profession, members of the media present here, distinguished guests, ladies and gentlemen, please kindly accept my apologies if for time constraints I have not been able to acknowledge you. The SGF felicitates with ANPMP on the 47th International Conference and AGM. He wishes would have been here by himself, but for exigency of office, he has asked the chairman of ANPMP Benue to represent him here. Unfortunately, he is also unavoidably engaged, and I've been asked to stand in for him, being the immediate past chairman of Benue ANPMP, representing the SGF, His Excellency Senator George Akume, CON-FNIM. I'm also an ANPMP member here, as I said earlier, and I'm a product of NYSC, having stayed in Benue State and becoming an indigene of the state in active medical practice for 33 years now. It's good for us to know that the SGF has closely associated with ANPMP right from its tenure as governor from 1999 to 2007. The first NEC meeting hosted by Benue State, the SGF assisted massively in the area of finance and logistics. And just last year, Benue State hosted the NEC again. We were privileged to do that. And who else could we have gone to again but the SGF? And he did not disappoint us. He has been a reliable ally. He recognizes the role of ANPMP as a core health provider and also key player in attaining universal health coverage. The SGF expresses profound gratitude and appreciation for the honor bestowed on him today. His appreciation goes to the president of the association, Dr. K. Adeshola, and the NOC, the Ogun State chapter, ably led by my younger brother, Dr. Kayode Oyelade, and the LOC for a successful hosting. The SGF wishes to assure the ANPMP of continued support, even as the association continues to support the renewed hope agenda of the government. And in furtherance to this, the SGF wishes to support the association with a pledge of 5 million naira. Once again, thank you for this honor. God bless Nigeria.
Thank you very much. Ladies and gentlemen, we are gradually winding down this segment. So let me quickly announce the members of the Communique Drafting Committee. As you hear your name, just proceed to the registration stand where the secretariat will be situated when the business session begins. Dr. Adebiyi GD, the Secretary General. Dr. Benga Eweoya, Assistant Secretary General. Dr. Akin Oyejoko, Ogun State General Secretary. Dr. Festus Osai, the General Secretary from Rivers State Chapter. And Dr. Mrs. Sheung Olushola, the General Secretary of Lagos Chapter. These 5 people will constitute the Constitutional Drafting Committee. Your attention is needed at the registration desk now.
SSD, má gbàgbé mi rán mi sí mi. Ṣé bí Ọlọ́run ò ní jẹ́ kó tán láéláé? Edwina Georgia Mẹ́ kú kalẹ̀ níbẹ̀ wọn aṣojú bàbá. Ṣé wọ́n àgbà ní àbí ẹ̀ máa ránṣẹ́? Àárí mi lónìí ṣe bẹ́ẹ̀ mọ̀ wẹ́mi ní ìrìn ààrẹ wẹ́mi nílò ọkọ̀ báyìí tó pọ̀.
Thank you very much, our brother, our elder brother. Right now, the Association of Nigeria Medical Practitioners will be appreciating the governor of Ogun State by the presentation of a plaque. And you will know that the governor is represented by the SSG. May I now invite the representative of the Ogun State governor, Mr. Tokumbo Talabi, to please step up and take this gift. This is to be presented by yet another handsome governor and the former governor of Cross River State. Well, the governor is also an indigenous of Abeokuta because I have met him in this hotel and at OOPL several times. Abeokuta is becoming like a second home for him. So I welcome His Excellency Donald Duke to present this for the SSG. After the SSG will receive that of the governor, he will equally be receiving another in his own personality. Thank you very much. Your Excellency, sir.
Bàbá wa Tàlàbí dákun má ṣe gbàgbé mi ọba ṣe fẹ́ràn mọ́ sí mi.
We work every day and night that Nigeria may be healthy. We are available. We are accessible. We are the largest providers of healthcare. We are available.
Bàlàbí ilé bọ́ ṣe lè bẹ̀ lálàáfíà rárá. Bàlàbí alábòkun bọ̀wọ̀ tèmi ni.
Thank you very much, sir. Sir, please, let's hold it until all this presentation is done, sir. Thank you very much.
We are the Association of Nigerian Private Medical Practitioners, ANPMP. ANPMP.
So the presentation will be in front of the podium, down the step.
From the east down to the west, the south and north.
The SSG will be receiving it alongside the Commissioner for Education, Professor Abayomi Arigabu, and the SA Health, Dr. Tayo Lawal.
We are the largest providers of healthcare. We are available. We are accessible. We are the largest providers of healthcare. From up above the river Niger and Benway.
Distinguished guests, ladies and gentlemen, I am indeed honored to present this award through you, my friend, to another friend of mine, the governor of this great state. And please tell him we miss him. I was hoping actually personally that I'll see him here today. But you've done a great job representing him as usual. So again, commendations and our best wishes all the time. Thank you.
Affordable healthcare is our desire. Equitable health coverage is our dream. Universal health coverage is our vision.
This goes with it. No, I can't put it on his neck. He will do that to the government. Now this is for you. And I think the association wants to express its gratitude for you taking time out here this morning to represent the governor as you have done dutifully. The association expresses its gratitude and takes note of all the advice that you have proffered this morning, and it's very, very insightful. I was quite thrilled, particularly the collaboration you mentioned between private medical practitioners coming together to share joint responsibilities. You know, you mentioned the laboratories and things they could do together rather than go it alone. Because capital is one of the challenges that we have in the country today. Credit is very, very expensive. And so coming together, pulling resources to add value, and which is part of the value chain, which I'll be talking about later, makes a lot of sense. And I'm glad you mentioned it. You're also a member of the profession, so you know it from first-hand experience. Again, I want to commend you and congratulate you for the work you're doing in the state and the confidence that the governor and the government repose in you. Thank you very much.
Dr. Sunday ni mo láti èmi ló ń kọ́ mọ́ bò ọmọ ìfẹ́ àpèrè ọmọ dáadé owó rẹ̀ mọ ìpè ọ̀ní ẹrù jẹjẹ.
Ladies and gentlemen, we have the arrival of our distinguished senator representing Ogun State East. Ladies and gentlemen, our very own father, a philanthropist, son of the soil, a man of the people, former governor of Ogun State. Ladies and gentlemen, put your hands together for our very own senator, engineer Olubenga Daniels.
Ọmọlúwàbí of Ogun State. Gbẹ̀ngàn Daniel wàlàyé olólùfẹ́.
Please, let's keep clapping for our very own senator, please.
Ìjọba sọ pé tàdé ń fẹ́ tiwa, ó tó wo dé gómìnà ní ti ń fẹ́ tiwa, ó tún dé gómìnà ó tún ń fẹ́ tiwa.
Ladies and gentlemen,
lọ sòkú lómù ní òmù ẹlẹ́ni.
Ajobiere, thank you. Ladies and gentlemen, I am presenting to you the man, the legend, a great philanthropist, a political gladiator, son of the soil, a distinguished senator of high repute, and ladies and gentlemen, he is a man of honor. When I say a son of the soil, I mean son of the soil. Ladies and gentlemen, please one more time, let's put your hands together for the former governor of Ogun State, a present sitting senator of the great Federal Republic of Nigeria, representing Ogun East since 2023. One more time, celebrate our very own engineer, Olubenga Daniels. Thank you very much, sir. Like the way Kule Bantefa used to call him then on radio and on TV, you will hear Olubenga Daniels. I can never forget. Thank you very much, ladies and gentlemen. We put forward in this beautiful event, and of course, right on my list, it is time for us to hear the voice and the goodwill message of our very own
former governor of Cross River State.
Olúgbénga ọmọ Daniel, ọmọ ẹlẹ́ni àtẹ̀yẹ̀ká, ọmọ ẹlẹ́ni ẹlẹ́wẹ̀lẹ́, ọmọ olórí ìsanwó òròpó ẹ̀bá ọ̀nà. Eléyìí fẹ́ tẹ̀ ní àwọ̀ ìsáfù ẹ̀yẹ tí ó fẹ́ tẹ̀ ní àwọ̀ sínú ẹranko ògbó àwọn tó ń jẹjẹ. Wọn náà tó ń lọ ọmọ olómù ńlá pé ọmọ lọ́rọ̀ aláàgógó àṣegbà lọ́nà tó wù. Èmi sìn ọ́ ìwọ sìn mí. Lolómù ṣe ìtàlẹ́fì lẹ́mọ̀ wọn lọ́wọ́. Ọmọ mo sí mo dájà dátẹ́kù mo sí mo dájà dátàtì. Bàbá yín lóhùn mo sí tí mo dájà ní ẹsẹ̀ náà jọ sí. Àtẹ́kù àtàṣe lánàá tí a bàbá yín dọ̀gbà lè mo sí àlọ́kọ̀fà obìnrin.
Thank you very much, Ajubiwe. Thank you. All right, ladies and gentlemen, without wasting much of our time, it is at this junction for the keynote address. Please, with a round of applause, join me as I bring to the microphone Dr. Isiaq Adekunle Salako, a very own Honorable Minister of State for Health. Thank you so much. Ladies and gentlemen, let's keep clapping as it goes forward. Thank you, sir.
Thank you. Thank you, MC Coded. The Secretary to the Government of the Federation, Senator George Akume, who is there represented, His Excellency, the Governor of Ogun State, Prince Dapo Abiodun MFR, also represented, the Chairman of the day, former Governor of Ogun State, Senator representing Ogun East Senatorial District, a distinguished engineer under whom I cut my political teeth, Otumba Engineer Senator Gbenga Daniel, His Excellency, the former Governor of Cross River State, Dr. Donald Duke, Chief of Army Staff here represented, the Director General of the Nigerian Institute of Cancer Research and Treatment, members of the Ogun State Executive Council here present, the National President of NMA, National President of Medical and Dental Consultants Association of Nigeria, our host, the National President, my friend, President, Association of Nigerian Private Medical Practitioners, Dr. K.A. Adeshola, Kabiesis, Yalake, Yakarigo, and Yolowu, our State Chairman of NMA and ANPMP, all our guest speakers and facilitators, especially my friend and colleague, Dr. Babatunde Ipaye and Dr. Kukoyi, past presidents, National Executive Council members, National and Local Organizing Committee members, distinguished eminent medical practitioners, gentlemen of the press, ladies and gentlemen. First, let me deliver the apology of the Coordinating Minister of Health and Social Welfare, who was also invited to be here, but is unable to attend because he's currently out of the country attending to official matters. He has asked me to give his apology. It gives me a great pleasure to address this eminent gathering of medical practitioners on a theme that resonates very loudly with the agenda of the federal government of Nigeria and that holds the key to improve investment, mobilizing more resources, and ensuring universal health coverage in our country. I must particularly thank the Association of Nigerian Medical Practitioners for inviting me and for identifying the Unlocking the Value Chain agenda as a topical issue for discussion at this conference. This is a topic that is a key pillar in the agenda of President Bola Ahmed Tinubu, GCFR, to save lives, prevent physical and financial pains, and deliver health to all of Nigerians. The value chain describes the full range of activities which are required to bring a product or service from conception through the different phases of production, delivery to final consumers, and the final disposal after use. In the healthcare sector, the value chain encompasses everything from research and development to the manufacturing, distribution, delivery of quality healthcare services, and managing healthcare finances. It is a complex system, a shared responsibility that requires synergy between government policies, budgetary allocation, private sector investment, and professional expertise. Availability of domestic manufacturers of quality assured products, as we know, is a critical enabler of universal access to essential health products and health security. The experience of COVID-19 particularly brought forward the compelling national security significance of unlocking our healthcare value chain in order to increase local manufacturing of pharmaceuticals, vaccines, medical devices, reduce reliance on imports, and mobilize billions of dollars that can help transform our nation's healthcare ecosystem. Thus, unlocking healthcare value chain has social, economic, and national security implications. The current administration under President Bola Ahmed Tinubu therefore took the bull by the horn at the beginning of the health sector reforms with a holistic diagnostic examination of the existing systems and identified 4 pillars as the basis for the health sector renewal investment initiative. The third pillar of this initiative, which is to unlock the value chain, was deliberately selected to address this deficit in our healthcare business system and our heavy dependence on imported health medical devices, test kits, and vaccines that we consume. Nigeria currently imports about 70% of the drugs and close to 99% of the medical devices, test kits, and vaccines that we consume. The Unlocking Value Chain agenda is expected to address this imbalance and accelerate our journey towards universal health coverage. The government therefore recognizes that while it plays a crucial role in policy formulation, regulation, and infrastructural development, the private medical sector is the engine that drives service delivery, innovation, and sustainable growth in the healthcare system. This is why the presidential initiative to unlock the healthcare value chain was established to enable a business-friendly environment that encourages investment, supports local production, and strengthens Nigeria's position as a global hub for pharmaceutical manufacturing, medical technology, and health tourism. The vision is to increase the share of locally manufactured healthcare products from the current approximate 30% to at least 70% by 2030. Reduce outbound medical tourism, which currently stands at about $1 to $2 billion per annum, and create skilled jobs across the various parts of the healthcare value chain. We have a clear understanding of the private sector as an engine of growth, a crucial stakeholder, and a reservoir of dominant funds to be tapped. Thus, the vision of President Bola Ahmed Tinubu is to enable the private sector and within the next half a decade, make Nigeria a regional hub for healthcare businesses and therefore reverse the prevailing direction of medical tourism from outbound to inbound. Consequently, the President in October 2024 issued Executive Order number 17, targeted at increasing local production of health products, reducing cost of healthcare equipment and consumables, and promoting local investments. The Executive Order introduced zero tariffs and excise duties on pharmaceutical machinery, equipment, goods and accessories, with a special waiver for all active pharmaceutical ingredients, excipients, and other raw materials. Executive Order 17 is expected to influence healthcare market structure and dynamics, ensure regulatory harmonization, and expedited approvals. The federal government, by this order, has therefore sent out a clear signal of prioritizing local manufacturing of pharmaceuticals, medical devices, and consumables so as to reduce dependency on imports. In the final analysis, Executive Order 17 is expected to lower healthcare costs, enhance supply chain resilience, and create millions of jobs. It's also expected to save billions of foreign exchange from the estimated $2 billion expended annually by Nigerians on outbound medical tourism and thus mitigate foreign exchange risks. The presidential initiative on unlocking healthcare value chain is committed to enabling the establishment and scaling up of high-quality private healthcare infrastructure by helping making business cases, improving access to affordable financing, and fast-tracking regulatory approvals through collaborations with financial institutions like the Africa Development Bank, the Bank of Industry, the Afrexim Bank, the Nigeria Sovereign Investment Agency. PVAC is expanding financing options for private healthcare businesses. And in the spirit of sector-wide approach, government-led initiatives like PVAC are aligned with broader health system reforms to ensure that collective efforts yield sustainable improvement in healthcare access and outcome. In this journey, government has identified private practitioners and private practices, private investors as critical elements to the unlocking the value chain agenda. In the unlocking process, the government may hold and control the padlock of the environment without empowering the private sector, private practitioners like your distinguished self, with the right keys. The process cannot succeed on a sustainable basis. The enablement provided by government, therefore, needs to be harnessed by the private sector to close the gaps in local healthcare services through the provision of top-notch specialized healthcare services, improved clinical standards, and world-class patient experience. The Nigerian $18 billion healthcare market, our growing population, and the regional continental healthcare market provide numerous opportunities for investment for a significant economic and social impact. It is heartwarming to note that the private sector is already taking good advantage of the healthcare value chain and establishing world-class health facilities that is offering top-notch range of services to Nigerians and other nationals. And I can mention quite a few from Ace Medicare in Ota. Bridge Hospital was there early in the morning, Premier Hospital, First Consultant, and so on and so forth, that are working very hard and providing first-class Medicare. I sincerely, on behalf of the government, commend these medical entrepreneurs who are actively providing good quality services that is beginning to attract good patronage within and beyond the shores of Nigeria and supporting the economic development of the country. To fully unlock the private sector and private practitioners should, however, not just focus on direct patients' clinical care. Investment opportunities also abound in several other areas of the value chain, such as training of health professionals, including specialists, research and innovation, continuous professional development, health promotion, provisions of enablers that drive healthcare services like power, logistics services, like drone delivery of medical products, telemedicine, EHR, EMR, artificial intelligence, and other technology-enabled services. Provision of auxiliary services like security, laundry, and catering are also areas for potential investment. Let me assure you of the full readiness of the Federal Ministry of Health and Social Welfare to support private sector players, including private health practitioners, to profitably invest in delivering healthcare services to Nigerians and to other nationals. The ministry, through PVAC, has developed an accelerator program to foster innovation, support business growth, and provide the much-needed partnership to players in the health sector, especially small, medium enterprises. PVAC has built a pipeline of over 70 bankable projects worth over $5 billion USD, and has mobilized resources from major institutions such as the European Investment Bank, Afrexim Bank, AFDB, NSIA, and BOI for investment in feasible healthcare projects. And this is one area that I believe the Association of General Private Medical Practitioners need to sit down and see how they can harness. It is a fertile ground waiting for private healthcare practitioners and other entrepreneurs to explore. The federal government appreciates the immense contribution of the private medical practitioners in securing the health of Nigerians in line with the 2014 National Health Act, which recognizes the private sector as an integral arm of the national health care system. Most of you are practicing under very difficult conditions, making huge sacrifices, and demonstrating the needed commitment to Nigeria. I assure you that the government will not leave you alone. We will continue to work to create the enabling environment to make private medical practice more rewarding. The policy of the federal government around health insurance is designed to mobilize more resources for the healthcare sector and ring-fence your risk by reducing out-of-pocket expenses. The federal government, before the end of the second quarter of 2025, will be conducting a national dialogue on power in the health sector to address the deficit of electricity in the system. And I want to assure you the Association of Nigerian Private and Medical Practitioners will be adequately carried along in the dialogue. Before I end this address, let me emphasize the need to balance financial profitability with social returns in healthcare investment. According to the European Investment Bank, healthcare investment projects typically generate moderate financial benefits and sometimes often fail to deliver sufficient financial returns. Against this background, I would like to appeal for the adoption of pricing models that balance profitability with accessibility in our private practices so that costs does not become a barrier to essential care. Access to quality healthcare should not be a privilege for a few. It must be affordable and it must be fairly priced. It is therefore imperative that private practitioners continue to actively encourage health insurance by working with the Nigerian Health Insurance Agency and the health management organizations. Distinguished ladies and gentlemen, eminent participants, healthcare is not just an industry. It is the foundation of national security, economic growth, and social well-being. The President of Nigeria, President Bola Ahmed Tinubu, is treating the health of Nigerians as an urgent matter of right and is therefore giving the sector priority attention, including more budgetary allocation, and we have our legislators, including Otunba Gbenga Daniel, to thank for approving more budget for the health sector. The federal government is expanding financial protection for Nigerians, with more citizens brought under the health insurance coverage. We're improving primary healthcare services through the reform of the Basic Healthcare Provision Fund, ongoing revitalization of close to 4,000 PHCs with a target to revitalize over 17,000 by 2027. We are expanding routine immunization and we are training our frontline health workers. We are employing more health workers despite the challenge of migration. We are focusing on better welfare for them and also addressing the challenge around migration, popularly known as japa. We are developing and enforcing standards. Earlier this morning, you saw the delivery from Dr. Ajayi around the regulatory framework that we are trying to create. We are expanding access to tertiary care, and in less than 2 years, we have created additional 12 federal tertiary health institutions across the country. We are creating 6 world-class cancer centers of excellence. We are improving the capacity of Nigeria to prevent, to detect, and to respond to pandemics. In summary, the Nigerian healthcare sector is on a trajectory of improvement and a better care for our people. Unlocking the value chain. Unlocking the healthcare value chain agenda is another of the priority of initiative of this government. I call on you, private care practitioners, to join us to unlock it together and build a system that not only meets the needs of Nigerians, but also positions our country as a leading player in the global healthcare economy. Government holds the padlock. The private sector is the key to unlock. Thank you, and God bless the Federal Republic of Nigeria.
Ọ̀kàrẹ̀ láyé ọmọ Zàlàkọ̀ ayé rẹ̀ ò ní burú láéláé. Ọba mi kí Tinubu àgbà ìyá ọmọ ìyálọ́jà àbọ̀ ọba délé àkànbí bàbá ìyálọ́jà mi ní.
Ladies and gentlemen, a round of applause for that beautiful keynote by an intellectually personified minister. Please, a round of applause for him one more time. Dr. Isiaq Adekunle Salako. Thank you very much, sir, for that beautiful keynote, well delivered.
Thank you very much. Village, they will say, "Ebi ta fẹ́ gbin obì sí, obì ti hù ń bẹ̀." The next thing is supposed to be the presentation of Plaque to the keynote speaker, and that is the Minister for State of Health, Dr. Kunle Salako. The person that's supposed to present is the chairman of the occasion, and is also sitting next to the chairman. But nevertheless, we will still step down the podium for the presentation of this plaque. May I invite the keynote speaker and the Minister of State of Health, Dr. Isiaq Kunle Salako, and also the presenter who will present the plaque is the chairman of the occasion, Otunba Senator Engineer Justus Olubenga Daniel, a fellow of the Nigerian Society of Engineers. Let's please put our hands together for the two of them for the job to be done.
Ọpọlọ di mẹ́ta lọ́dọ̀ tèmi nìkan ṣoṣo, wọ́n ní ọpọlọ gidi. Aṣáájú Àkànbí ọmọ Ìyálọ́jà, Adékúnlé ọmọ Ṣàlàkọ́, Ọ̀túnba Gbénga Daniel, òmù ẹlẹ́ni nílé bàbá rẹ̀, ọmọ ẹlẹ́ni àtẹ̀kọ́, ọmọ ẹlẹ́ni ẹlẹ́wẹ̀lẹ̀.
Your Excellencies, our President, very distinguished medical practitioners, ladies and gentlemen, it is my pleasure and honor to make this solemn presentation to one of the best ministers for health of our time, on behalf of the Association of Nigerian Private Medical Practitioners, it is a honorary award of excellence, humbly presented to Dr. Isiaq Adekunle Salako, Minister of State for Health, in recognition of his role as faculty and being the special guest of honor at this 47th International Conference and AGM of ANPMP Gateway 2025. This solemn day, 24th of April 2025. Hearty congratulations.
A better round of applause. Òmù ẹlẹ́ni nílé bàbá rẹ̀, mo rántí ọjọ́ tá a lọ sóòkú ló mọ̀ ń jọ sí. Èrò pọ̀ wọ́n níye, ẹni kúkúrú di gíga, èèyàn tó ṣe gígùn bẹ̀rẹ̀.
Thank you and well done to the chairman of this occasion. And thank you, congratulations to the keynote speaker. Thank you very much. Ladies and gentlemen, we're moving on to a very important aspect of this program. But before I will call it, I want to let you know that a major contributor to the Ogun State that I've been marketing since I have this microphone is here with us. A former governor of the Gateway State, a distinguished senator of the Federal Republic representing the good people of Ogun East Senatorial District. He is the chairman Senate Committee on Navy, the Otumba Obalofe of Akile Ijebu himself. Without him, people like us will not be holding the microphone as we are doing here today. Distinguished guests, ladies and gentlemen, please welcome with me to this conference the chairman of today's occasion, Otoba Senator Engineer Justus Olubenga Daniel, FNSE. Let's put it together very well for him. Well, if we want to give him a standing ovation, he worth it. He even worth more than that. Thank you very much, sir. We are glad to have you. Thank you very much. Thank you, sir. Thank you, sir. Thank you, sir. I hope you didn't forget that I am also Olubenga, so I'm glad to share the same name with him. We can also put our hands together very well for that. Majowa now. Anyway, Ayeshiwa, Sheka change Oruko Benga. Now we are moving on to investigation. And I'm going to call the Secretary General, Dr. Badebo Adebi, to please join us up here to anchor this aspect of the program. A round of applause for the Secretary General.
Thank you very much. Ladies and gentlemen, my name is Badebo Adebi, the Secretary General of the Association ANPMP. Ladies and gentlemen, we are about to commence one of the highlights of today's event and the proceeding for the award of FAGP. Permit me therefore to invite my President, Dr. K. Adeshola, to proceed to the podium for the conferment of the award.
Olúgbọ̀ngbà Daniel ọmọlòmù ọmọmọsí ọmọlòmù láàmọlòmù ní bàbá rẹ̀ ọmọmọṣẹ́ ọmọ àbọ̀rọ̀kọ̀ ní owó lọ́wọ́ ìrọ́pọ̀ ọmọ ìsìsọ́pọ̀ ọmọ oníjẹ́kárí iná mọ́. Ọ̀rọ̀ òmùmù sí sọpọ̀ òmù ní jẹ́ kárógun mọ́ má gbèjà òmù kálẹ̀. Èwú yẹn ti dómù wá àdọ̀tún.
I, Dr. Badebo Adebi, Secretary General of ANPMP, hereby present the following doctors who, for their contribution to the growth of the private medical practice in Nigeria, have been found worthy to be conferred with the singular honor of the Fellow of the Association of Nigerian Private Medical Practitioners. I hereby call on these fellows, and they should move out as they hear their name. Dr. Odogu Victor from Bayelsa State.
Please clap and welcome them.
Dr. Ebo Emmanuel, Delta State. Dr. Udegbe Enauro Festi, Edo State. Dr. Rabo Derek Kolawole from Edo State, and Dr. Agedo Moses from Edo State as well.
Distinguished ladies and gentlemen, as it's our tradition in the association, today we're honoring some of our members with the award of fellowship as fellows of the Association of General Practice. Those that qualified for this award, the minimum they are put into private practice is 15 years. They have contributed in several other ways, and they have been able to establish the authority around their areas, their locations. And this on this note that we have screened them and found them worthy to be given the award of the fellowship of the Association of General Practice. Secretary General.
Mr. President, sir, I pray that the names of this fellow be entered into the rolls of honor of the association. Doctor, sir, do you hereby promise to accept the responsibility of fellow of the Association of Nigerian Private Medical Practitioners? If you do, say this after me. I. You put your. Do hereby solemnly declare that I accept this honor by my peers and colleagues. I also promise to discharge my responsibilities as a fellow of the Association of Nigerian Private Medical Practitioners. So help me God.
Please a round of applause for them.
It's not easy to have put in this in this tight country. 15 good years. Some of them are actually put in as many as 25 years. Gentlemen, as part of our tradition, you will move forward. Come to this side. Don't make the mistake of putting on the cap until you are given the award. Otherwise, you wait till another 365 days. Please move, give yourself space. Now look at our colleagues there. They are the ones conferring on you this great honor today. So you look at them. Doctor, are we ready? You ready for me? So you take a bow this way, then you turn back. Our dignitaries there, the KBSC, His Excellencies, you also face them, take a bow, and then we continue, you turn back. So please go ahead and do that. Please, a round of applause for them. Take a bow, clap for them, turn around, greet the dignitaries. Yeah, take another round of applause for them. So please, I, K.A. Adeshola, President of the Association of Nigerian Private Medical Practitioners, has the honor to formally confer on you fellowship of the Association of Nigerian Private Medical Practitioners, and hereby present these certificates to you, which will entitle you to the rights and privileges pertaining thereunto. Congratulations.
Dọ́gba àbàtì mo kí ọkùnrin kalẹ̀ níbẹ̀ ẹ̀hún. Ọ̀rẹ́ ọmọ rẹ̀ ọ̀gbọ̀kọ̀ òun ní kí gbogbo ayaba kárí ẹ̀jẹ̀ ọmọ òrówó ẹ̀bọ̀dì kúnkúrú.
Thank you, sir. Thank you, sir. Association of Nigerian Private Medical Practitioners. This is to certify that Dr. Odogu Victor Coroner Kegba is hereby elected a fellow of the association in recognition of contributions to the growth and development of private practice in Nigeria. Once more, I say congratulations. Don't cover it.
Ìwọ gangan la tẹ̀lé àkàn bí mọ́gàjì fèyí kọ́gbọ́n. Bẹ́ẹ̀ni ọmọ Daniel.
The Association of Nigerian Private Medical Practitioners hereby present to you Dr. Egbo Emmanuel as an elected fellow of the association in recognition of contributions to the growth and development of private practice in Nigeria. Congratulations.
Thank you, sir. Thank you, sir.
Dr. Udegbe Enaholo, FO. The Association of Nigerian Private Medical Practitioners hereby certify you as if an elected fellow of the association in recognition of the contributions to the growth and development of private practice in Nigeria. Congratulations. Please, let's give them a round of applause. It's not easy. Yeah. Dr. Rabo Derek. The Association of Nigerian Private Medical Practitioners hereby certify you as an elected fellow of the association. Recognition of contributions to the growth and development of practice in Nigeria. Congratulations.
Yes, thank you.
Dr. Agedo O. Moses. The Association of Nigerian Private Medical Practitioners hereby certify you as an elected fellow of the association in recognition of the contributions to the growth and development of private practice in Nigeria. Congratulations.
Thank you, sir.
Hold it to her, hold it to her. SG.
Thank you, my president. Awadi, you can now put up your cap, take your bow, and move. Well,
put on your caps now. Once you have become fellows of the association, you are now qualified to wear your cap. That should drop to the left side. So now take a bow as we admit you into the role of honor of the fellowship of the association. Take a bow, all of you. Thank you. Please a round of applause for them. You can. Yes.
I, Dr. Badiba Ibis, Secretary General of ANPMP, hereby present the following doctors who, for their contribution to the growth of the medical practice in Nigeria, have been found worthy to be conferred with the singular honor of fellowship of the Association of Nigerian Private Medical Practitioners. Hereby present Dr. Yakini Taufik Bolagade, Dr. Adetoye Olusanya Rufus, both from Ekiti.
Let's clap for them. Come on, let's clap for them.
Dr. Alubungu Eso Olaku from Kogi State. Dr. Sanusi Badebo Gafar and Dr. Oyetunde Daniel Uche Stephen from Rivers and Dr. Thompson Moses Kofi from Ogun State. Doctor, sir, do you hereby promise to accept the responsibility of a fellow of the Association of Nigerian Private Medical Practitioners? Then say after me. My SD said they cannot hear you.
Are you ready to accept the responsibility?
Yes, we are ready. Good. So, repeat after me. I, what's your name? Do here solemnly declare that I accept this honor by my peers and colleagues. I also promise to discharge my responsibility as a fellow of the Association of Nigerian Private Medical Practitioners. So help me God. My President, sir.
Yeah, I congratulate all of you. In fact, ANPMP forever, ANPMP forever.
We are greater together.
In fact, I'm surprised that the set of colleagues I'm seeing here, some of them have known them for over 30 years. Why they are now collecting the fellowship at this junction? Was it economy or where do we place it? Yakini has retired from Federal Medical Center, Ekiti, has retired even from his own private practice. Just coming forward. He said he's not tired. So please, you take a bow to greet your colleagues and turn to the high table and greet our dignitaries. Oh yeah, please, a round of applause for them. Let's not just... Yes. I, K.A. Adeshola, the president of the Association of Nigerian Private Medical Practitioners, has the honor to formally confer on you a fellowship of the Association of Nigerian Private Medical Practitioners. And I hereby present these certificates which entitle you to the rights and privileges pertaining thereunto. Congratulations. Thank you, sir. Please clap for them. They are now fellows. Dr. Yakin, I, Bolagade, the association hereby elects you as a fellow in recognition of contributions to the growth and development of private practice in Nigeria. Once more, I say congratulations.
Thank you, sir.
Let them see. Are you hiding it? Dr. Adeto Soya, ANPMP, the Association of Nigerian Private Medical Practitioners, hereby elect you as a fellow of the association today in recognition of contributions to the growth and development of private practice in Nigeria. Congratulations. Please, let's clap for them. This is a whole state chairman here again, all the way from Kogi. Dr. Alumbugi Iso Olako, the Association of Nigerian Private Medical Practitioners hereby confer on you today the fellowship of the association in recognition of contributions to the growth and development of private practice in Nigeria. Congratulations. He seems to have been saving this money for over 10, 20 years because he's been qualified for this fellowship for a long time. He finally saved enough to earn. Dr. Sanusi Gbadebo Gafar, Association of Nigerian Private Medical Practitioners, today certify you as an elected fellow of the association in recognition of your contributions to the growth and development of private in Nigeria. Congratulations.
Thank you very much.
Dr. Thompson M.K. Blackson, the Association of Nigerian Private Medical Practitioners hereby certify you as an elected fellow of the association in recognition of your contributions to the growth and development of private practice in Nigeria. Congratulations. Please, let's clap for him now. Where Bayelsa? Bayelsa? Is it not Bayelsa? You're from Bayelsa State. Ogun State. Ogun cannot clap for you. Congratulations. Please, all of you should remember you must secure the signature of the President and Secretary General. That's what authenticates your certificate. Thank you. So, can you put on your cap now? This will hang on the left side. If you put it on the right, we will withdraw the award. You come back again next year. Who is putting it on the right? Nobody. They don't want to come back. They are all late comers. Congratulations. So take a bow before your colleagues. Please, a round of applause for them. Congratulations. And then our dignitaries, take a bow. Greet them. Thank you. Thank you. Thank you. Sit now. I hope I'm free.
Thank you, Mr. President. All the awardees should remember to sign their roll of honor register. Otherwise, this is null and void. Thank you.
Ladies and gentlemen, congratulations to all the fellows. Please, a round of applause for them, please. Thank you very much. It is my absolute delight to bring up on stage a distinct, different, special gentleman. Ladies and gentlemen, please join me for the Adam Ewa lecture. Put your hands together with a round of applause to bring on the microphone His Excellency Dr. Donald Dupe, former governor of Cross River State. Please, ladies and gentlemen, I need you to keep clapping. Please keep clapping, keep clapping, keep clapping, keep clapping. Thank you. Thank you very much. He is a distinct gentleman. Thank you, sir.
How come that guy's microphone is louder than this one? The day is far spent, so I'll apply the skirt theory. You know, skirts should be long enough to cover the vitals, but short enough to keep us interested. So I'll keep this long enough to ensure that we cover the topic of discussion, but short enough not to bore you. Mr. Chairman, representative of the Secretary of Government, representative of the Governor of Ogun State, Honorable Minister of State, Health, Royal Fathers, President of NMA, President of ANPM, distinguished ladies and gentlemen. Let me thank the Association for the opportunity and honor to speak to you this morning, afternoon it is, this lecture series of the 47th Annual General Meeting aptly known as the Andemewa Lecture, in honor of your pioneer president, Dr. Samuel Etim Andemewa. Dr. Andemewa, a very distinguished physician and gentleman, was very well known to me as an uncle and perhaps one of my father's closest friends. I recall with nostalgia spending time at his home and hospital, Andem Friendly Medical Clinic at Mabo Street in Surulere in Lagos. The hospital was, in my child's eye, an expansive facility on the ground floor, while Dr. Andemewa resided upstairs with a green wall-colored spiral stairway leading up. This was a unique feature for us as children. I recall the disinfectant smells of the hospital at the time and peeping through the windows at patients and the nurses in their impeccably starched light blue uniforms. Indeed, nostalgic. The subject you've chosen for me to speak on, unlocking the value chain in the Nigerian healthcare system, the role of the government and the Association of Private Medical Practitioners, is most topical. However, before I commence, let me add a caveat. I am no expert in health policy, but sufficiently knowledgeable enough to know our nation's strengths and weaknesses in the health sector, with a fairly good idea of what to do that may make it work. Let me start this discourse with my perceived role of governments in the sphere of governance. Governments are established to ensure the utmost productivity of the citizenry within a safe and orderly environment. In this sentence, three words stand out: productivity, safe, and orderly, with the ultimate beneficiary being the citizenry. The reason for education and skills acquisition is towards productivity. The further reason for healthcare is also towards productivity. In other words, a sound mind in a healthy body is potentially a productive citizen. The addition of infrastructure, be it electricity, roads, telecommunications, and embracing new and adaptive technologies, is to catalyze productivity. The role governments play in the health sector depends largely on the level of economic development of that society. More economically advanced societies, for instance, lay more emphasis on regulation, research, and innovation than direct investment in patient management. In less developed societies, the government may have no choice but to regulate, directly invest in patient care and management by building hospitals and healthcare facilities, training of healthcare staff, payment of salaries and wages, and perhaps more, leaving little room for research and innovative approaches to modern healthcare. In wealthier societies, the private sector, whilst contributing to research and development, invests in hospitals and healthcare facilities. The near absence of capital in less developed societies leaves most of the responsibility with the government. But without doubt, this sector is one in which all hands must be on deck, and why both sectors, public and private, must be unlocked to exploit the potential of their full value chain. The Nigerian healthcare system is primarily challenged by inadequate funding, inefficient resource allocation, poor access to healthcare facilities, and a concurrent shortage of healthcare professionals, dismal management, attitudinal lapses, and to a large extent, corruption. The latter two issues, attitudinal lapses and corruption, do not form the thrust of this paper, but should remain at the back of our minds as being a significant part of the challenges in unlocking the full potential
and value chain of our health system. Funding. The ideal percentage of GDP allocation to the health sector is subjective. However, the World Health Organization recommends countries allocate at least 15% of their national budget to this sector. Very few developing countries, due to various sectoral demands, are able to achieve this. For instance, Nigeria's aggregate sectoral allocation to the health sector, and as a percentage of GDP, stands at about 4%, while in India it's as low as 1.9% of GDP. In South Africa, it's 1.1% of total budget, and in Brazil, 9%. In developed or high-income countries, it ranges between 10 and 20%. 17% in the United States, 11% in Japan, in Germany 12.6%, and the United Kingdom 12.4%, but global average is put at about 3%. The near absence of affordable credit, and the word here is affordable credit, is also a major hindrance to further private sector participation in healthcare in Nigeria. Whilst for government, prioritizing more alluring sectors such as infrastructure, housing, and defense are considered just as critical, particularly amongst we politicians, the lopsidedness in sectoral allocation, to my mind, is a betrayal of the primary reason for the establishment of government in the first place, which, as I stated earlier, is to ensure the utmost productivity of her citizens. Now, insufficient resource allocation. Despite the inadequacy of funding, abuse such as misapplication of allocation are perverse. Budgetary allocations are spewed in favor of items that hardly have any bearing to the health sector, such as seminars and conferences abroad, vehicles and other line items that cannot be justified. Although this data is dated, it reflects the spending patterns to date. In 2018, for instance, approximate allocation to federal government-owned hospitals comprising university teaching hospitals, federal medical centers, and other federal medical institutions amounted to 231.7 billion naira. Although significantly higher today at 2.4 trillion, but please recalibrate giving accommodation for the devaluation of the naira. This figure represents about 5.18% of our total budget, of which 92.4% is expended on recurrent items, personal costs, overheads, and curiously, vehicles and travels are a significant portion of this. Access to healthcare facilities and shortage of healthcare professionals. Besides issues mentioned earlier, inadequate funding and misplaced application of funds, access to healthcare facilities, and debilitating shortage of healthcare professionals is also a hindrance. Many facilities, especially in our rural areas, lack basic health infrastructure. Primary healthcare centers are often dilapidated with a near absence of functional or outdated equipment. With a doctor-to-patient ratio of 1 doctor to 5,000 patients, far below the WHO recommended ratio of 1 doctor to 1,000, or a low nurse-patient ratio of 1 to 2,500. With these alarming shortages, the impact is felt more in our rural areas as professionals tend, for obvious reasons, concentrate in urban areas. Of course, it need not be stated that specialists such as surgeons, anesthesiologists, obstetricians, etc., are particularly rare in our rural areas. Dismal management. Hardly spoken of. Management is a science for which health professionals are rarely equipped to handle. This is largely responsible for the failures of most government-owned health facilities across the country. Hospital management ought to be included in medical teaching curriculum, at least to the diploma levels. When it comes to attitudes and corruption, no lecture can accommodate these shortcomings. However, a near absence of consequences is, to my reasoning, the continuance of these failures. Now, having addressed some of the challenges to unlocking the value chain in our health system, perhaps we should now turn our attention to the partnership that would make the system work. The near absence of affordable credit has plagued our entire private sector pursuits. It's inconceivable that credit costs today range anywhere from 35 to 40% where available. This has stifled growth generally and is particularly more felt in the health sector, which is seen as a quasi-social service. Private medical practitioners can hardly exist in this difficult environment and remain in practice. Recent reports of diaspora doctors relocating back to their foreign base due to their inability to survive the economic environment abound, and I'm sure certainly familiar to this audience. Manpower shortages and translocation amongst health workers, particularly young doctors and nurses, to more conducive and fulfilling environments have typified our nation's lot in recent years. Nigeria has lost to translocation about 16,000 doctors and about the same number of nurses in the past 5 years alone. Very poor remuneration, and this was mentioned by the Secretary to the State Government. Very poor remuneration and working environment has been the primary reason. The urgent need to train more health personnel, expand teaching and clinical facilities, such as adding training to existing general and select private hospitals under supervision, is critical to bridging this gap. This has also to be applied concurrently with better remuneration and working environment, not only to attract but retain professionals in the field. Ordinarily, teachers and health professionals ought to be the best paid sector workers in the country. Starting a doctor or a nurse at a meager monthly wage of 150,000 naira or $100 equivalent or less, be rest assured he or she is just bidding time while seeking an avenue to relocate to greener pastures. So how do we fund this sector and strengthen clinical governance in the shared partnership to unlock the value chain towards achieving better healthcare and innovative solutions to our peculiar challenges? Firstly, availability of capital. At this point, it will be foolhardy to expect the government budgetary allocation to achieve the WHO stated target of 15%. Even that figure is subjective. How was it arrived at? Using which parameters? Was it population, size of the GDP? What exactly determined the 15%? Or was it a figure randomly stated to assure the importance of the health sector? Without belaboring the point, the answer lies before us and its framework is already in place. But as usual, our knee-jerk or tepid implementation and a lack of political will is a deterrence to achieving the goal. Simply put, insurance. Our national health insurance scheme is the panacea to the issue of funding. Let me state here that contrary to the popular parlance that health is wealth, no, health is everything, and therefore nothing should be spared to achieve the status of a healthy citizenry. As earlier stated, the role of government in the structure of governance is to ensure the utmost productivity of its citizens, a sound mind in a healthy body catalyzed by the requisite infrastructure. We therefore ought to devise a seamless way of ensuring full insurance coverage. Seamless because citizens warily subject themselves to any form of taxation or deductions. An idea that has been floated around for a while now that is awaiting the political will for implementation is using telecommunication companies as a collection mechanism. Through the compulsory registration of every citizen, or as many citizens as we can, with a health maintenance organization, HMO, an attachment to a provider hospital, a certain amount could be added to your phone charges. And this is designated as your contribution to your health insurance premium. Let me run this through an example here. Our fictional beneficiary will be a lady known as Shade, registered with Bell HMO and attached to John Brown Hospital. The average cost of a phone call in Nigeria today is about 14 naira per minute. Let us up it to 19 naira. The added 5 naira is redirected as premium to Bell HMO. That way, payment is made continually towards Shade's premium each time she makes a call. The details can be fleshed out, and a whole lecture may be required to detail how this works. But to my mind, this is an easy and seamless collection method. Now, Nigeria has approximately 157.3 million mobile subscribers shared between its 4 major telco services, MTN, Airtel, Glaucoma, and 9 Mobile, and their market shares in that order. Total estimated revenue from the telcos for 2025 is put at about $9.5 billion. An additional 5 naira will generate approximately 6 billion towards health insurance premiums, or 9 trillion naira. This far exceeds our current federal budget allocation of 2.4 trillion to the health sector. Combined and added to state and local government allocations, it no doubt becomes a sizable contribution to the health sector, further enabling the unlocking of the value chain. Firstly, thank you. Firstly, our nation has to deal with the unreasonable cost of credit, striving to bring it within the single digit and reasonable tenure to encourage growth in all sectors, not just the medical sector, but in all sectors. Because you see, each citizen that is not productive is parasitic. That person is living off the goodwill of some other person. Secondly, with an estimated 9 trillion in insurance receipts alone, and this is only one example of accruing capital for the health insurance industry, there is a larger likelihood that services rendered to the recipients of this sector can be paid for, thus attracting further investment into the sector and expanding access to underserved populations, particularly in our rural communities. Thirdly, encouraging specialization in medical practice. Fourth, with this in place, major international health insurers such as Cigna Global, Joe Blue, Bupa, etc., will then take more than a cursory interest in the Nigerian health sector, and are encouraged to invest in health infrastructure, manufacturing, and consumables, manufacturing of consumables and equipments. 5, research and grants will be unlocked as the nation is now perceived to have a viable health industry. 6, innovations and best practices are encouraged as competition sets in the desire to attract capital and revenues, as has been exemplified by the banking industry. And 7, clinical governance is improved as patients now have the choice to attach to hospitals and health centers that provide better services. That phone is a bit loud, sir. Let me note that the federal government has recently taken a very decisive step in addressing these issues. With the launch of the Presidential Initiative for Unlocking the Health Value Chain, aimed at transforming the healthcare ecosystem, its objectives being to encourage domestic manufacturing of pharmaceuticals and medical devices and consumables, job creation in the medical sphere, reduced to the barest minimum medical tourism, and the promotion of innovation and research. All this in partnership with your association in part. This again is tied to our ability to make affordable credit available. And as earlier stated, and the Minister of State spoke about this to some detail, we could also borrow a leaf from India, which has succeeded in attracting its huge diaspora medical manpower. India offered free urban land, tax-free status, a special credit regime at lower interest rates, and a longer tenure, including priority repatriation of funds to incentivize diaspora return or investment in the medical field. We equally have a large pool of medical diaspora manpower that we could tap into. With this foundation in place, the Association of Nigerian Private Medical Practitioners is strengthened in collaboration with governments at all levels to advocate for policies that support the growth of private and public healthcare providers, establish and enforce quality standards, contribute towards the building of capacity and admitting students for clinical training in private facilities, thus improving skills and service delivery, fostering partnerships between association members and the government to improve and increase access to health care. One significant outcome of this policy would be the reversal of the current brain drain in the sector and the encouragement of the thousands of Nigerian health personnel who had earlier translocated to return. The intertwine between local and foreign-based or surgeoned medical personnel can only augur well for the improvement of our nation's overall healthcare system. Distinguished ladies and gentlemen, I thank you.
Thank you, sir. Ladies and gentlemen, please let's keep clapping, let's keep clapping. A very beautiful address by our very own Dr. Donald Duke.
Thank you very much. While Dr. Donald Duke is exchanging pleasantries with members of the high table, may I equally invite him to step down the step to receive a plaque of appreciation as prepared by the Association of Nigeria Private Medical Practitioners. To present this award is the chairman of today's occasion, my father and namesake. You know, some father will name their child, they will say junior. So he's the senior, I'm the junior. His Excellency Otumba Gbenga Daniel will be presenting the plaque. With the Honorable Minister, okay. His Excellency, the former governor and distinguished senator will be presenting with the Honorable Minister of State of Health. And the President said, I am the observer.
Well, this is another executive order that I have to do. Well, it's an honor for me to take an order from my boss, my former boss, and also present this very beautiful plaque to another very good, impactful former governor from Cross River State. On behalf of myself and Senator Otumba Gbenga Daniel, I present the plaque.
Daniel. Ọ̀rẹ́ mi ni wọ́n láyé ọ̀tá rẹ̀ ọ̀tá wa ni. Gbenga Daniel
Ladies and gentlemen, please a round of applause for that beautiful award presentation. Our surgeon, sir. Please, sir, please come forward. Thank you very much. Representing the Secretary to the Secretary to the Federation, sir. Daddy, please come forward for the award presentation. Thank you very much. To present this award is by our very own surgeon, sir.
Yeah. Mr. MC, I think the word is Surgeon Commodore is just a title for medical practitioners in the Nigerian Navy. It's taken after the British tradition. Thank you, sir. So, yes, I'm privileged. Okay, sir. No, sir, no problem. I'm privileged to present this plaque for you on behalf of the Association of Nigerian Private Medical Practitioners for your presence in honoring their invitation, and at the same time for the support you have been giving to the association and for future support too. Please find a very, very open place in your office or home so that you place it there to remind you of your presence in our midst today. Thank you very much, sir.
A better round of applause to both the recipient and the presenter of this award. I appreciate you. Thank you so much. I want to commend the Association of Nigeria Private Medical Practitioners for this program. And right now, Your Excellencies, distinguished participants, ladies and gentlemen, I hope you are ready to receive the long-awaited speech of this conference, and that is the chairman's speech. All right, ladies and gentlemen, we're going to invite the Akarigo of Remoland, Oba Dr. Babatunde Adewale Ajayi, CON, and is represented by the Ologere of Ogere, Oba Obafemi Saliu, Ejekasheka BSO. The Alayeliwa will be coming to deliver a goodwill message in 2 minutes. Thank you very much, KBSU.
Thank you, Mr. MC. Thank you. His Excellency, the Governor of Ogun State, Prince Dr. Dapo Abiodun, MFR, ably represented by our own Mr. Tokumbo Talabi, His Excellency Otumba Engineer Senator Benga Daniel, His Excellency Dr. Donald Duke, the President, ANPMP, distinguished members of the Association of Nigerian Private Medical Practitioners, esteemed guests, ladies and gentlemen. It is with great honor that I stand before you today to represent His Royal Majesty Oba Dr. Babatunde Adewale Ajayi, FCA, CFR, the Akarigo and paramount ruler of Remoland. The Akarigo sent his greetings and goodwill message as the royal father of this event. On his behalf, I commend the association for
its unwavering dedication to the advancement of healthcare in Nigeria. Your tireless commitment to providing quality medical services, even in the face of numerous challenges, is a testament to your professionalism, compassion, and patriotism. The impact of your work resonates deeply in our communities, and for that we are truly grateful. Furthermore, we implore the association, all stakeholders and financial institutions to invest more in private healthcare infrastructure and services within the country. It is our collective hope that through such commitments, we can eradicate the unfortunate necessity for our citizens to travel abroad in search of quality medical treatments. Nigeria is blessed with brilliant minds and capable hands. What is needed is the enabling environment and resources for us to thrive and deliver world-class healthcare services right here at home. And with an association like this, we are very hopeful. As you deliberate and share knowledge during this 47th Annual General Meeting and International Conference, may your discussions yield innovative solutions that will further strengthen our healthcare system. On behalf of the good people of Remoland, we extend our heartfelt goodwill. May this conference be fruitful, and may your noble efforts continue to uplift our nation. God bless ANPMP. God bless Ogun State. God bless our dear Nigeria. Thank you all.
Ọmọ onípàgádà mo kí o.
Ẹ jẹ́ ká ṣe kábíyèsí o.
Ọba mi kí ọba àgárí gbogbo rẹ̀ mo ní ẹ bá mi kí wàláhì bẹ́ẹ̀ bá dé fẹ́ àbúrẹ́ odidi àdúgbò kan ní Rẹ́mọ.
Thank you very
much.
Thank you so much, sir. Right now, as earlier said, I hope we are ready to take the long-awaited chairman's speech on this occasion. And as you're all aware, the chairman today is a politician, a political mathematician, an example of good governance, an administrator par excellence, a state manager of human and material resources, a highly cerebral engineer, a father and a leader. When you look up there, you will see him, and when you also check the grassroots, you will see his footstep in the remotest spots where his people could be found. A former and two-term governor of Ogun State and senator of the Federal Republic, representing the good people of Ogun East Senatorial District. He is the chairman Senate Committee on Navy, and the newest, I would say, the co-promoter of the coming Ijebu State. Ladies and gentlemen, I want to welcome to deliver the chairman's speech, Otumba Engineer Justus Olugbenga Daniel, FNSC, to come forward and deliver the chairman's address.
Olugbenga Daniel!
Thank you. Thank you very much.
Olugbenga Daniel. ní onímọ̀ fún ọ̀ṣọ́ wíire fọ́ọ̀rẹ́ àwíyá fọ̀yẹ́ lolúfẹ́ ẹ̀fọ́ gbangba lóru ọdẹ pẹ̀rùn ògèdè gbélẹ̀ràn bàdà ọmọ ẹlẹ́ni àtẹ̀ká ọmọ ẹlẹ́ni ẹlẹ́ẹ̀lẹ́ bí n bá wí pé wọn ní ìjẹsà bẹ́ẹ̀ ní tó ní wọ́n mi lẹ́ òbí tẹ́ni gbọ́dá wọn máa gbọ́dọ̀ kúrò ní mo yọ lẹ́lẹ́ lóró ẹlẹ́fọ̀n.
Thank you very much. Your Excellency, Governor Emeritus. Your Excellency, Par Excellence Governor Emeritus Donald Duke, I want to first and foremost thank you for being present here, giving us quality time, and as usual, delivering your typical iconic lecture. Thank you very much. Our dear Honorable Minister, I must especially thank you for, together with your twin brother, facilitating and ensuring that this conference is held here in Abeokuta, capital of Ogun State. And in particular, within the vicinity of the conference hotel. I'm not unaware why you are doing this. I know it's your own way of extending patronage to an initiative that has turned around Abeokuta as our state capital. Thank you very much. Representative of the military, thank you very much for coming and adding color. And of course, to all our royalties here, in particular, Kabisi, the Ologere of Ogere, who is representing of Remo Land, the Akarigo of Remo Land. Thank you very much. Before I go on, let me first render apologies for my late arrival. I'm aware that I'm supposed to chair this session, but we lost an iconic Senator Ayo Otegbola, who was one of the founding leaders in politics in this Ogun State, and today he's married. So I had no choice but to quickly show my face at the church in Lagos, and once I had an opportunity, I sneaked out to come and be with you. Please accept my apologies. Members of this great association, the Association of Nigerian Private Medical Practitioners, ANPMP, congratulate you on the occasion of this 47th anniversary conference and AGM. I remember that as governor a few years ago, this same association, and Dr. Kukoyi whispered to me that they feel quite excited how that event went, and I'm sure even happier today that they have returned to Ogun State. I also want to thank you for the various awards that you have been giving to the people, including our governor, our minister, and a number of people who have added value to private medical in our country. Without any doubt, it's still a long way. I am told that we have about 10,000 members of this great association across the length and breadth of Nigeria. That is indeed a community that nobody can toy with. But more than anything else, it's quite clear that with about 200 million Nigerians, we are not yet there in terms of Medicare support. And part of the problems that I know we have not been able to find a solution for is the brain drain, which clearly is affecting this industry. And I cannot extricate myself from responsibility, because whether we like it or not, government directly or indirectly indeed have a responsibility to stem the tide of brain drain that appears to be plaguing the environment. That is not to say that there are no good sides to this brain drain. On the other hand, we've had a number of our people who haven't gone abroad have been able to contribute their own quota economically to development of this country through the funds they transfer to us. But what is intriguing to a number of us is that when you have opportunity to visit some of the institutions, medical institutions abroad, you are confronted with a large chunk of our people who are in charge. The best surgeons you'll find in hospitals in Britain, in the US, many of them, if they are not Indians, they are Nigerians. So it means that without any doubt, there is indeed inherent talent that is embedded in this profession. I can only continue to plead that government in and out should continue to do whatever is needful and necessary to stem the tide of this drain. Part of what I think needed to be done, in my own opinion, is to probably separate Medicare profession from the typical civil service rules and regulations in terms of remuneration. Because without any doubt, I do not pray for anybody to get ill. But when you are sick, nothing else matters, because you are in between heaven and earth. And you therefore desire that you have the best in terms of treatment. So how do you expect a medical practitioner who is hungry and angry to give his best? So I think without any doubt, if there is one thing that needs to be taken out of the core civil servant in terms of remuneration, it is the medical protection. I'm aware that attempts are being made to introduce medical insurance and something that looks like the NHS, which is very common in Europe and elsewhere. I think this is important, but has to be attached to our statistics and data as a people. Part of the problem that we do have is being able to actually evaluate who is who. Who are the real Nigerians who are entitled to one thing or the other? And I feel that until we're able to get our database right, it's going to be very, very difficult for us to make progress in this area. So to this extent, I'm hoping that the census that is now being planned will probably, for the first time in history of our country, tell us how many Nigerians do we have, who are they, where are they located, what is their profession, and so on and so forth. I think this is very, very important if we are to make progress in terms of medical assurance, which is a prerequisite for success in this environment. I'm not unaware that there are regulatory issues and also litigation issues. And the only thing that we can do is continue to educate ourselves. We should do more more like this, lectures like the one Donald Duke has delivered today, that continues to actually educate us so that we know where and what we are facing. That also is linked to tax and levies. Yes, government has need to collect taxes and levies from time to time, but I'm also aware that sometimes our medical locations are overtaxed and we have issues of multiple taxations. So you do pay to federal to state government, you do income tax to federal government, the local government will not let you rest, they will bring one levy or the other, one license or the other, and so on and so forth. So I believe that again, there has to be some kind of sanity in terms of the multiple taxes that are slammed on your on your efforts. There are quite a number of things that we can continue to talk about on our own at the level of the National Assembly. We've tried in our own little way. Without being selfish, I've just told the minister that in Ogun State, there is only one federal medical center here in Abeokuta. And from the other side where I represent, yes, we have a general hospital in Shagamu. We are happy that it's running well. But there is nothing in Ijebu land. And so I've been whispering to the minister that he should help us to ensure that a federal medical center can be activated in Ijebu land. And the minister has promised me that he will use his position to ensure everything and anything that is possible to make this. Please help me clap for the minister. I can assure the minister, I have already presented a bill last year for the establishment of this federal medical center. So we will push it from the legislative arm, and we hope that he will put the executive stamp so that it can become a reality. So, one bill that I have put up at the National Assembly, it is Terminal Diseases Funding Bill. It has gone to the first and is now at the level of the second reading. The reason for me is not too far-fetched. In our country, once you are confronted with a terminal disease, it is like signing your death warrant. And everybody personally will have given up on you. It's not all terminal diseases that are terminal. Some of these conditions can be reversed if there is funding. But we found instances when whole families have become poor. They've sold their properties, they've done everything humanly possible just to support a member of the family who has been declared to have a terminal disease. I think if we can reroute some of them, for instance, I read a few days ago that about 5 banks have declared profits running into trillions of naira. And I think that a fraction of this, if, for instance, put at the service of this kind of fund, that fund is still going to be in the bank, it will render interest, they can still use it, but when people have this challenge of diseases, that fund can be available to support that. So I have put that bill at the National Assembly. I'm hoping that by the grace of God, something will happen. We can Thank you very much. We can go on and on and on. There are so many other areas that require attention, but the way to go we are doing here today, when you sit like this and you have you're bringing all stakeholders together, without any doubt, you're loud and it will be loud. So my recommendation is that at the end of this meeting, you should not fail to have what you can call a resolution. And such a resolution weighs no time in passing it to the executive and to the legislature. If you are 10,000 strong professionals, I think you are a force to be reckoned with and should not underestimate your capacity. Once again, thank you very much and God bless you.
With
a standing ovation, let's keep clapping for His Excellency. Thank you very much. Let's keep clapping till he gets to his seat. That's the chairman of this beautiful occasion. Thank you.
Baba,
thank you so much. Let's have our seats. Thank you. Thank you, everybody. Thank you very much. I have an information to give us very quickly. We have exciting raffle draw. Get your ticket now for a chance to win amazing prizes. First prize, 43 Smart TV. Second prize, 195L double door freezer, deep freezer and fridge. Third prize, rechargeable mist water fan, and lots of consolation prizes to be won, including thermometers, stethoscopes, syringe boxes of face masks, theater caps and others. Don't miss out. Enter today and let's lock your lock quickly. Draw for the draw date is Variety Night, Friday, 25th of April, 2025. The ticket costs just 1,000 naira only. Feel free to buy as many tickets as you want to boost your chance to be a winner. Grab your copy before it's too late. Tickets are already available at the registration stand and will be available at the Cultural Center tonight. Cash will not be accepted, only transfers and POS transactions for Money Point and the rest. Thank you very much, ladies and gentlemen.
Gbẹ̀ngà tí ń ṣàánú mi ọjọ́ tó pẹ́ ní ti ń ṣe tiwa ní ti ń fún mi lówó tí ń fún mi lóúnjẹ ọjọ́ tó pẹ́ ní. Wàláhì Ọlọ́run ọba ò ní bá ọ jẹ́ láyé Olúwa Gbẹ̀ngà ọmọ Daniel. Ikú dákun mọ́ pàlánù mi Gbẹ̀ngà Daniel. Èmi ń fẹ́ ti yín, ẹ̀yin ń fẹ́ tiwa, tiẹ̀ náà ò ní dìbàjẹ́ o. Ẹ̀yin ń fẹ́ tiwa. Ṣé kí n wá abẹ́ máa rán mọ́ wá?
Wọ́n máa rán yàn wá.
Ọkàn mi ti balẹ̀.
Wọ́n náà máa rán yàn wá sí.
Owó Gbẹ̀ngà nìkan ti tó fún mi.
So, Your Excellencies, very distinguished guests, ladies and gentlemen, ladies and gentlemen, to do the vote of thanks, Dr. Ike Odo, immediate past president. Please, a round of applause for him as he comes forward. Please, let's keep clapping. He is another reputable personality. Thank you very much, sir. You're very much welcome. He's giving us the vote of thanks. Please, a round of applause for him. Thank you.
ANPMP. ANPMP. The chairman of the occasion, a typical Nigerian we're all proud of. You know, many times we live by what the papers say, and we believe only what we see on the TV. But once in a while, we are privileged to see in real life, flesh and blood, what the shakers and makers, the timbers and the calibers those on whose shoulders the entity Nigeria has stood, those who have defended the integrity of this country and given it a path to this day. I'm referring to the chairman of this occasion and the men around him, the governor of the state, who is eminently represented, the chief of staff, who is also here. And I was at Tinapa some time ago, and here I am seeing Tinapa in flesh and blood. Unfortunately, that great dream, that millennial dream, a dream of the future, a dream that had the potential of transforming not just Cross River State, but this country into another commercial hub, is now sleeping and indeed in coma. I don't know how Our Excellency feels, but sir, I weep for you. I weep for our country, but I congratulate your visionary leadership. I thank all the members of the high table, the NMH president, the MDCAN president, and all the great men that have left here in the course of this occasion. Our own president, Dr. K. Adeshola, who has worked tirelessly, fighting enemies known and enemies unknown, speaking in language men understood and even language only the spirits understand, to bring us to where we are today. My president, I thank you. I thank all our guests, friends, even the men from the diaspora who have sent greetings because they're not able to be here physically. I thank the press. I thank our staff. I thank the Ogu team. When I came into, when I stepped into Ogu yesterday, I said, oh, Lagos has truly entered Ogun State. Abeokuta is no doubt another Lagos State. So I thank our team here, and I thank all our dogged, resilient members. These are the men and women, Honorable Minister for Health. In a very special way, I honor you, and I welcome you to Ogun State, and appreciate you for the respect you have given to your doctors. Because it is not all the time we have this privilege. Times in the past, we've been looked down upon, maybe in quotes, but we have to struggle and struggle and struggle, and yet we were told how easily the Honorable Minister was willing to be here, and he made it possible to be here. We deeply appreciate you, sir. And I'm presenting before you the Nigerian doctors, private doctors. If you listen to our creed, you have heard that indeed they are the ones sustaining 70–80% of the healthcare delivery of this great country. And yet, it pains when we realize that when the issues of healthcare come to the table, the hewers of wood, the fetchers of water, in fact, the life wire, the heartbeat of the industry is kept aside. And we're happy today we have a friend in you. We listen to you. We have heard you. And so we know that the journey is not over. It has rather just begun. And that the federal government of Nigeria will hear more. They will indeed do more. But these are the people keeping the health care of this country alive. I thank all my colleagues. You are the champions of this industry. You are the hope of the healthcare system. You are the future of Nigerian prosperity. I thank everybody that has been part of this great success. So on behalf of the ANPMP and on behalf of our dear President, I thank all of us. And as you can see sitting before me, the BOT members, the fathers of the association. Torumolola is here, Eyimba is here. And as many as I'm not able to see, please pardon me. But just to say to you, you are great heroes. And Nigeria is proud of you. It has been tough. It may get tougher. But we must remain strong, resilient, and believing that, yes, because we believe, and because we remain committed, we will all not japa. Instead, those who have japa will come back. Because if you put our house in order, we'll make this country great again. Thank you, and God bless you. It's okay. It's okay. Thank you.
Thank you very much. Those who have japa, we begin to japa when everything that the distinguished senator has said. So right now we will take the national anthem, and after that members of the high table will step down the podium for a group photograph, and after the first shot we will have the national ESCO, we have the state ESCO, we have LOC, and all of the Cs and OCs. So right now we rise as we take the national anthem. Thank you very much. So we want to invite the members of the high table, Your Excellencies, Honorable Minister, the Service Chief, the representative of the SGF, the President and Chairman of Council, to please come down steps for the group photographs. And after that, we will have other distinguished guests.
Aṣáájú àgbọ̀n kọ́ ṣé ń bẹ̀rẹ̀ aláàbíyà àràbámi àkànbí bàbá ìyálẹ́jà mi kọ́ ọkọ̀ olúrẹ̀mí àkànbí kọ́ ṣé ń bẹ̀rẹ̀ aláàbíyà àrà ìyáwó àkànbí èmi tó fẹ́ kó tú àwọn abánigbé bí nínú lára.
Thank you very much. Ẹ̀gbọ́n wa Jóbíewé, thank you so much. All the newly inaugurated or inducted fellows who are still in their gowns, if you can come fast, you will have opportunity of a group photograph, and if not, we will be taking the other ones sometimes later.
We are the largest providers of healthcare.
Adékúnlé ọmọ ìsàlẹ̀ ọba ń kíbi inú òun kan wà láàrin àìsíwájú mi. Ọdún wo ni ọba mi kí? Báńkì àìsíwájú àgbàjọ ọmọ ìyálọ́jà àbọ̀ òwò ayélujára ọkọ̀ olúrẹ̀ ní àgbà òwú kọ́.
ANPMP, we
Adéjọpẹ́ ọmọ olóògbé àbá ọmọ òyìnlá. Àkàbí tó torí ìlẹ̀kẹ̀ bá ọmọ ọmọ wa bàbá wa tó ti jẹ wẹ́wẹ́ báwọn lọ́wọ́ bọ̀. Epo yọ ọmọ àgbáyé. Ìyànjú lọ́lọ́ aláta ẹ̀yìn ọmọ àkúndò ọmọ àṣọ̀ṣe fún wa kàkàkà ìgbàlùwọ̀ ọ̀rọ̀. Báńkà pàlú ìwọ̀ ìgbàdégbò Adékúnlé Bàlá ọ̀rọ̀ ìjẹ́kẹ́ ìjábọ̀. Èèyàn ọmọ Daniel ọba mi ká àkànbí mi bẹ́ẹ̀ gbàdélé aṣáájú yàgà bàbá mú gbadé gbọ́kọ̀ ọmọ olóògbé àkànjọ́ ọmọ bàbí àkànbí dàbá ọmọ òyìnbá.
The east and western
káàkiri bó wáyé Dr. Sunday any more love
we are available.
Running ìránṣẹ́ omi òun any more ìyáṣẹ́ ìránṣẹ́.
We are available.
Ìwọ lọ pé kó lọ sí wáìpé.
We are the largest provider.
Wọ́n lọ pé òkú wá kù. Wọ́n lọ pé ayélujára rẹ̀ mú bàbá náà níbi tó tó wá sí ìdílé àìsíbọ̀rọ̀ ọba gbàgbà.
We are the Association of Nigerian Private Medical Practitioners, ANPMP forever. ANPMP, we are greater together. From the east down to the west and south and north.
Adékúnlé ọmọ Ìgbàlàpọ̀.
We work every day and night. That Nigeria may be.
Kúnlé Ìgbàlàpọ̀ sórí bàtàdọ̀ bàbá mi.
We are the largest provider.
Ọmọ owó ilé yóò mú ẹ̀yà òkú fún ayọ̀.
We are accessible.
Èmi ìwé òkú fún ẹ̀sọ́ ìwé Èmi ìwé ẹni arákànní ìdíjà òṣàgbà ṣàgbà òkú tó máa ní ìlú.
To our confluence, heritage.
Òkúlẹ̀yà ẹ̀dúró náà ta ló bá mi rọ́mọ bàbá mi. Ta ló bá mi rọ́mọ ìyá mi.
Hello. Please, NOC members, please come forward for your picture. NOC members, please come forward for your picture. NOC member, inside, outside, please come to the front here. Please come to the front here.
Ta ló bá mi rọ́mọ bàbá mi. Ọmọ wọn níta pé mi máa bọ̀ lọ́dọ̀ mi. Dókítà ọ̀sẹ̀ mi ní àwọn àjọpọ̀ mi. Ọ̀nà fún ọmọ òṣèlú. Òkè ìkọlà ọmọ àkókò àpò ìdèdè lálàdé wa òkú ládé. Ọ̀nà fún ìlẹ́lẹ̀ ìrẹ̀lẹ̀ ìyá ìgbéra ìgbésẹ̀.
Please, everybody should come inside for lunch. If you are a delegate, please come inside for lunch now. They are serving lunch now. Please come inside. NOC members, please come to the front here. NOC members, please come to the front. I just need a minute of your time. Please, everybody should try and sit down as we begin to serve the lunch.
Bàbá arówó méjì á sì jẹun. Wálé ẹ̀wá náà lé ẹ̀wá jẹun. Gani ẹ̀wá náà lé ẹ̀wá jẹun. Ọmọ ọ̀rọ̀ fún ọmọ òkú yìí. Ìlàmú ọ̀rọ̀ tí ọ̀rọ̀ fún
Ọ̀bárí káyé. Equitable health coverage is our cream.
LOC members, we are still waiting for you. LOC, the chairman is here. LOC members, the chairman is here. LOC members want to take our picture now.
We are
LOC chairman is coming inside.
practitioners. ANPMP.
LOC chairman, please come inside.
ANPMP.
Please.
From the east down to the west, the south and north. We are the gatekeepers of our people's health. We work every day and night. We are available.
LOC members, please come inside. LOC members. Ọmọ rẹ̀ ọ̀ṣọ́kọ̀ ìgbésí ayé àgbà kárí ló. Ọ̀nà tó lè dá ọmọ òkú yìí. Ọmọ òkú yìí lọ́wọ́ ọmọ àgbẹ̀wọ̀n wá kó bèbí lálàdé wà ọmọ àbàtì ẹ̀yẹ. Ọ̀nà tó fi iṣẹ́ lóye ọ̀dà gbé ọmọ àgbẹ̀wọ̀n ayé. Dr. Adanle Koko. Our own Dr. Adanle Koko. Fún wọn ṣẹ́gun ìlẹ̀kùn alára bàbá òun. Ojú ọ̀rọ̀ ló ti dẹ́kun kan ṣe ń jẹ. Bàbá ìlara ti jáwọ́ ní àìsàn ní wọn. Ewúrẹ́ ìlànà ìjẹ́ lẹ́sẹ̀ ẹ̀fà ìgbòrí àgùntàn ìlàjẹ́ ẹ̀jẹ̀ ìyára. Àkókò kàkà ìdí ìkọlá lè lo ìlàjọ́sí. Owó ṣèwé ìmọ̀yàn ọ̀gbọ̀dì ọ̀gbọ̀n ra èrò gbóló tó mú lọ́rí. Ọjọ́ ọ̀ràn tó ti ń gbòdò èyí ní jẹ́mọ́. Gbogbo ilé ìjọba wá jẹ́ lórí ṣe wá lọ́pọ̀ òkè máa pọ̀ ní bàbá wọ̀ ọ̀rọ̀ gbóhùnmọ́ òkúyè.
We are the Association of Nigerian Private
Dr.
Medical
Sunday
Practitioners.
ẹni mọ̀ láti mi dà.
ANPMP.
Ẹ bá mi kí ọmọ wọn ní Kogi. Ṣé àbúrò wa ọmọ adájọ́ owó rẹ̀ máa ń fi ọ̀ọ́dún ẹ̀rù gbèjò. Àbúrò ìfẹ́ ló là fún bàbá ilé ìfẹ́ ẹ̀kọ́. Ọmọ ìfẹ́ òṣìṣẹ́ Please, we want everybody seated. Don't go there to collect your food. Please sit down so that we can start serving roll by roll. Please sit down. Please, let's hurry up. Let's hurry up. It's time for lunch. We have a lot of things to say. Sunday, very more láti ìlú. Ẹni mọ̀ láti ìlú Sunday olówó Please sit down. Please let us sit down. Please let us sit down. We want to start serving the food.
We are available.
Ọláréwájú gbàdé ìgbàdá. Wálé ọlọ́pàá ẹ̀dá nǹkan ní kóró wà ọ̀yẹ́ lọ́ọ̀mẹ́rin ó máa wà ìdàgbàjáde àgbèrè.
Thank you, distinguished doctors, the Association of the Private Medical Practitioners of Nigeria. My slides, please. My slides, please. Please, who has my slides? My name is Okoyemi Ogunbere. I work for Biogenerics as a marketing manager. Just want to very quickly talk to us about, next slide, please. Next slide. maximizing iron absorption with Globifar. I would like to stand on existing protocols and to go ahead with this presentation. Next slide, please. Next slide. Iron is important, and we know we cannot tolerate it. Next slide. From oxygen transport to even DNA repair. Now, iron hemostasis. One thing that is unique about iron is that iron is all about absorption. There is no particular body mechanism for excreting iron. So, iron balance control is basically all about absorption, absorption, absorption. Next slide. Now, epsidin. This is the principal regulator in iron hemostasis. When you are thinking of iron hemostasis, you think of epsidin. What does epsidin do? Epsidin basically regulates iron absorption. When the body has enough iron, epsidin is released to stop the oral absorption of iron. Now, when the body is deficient in iron, epsidin is withdrawn so that iron can actually be taken in. Next slide. So please, if I'm too fast, please slow me down. And if I'm too slow, hurry me up. And if I'm boring, please let me know. So there are two forms of dietary iron. There's the heme ion and the non-heme ion. Next slide. We'll be looking at that very soon. Yes, iron absorption. Now, when it comes to iron absorption, the topic we're looking at is maximizing iron absorption with Globifar. What are we trying to look at here? We're trying to look at the two types of dietary iron and the absorption they face. There is the heme ion, which is from hemoglobin or myoglobin. If you look at the your left-hand side of the slide, you see the globin. Epsidin has, the heme ion has a special carrier. That's the heme ion protein that takes in heme into the cell, and then it's broken down, and then iron is released. Whereas the non-heme ion, which we are very familiar with, the ferrous, sulfate, and the rest, you see that it has quite a number of challenges with absorption. Next slide, please. I'm running very fast because of our time. Now, what are the factors that affect non-heme absorption? There are things like inhibitors, where there's things like H2 blockers, that's the things that the antacids that you have, proton pump inhibitors, all these things, anything that increases the alkalinity of the stomach reduces iron absorption. Now, there are other metals that compete with iron, things like lead, cobalt, strontium, manganese. That is, the idea is that when you have iron and these other divalent metals in the system, they compete for the carrier protein, because the divalent metal transporter 1 is actually a non-specific transporter for all divalent metals, and it has the least affinity for iron. So when other divalent metals are present, taking in iron becomes a problem, becomes a challenge. So these are things that compete. Not only that, when there are things that enhance iron absorption, things like vitamin C, things like proteins and all that. Next slide, please. Next slide. These are symptoms of iron deficiency, which as doctors we know and we see almost on daily basis. Now, if there's a challenge with iron absorption, if there's a challenge with and things like that, we'll try to look at correcting anemia. Now, anemia is a challenge. If not corrected, it becomes a problem. And because of the fact that you're having anemia coming up from time to time in people, you need to correct it. Next slide. Now, next slide. If you are going to correct anemia, you are thinking of iron replacement therapy. It can be done via the IV route or the oral route. Next slide. Next slide, please. Now, what are the challenges that come with correcting iron deficiency? Part of it is the poor absorption. It's we know that oral absorption for iron is about 1 to 10%, and that's quite a challenge. Not only that, there are unpleasant GI effects. When people take in iron, some of them complain of stomach upset, nausea, constipation, and not only that, some people complain of blackening of the stool. Everybody that takes oral iron talks about blackening of the stool, and so because of that, you see some patients not complying, and because they don't comply, they don't get recovery out of anemia correction on time, and that leads to longer duration of treatment. Yes, foods rich in calcium, bran, they also limit iron absorption. Next slide. Other medicines such as calcium, things like coffee, tea, cocoa, food, all these things slow down and reduce iron absorption. Not only that, if you're going to use IV, venous access, some patients' veins are so small, to get them becomes a challenge. These are part of the challenges you face when you are trying to correct anemia via the oral or the IV route. Yes, next slide. And that brings us to Globifar 4th. The solution biogenesis are actually provided to overcome this challenge with iron absorption and correcting anemia, which we know could be quite threatening. Next slide. That's how the pack looks like. What is Globify? It's an heme non-heme ion combination, and we call it your ideal ion complex. Can you move next slide, please? What is Globify? Globify contains fortified heme ion, hemoglobin 5119, and ferrous sulfate 81 milligrams. Elemental ion in this drug is 18 milligram. Globify is a heme non-heme ion combination. So you have the heme ion, which is highly absorbed with very high absorption level, as well as the non-heme ion, which has the poor absorption level. Why are we doing this combination? Can you please move on, please? Next slide. So some stories behind Globify. The story of Globify started in Sweden, in Karolinska Institute, in which some people worked, and they actually discovered that heme ion has a better absorption compared to non-heme ion. Move on, please. Okay, now the principle behind Globify is this. It's actually been found in 1993. Ekman with Rosenstein, the prof that did initial work in Karolinska Institute, actually published this work, which can actually be assessed. The addition of heme ion to physiological doses of ferrous ion in a tablet can increase the amount of ion absorbed by as much as 40%. So we are looking at absorption that's usually 1, 2, or 3% being moved up to as much as 40%. Part of the reason why people have GI effect with iron is because a lot of it is not absorbed. And because a lot of it is not absorbed, the remaining unabsorbed iron causes GI irritations, blackens the stools, makes some patients uncomfortable even seeing the black stool. So if you can increase absorption of iron, you not only you shorten the duration of treatment, you increase the uptake of iron, and the patient recovers faster from anemia. So the addition of heme ion to physiological doses of ferrous iron in a tablet can increase the amount of iron absorbed by about 40%. Don't forget, we said at the beginning that iron is all about absorption. There's no mechanism for excreting iron. Next slide, please. So this is the work that was done, that was published in 1993 by Ekman. Please move on, next slide. So now we talk about epsidin being the chief regulator of iron absorption. Now in places in a normal patient, in you and I, when we have enough iron in our system, epsidin production is withdrawn. When we don't have enough iron, epsidin production, is increased so that iron can come in. Now, but in patients that have inflammatory conditions, for instance, chronic kidney disease patients, CKD patients with inflammatory conditions, so that inflammatory bowel disease, what you discover that even though these patients are starving of iron, they don't have enough iron, yet the body continues to pump out epsidin, and as such, you see that absorption of iron is very poor. That's why you discover that nephrologists do not depend on oral iron to correct anemia in their patients, because they know that absorption is poor for iron naturally. There is even worse in a CKD patients where epsidin levels is elevated. As long as epsidin levels are elevated, iron absorption is a no-no. It's not going to happen like that. And one thing we've discovered with Globify, epsidin does not affect Globify. Even though your patient is a CKD patient or a patient that has a chronic inflammatory condition, you should have very good iron absorption with. Let's move on. Next slide. So what are the indications of Globify? Basically, anywhere you need to take care of iron deficiency anemia is where you use Globify. So when there's iron deficiency or iron deficiency anemia, Globify is your go-to brand. So because there must be iron deficiency before anemia shows up. So you want to correct iron deficiency anemia, or you want to correct iron deficiency itself, Globify is actually the way to go. CKD patients, pregnant women, you know pregnant women need a lot of iron. This is very ideal for them because of the iron level and absorption is very high. Cancer patients that have chronic inflammatory conditions, patient that is recovering, a patient that wants to go for surgery and you just want to boost the blood level without either without maybe using IV iron, or a patient may not need blood transfusion before the surgery, it comes in handy. Post-surgical conditions, maybe after they've had their blood transfusion, they are done with the surgery, you want to send them home on something that will help to build up their blood, and you need an iron supplement, an iron preparation. Globify is actually the way to go. A patient that is recovering, anywhere you need iron to be supplied for the patient to boost and increase the blood level, Globify Forte is your way to go. Yes, next slide. How is Globify used? A tablet or 2 tablets daily. To correct anemia is 1 tablet twice a day. So to correct anemia, 2 tablets. To maintain, 1 tablet. So if a patient has anemia, you want to correct 1 tablet twice a day. Once you've reached the hemoglobin level you want, you can drop it to once a day. Next slide, please. So what do you expect in about 3 to 4 weeks, you expect the hemoglobin to rise by about 1 to 2 gram per DL. Next slide. So what are the side effects? Globify has placebo level side effects, and that's what I'm glad to tell you today, that with Globify you don't need to be afraid of the epigastric pain that you see with other iron preparations, the constipation, the diarrhea, the abdominal cramps. Next slide, please. So some clinical evidence. This was where we had Globify being administered to pregnant women that were anemic. And at the end of the day, what did you have? You have increased hemoglobin levels, ferritin level increased, T-cell levels increased, tolerability. No adverse effect was reported in this particular study done in Slovakia. Next slide. Now, this was done in this was Globify administered to pregnant women in Libya. And at the end of the day, if you look at the conclusion, Globify 4 has been found to be very suitable, effective, and convenient in treatment of iron deficiency anemia, even antenatal care. So, wherever you have to treat a pregnant one that has iron deficiency anemia, not folate, but once it's iron deficiency anemia, Globify is your go-to brand. Next slide, please. Now, when it comes to CKD patients, it could be a challenge. This is a study that actually looked at Globify, iron polypeptide like you have in Globify, and IV sucrose. So patients who are on IV sucrose, they were now stopped and moved to this oral preparation. And if you look at the conclusion, during the 6-month study period, iron polypeptide like you have in Globify successfully replaced IV iron in the majority of hemodialysis patients. That's why we say Globify is the power of IV iron in the tablet. Next slide. This was a comparison, a parallel study looking at IV iron and iron polypeptide like you have in Globify, and the conclusion was that it is similar in efficacy to IV iron. Next slide, please. So we say Globify is your ideal iron complex. Why Globify? Better hemoglobin levels, effective as IV administration, as the case may be. Globify is not affected by food. It's not affected by other medications. It offers shorter duration of treatment because absorption is excellent. Imagine a 40% absorption from 1 or 2, 3%. Excellent patient compliance. Does not color the stool, does not blacken the stool, does not give out the abdominal cramps that you see with other iron preparations. Globify is your go-to brand. Next, please. The challenges of IV, the patient has to come to the hospital, you have to set up, and then when you're administering IV sucrose, you need to, iron sucrose, you need to have the things that may cause them, the things like hydrocort, Promet, in case there's a reaction, and then they have to set up the line, and then you can't give, it's not intramuscular, it's IM, and it's slowly. So all the challenges that come with this kind of, with IV administration is curtailed. Next slide, please. So it has excellent tolerability. Patient, it does not affect the stool, does not disturb the stomach of the patient. Next slide. Next slide, please. So I come to the Globify equation. Why do this is my equation. No iron, no hemoglobin. You agree with me? And if there's no hemoglobin, there's no blood. And if there's no blood, there's no life. A bloodless human being is a lifeless human being. So, no iron, no life. Why? Because iron equals blood, and if blood equals life, according to the mathematicians, iron equals life. And interestingly, Globify equals iron because it gives you excellent iron absorption. Therefore, we say Globify equals life. And so in biogenetics, we say get Globify, get life for your patient. Next slide, please. Very quickly. Yes, go on. Next slide. So let's help our patients live life to the fullest. We have a beta erythropoietin, which comes in handy for CKD patients or people that need erythropoietin. Yes, next slide. Next slide. That's the 4,000 international units. These are telmisartan brands. We all have them at booth 40. Yes, next slide. We have a coamoxiclav combination. Next slide, 625 and 1 gram. Then we have the Neuracam. This coming when it comes to neuropathic pain. This is the flagship. This is a go-to brand when you have to take care of neuropathic pain. Next slide. Epoxin combines naproxen NSAID with a PPI. The way to go when you want to relieve pain and protect the GI of the patient. Next slide, please. Now, this is my final slide. I come back to my Globify equation. In biogenetics, we say Globify equals iron, and iron equals life. So they say, therefore, Globify equals life. Please, if you don't remember anything I've said from when I started till now, just remember one thing. Get Globify, get life. Get Globify, get life. Get Globify, get life. Thank you very much for this moment.
Thank you very much. Next to present will be representative of LB Pharma. Elizabeth. Thank you very much. A round of applause, please.
Thank you for the opportunity, sir. Distinguished guests present, all protocols duly observed. My name is Elizabeth John from LB Pharma, marketers of our unique anti-malarial brand, which is Anthems First Soft Gel. And along the line, aside the anti-malarial brand, the company deemed it fit to also delve into the supplement industry. And which brings me up to talk about a unique approach on prenatal nutrition for the best outcome in pregnancy and lactation. Of course, from the moment a tiny heartbeat begins, the mother's nutrition plays a vital role in ensuring that the child's future is secured. Next slide, please. So, of course, pregnancy is a time during which a baby develops in the womb of the mother, and it's also a period of physiological, mental, and social demand, which the company deemed it fit that as crucial period as it is, attention needs to be taken and attention needs to be addressed at that point in time. Next slide, please. So the challenges that pregnant women face, my product is actually positioned to address those challenges. Challenges like nausea and vomiting, gestational diabetes mellitus, iron deficiency anemia, preterm labor, low birth weight and stillbirth. All these challenges are actually what my brand is positioned to address in pregnancy. The importance of prenatal care to ensure healthy growth of the fetus, sound health and safety of the mother, to also manage health challenges in pregnancy, like I mentioned earlier, to also reduce risks like gestational diabetes mellitus and the like. It also reduces the complication of labor, fetal adoption to environment changes after birth as well. So please permit me to introduce to you our unique prenatal vitamin, which is still very much new in the company, but over time we've been trying to launch it from associations to associations, which is also the reason why we are here today, to introduce to you our premium prenatal vitamin called Daravit Pregmum. Like I mentioned, it's from the stables of LB Pharma, and one of the flagship brand we are known for is our Anthems First Soft Gel, alongside our Ebicef and Ebiclaf as well. So our Daravit Pregmum and Pregmum Plus, they are two different packs. It comes in soft gel, and it is positioned to provide essential vitamins, essential minerals, essential amino acids, fatty acid, and make up the shortfall of nutrients that these pregnant women are not getting in their normal meals on a daily basis. So here is just to talk about the constituent that makes up my prenatal vitamin called Daravit Pregmum. We have our vitamin Bs, we have our vitamin Ds, but one of the unique constituents we have that makes us stand out is the folic acid, the L-lysine, L-arginine, and inositol. We also have calcium pantothenic, we have magnesium, which also help reduce preterm labor. We have zinc, selenium, iodine. So it's a whole pack. In one pack, it's a whole constituent that is packed. We also have a natural mixed carotenoid, which is the natural form of vitamin A present in our Daravit Pregmum. So I mentioned earlier we have L-lysine. L-lysine helps to support the absorption of calcium, iron, and zinc. It also helps to improve immunity in order to help the mother combat infections and make her less susceptible to diseases or illness at the point. Next slide. We have L-arginine, which is also positioned to help support the relaxation of uterine muscles. It also helps to attain good gestational age. We have inositol, which is one of our unique constituents that make us stand apart from our competitors. Inositol is a carbocyclic sugar that is positioned to help improve blood glucose level in pregnant women, especially women of our age now that we are so used to taking drink in the morning, sweet in the afternoon. So we have inositol there to help regulate their blood glucose level. Inositol is also positioned to help improve the quality of good oocytes, and also it's important for tissue osmoregulation. I mentioned earlier that we have two brands, which is Diabetes Pregmum and Diabetes Pregmum Plus. So what makes Diabetes Pregmum Plus different from Diabetes Pregmum is the inclusion of the omega-3 fatty acid, which is the docosahexaenoic acid and eicosapentaenoic acid. And these two fatty acids are very important when it comes to prenatal care. So they are important during pregnancy to meet the fatty acid requirements of the mother. And DHA, which is also a fatty acid, is necessary for fetal brain and retinal development. The EPA reduces inflammation and prevents risks of preeclampsia. So this and more are actually what we have in our Diabetes Pregmum Plus. Our Diabetes Pregmum and Diabetes Pregmum Plus also contains natural mixed carotenoid, which is a safe form of vitamin A in pregnancy to help support good vision, to support fetal growth, and improve immune function. We also have our vitamin D3 present, which it is important for the modulation of the immune system. We have vitamin E, which is a great antioxidant to also help mop up free radicals, reduce oxidative stress. We have vitamin K, which is necessary for blood clots and coagulation. We have vitamin C in our Diabetes Pregmum as well. We have vitamin B complex, which is required for metabolism. Next slide. Okay, so we also have folic acid. Like I mentioned, one of the constituents that make our brand stand out is inositol and folic acid, aside other unique constituents that we have. So we have our folic acid, which is positioned to prevent neural tube defects like spinal bifida and encephaly and other birth defects that the baby might be susceptible to. It also reduces the risk of congenital heart diseases and supports proper placental development. We have our vitamin B12 as well to increase the formation of the DNA. We have iron, which improves respiratory functions. We have copper. We have all of these constituents, magnesium to help reduce preterm labor. We have zinc, we have iodine, we have selenium. So all of these constituents are what we have contained in our Diabetes Pregmum. And we also have the Diabetes Pregmum Plus. Like I mentioned earlier, what makes Diabetes Pregmum Plus different from Diabetes Pregmum is the inclusion of the omega-3 fatty acid. Now, for recommendations of our brand, it's for daily nutritional support for pregnancy and lactation, for micronutrients, malnutrition in pregnancy, it addresses that. It also helps in the management of health challenges in pregnancy and improve pregnancy outcome to a desirable result. And of course, our brand also comes in a soft gelatinous form. This decision was informed by the feedback that was gotten from the Anthems for soft gel. How there's increased bioavailability due to the fact that it's in soft gel form. So this informed the decision of the company to also bring out Diabetes Pregmum and Diabetes Pregmum Plus in soft gel form. So the fact that it is in soft gel form, there's increased bioavailability, it has aesthetic appeal, it's easy to swallow, it doesn't cause nausea and vomiting in pregnant women, It contains DHA for fetal brain development. It is cost effective and available from a reliable source, which is Elbe Pharma. So with your support, we are looking forward to making this year, we are looking forward to ending Darit Pregmon Plus and the Pregmon brand, and ensuring that you distinguished doctors can help prescribe the Darit Pregmon and Darit Pregmon ranges in your respective hospitals. Thank you so much for your time.
All right, thank you, Elbe Pharma. Next, we have Ace from Oswald. 10 minutes.
All right. Thank you very much, sir. Thank you very much. Good afternoon, distinguished medical doctors. My name is Ehis from Oswald Nigeria Limited. Oswald Nigeria Limited is a subsidiary of May and Baker Nigeria PLC, and we are in the forefront of providing quality and affordable pharmaceuticals for our teeming population. We have been in the business of pharmaceuticals for over 80 years, and we believe that we've earned the trust of all the medical professionals and our teeming population. And one of those products that I'll be presenting today is an innovative topical analgesic. You will not find any of such of these formulation currently in the Nigerian market, and that is our Anofast gel. Please, the first slide, please. That is our Anofast gel. Anofast gel is positioned to give fast and effective relief for all forms of musculoskeletal pain. In the course of this presentation, I would highlight what is in Anofast that makes it fast and effective in combating all forms of musculoskeletal pain. And I believe that anytime you think of prescribing topical analgesic, what will come to your mind should be Anofast gel. Next slide, please. Pain is highly unpleasant. Anyone that feels pain wants an effective relief. Pain is debilitating and affects the quality of life of people. So that is why Anofast gel came into play to give this fast and effective relief. Next slide, please. According to the World Health Organization, in 2019, it was discovered that over 1.7 billion people had different forms of musculoskeletal conditions. This goes to show that musculoskeletal pain is an important contributor to disability worldwide. Next slide. So Anofast gel relieves pain in various areas of the musculoskeletal system: joint pain, back pain, sprains and strains, osteoarthritis, rheumatoid arthritis, all of these conditions. Next slide. So what is in our Anofast gel that makes it unique? Number one is aceclofenac. Number two is capsaicin. Number three is linseed oil. And number four is methyl salicylate. As I said earlier, currently in the Nigerian market, you will not find any formulation with all of these four ingredients in one tube. So let's move to the next slide and discuss each of the active ingredients. Aceclofenac, as we all know, has marked anti-inflammatory and analgesic properties, and it has established efficacy in the management of osteoarthritis, rheumatoid arthritis, and all forms of musculoskeletal pain conditions. And the way it works is that it inhibits cyclooxygenase enzymes. And this inhibition prevents the synthesis of prostaglandins, which is highly implicated in all forms of inflammatory pain. So this is how aceclofenac works. Now, what makes aceclofenac different from diclofenac? Aceclofenac has a longer half-life. And because it has a longer half-life, it also has a longer duration of action than diclofenac. And this gives it a longer pain relief effect. So using aceclofenac gives the patient a longer relief to pain. And considering the fact that it is now in a topical form, it means that it will give a faster relief to pain, to any form of musculoskeletal pain. Next slide. Another interesting ingredient is in our Anofast gel is capsaicin. Capsaicin is derived from pepper, and it has established efficacy in management of musculoskeletal pain. How does it work? It binds to a receptor, that's TRPV1 receptor on the sensory efferent nerve. On binding to this receptor, it is activated, and there is influx of calcium ions, and there is release of inflammatory neuropeptides. This causes an initial mild but tolerable burning sensation, after which there is desensitization of this nerve, which results to analgesia. So what this means is that capsaicin has the effect of desensitizing local pain nerves after an initial mild and tolerable burning sensation. So this means it's very effective in handling musculoskeletal pain conditions. Next slide, please. Also, another ingredient in Anofast gel is methylsalicylate. Methylsalicylate works by two mechanisms. Number one, it has a rubeficient action. So when you apply it on the skin, it causes vasodilation of the local, it causes vasodilation where it is applied. And this causes a feeling of warmth. This feeling of warmth maxes the sensation of pain. Another way it works is by its anti-inflammatory properties. On absorption into the skin, it goes into the dermal and subcutaneous tissues where it is hydrolyzed to salicylic acid. And this has anti-inflammatory effect. So this brings about analgesia for any form of musculoskeletal pain. Now, the last ingredient is linseed oil. Linseed oil is a rich source of alpha-linoleic acid, and it has established efficacy in managing all forms of musculoskeletal pain, such as osteoarthritis and rheumatoid arthritis. Next slide. So now, looking at all of these four ingredients, they all have efficacy in the management of musculoskeletal pain. Now imagine all of these ingredients in one formulation called Anofast gel. You can imagine the kind of relief your patient is going to experience. So when you think of musculoskeletal pain and you are thinking of a topical analgesic to use, I would advise you go for Anofast gel. It is applied easily on where the pain is being felt, massaged. It is massaged appropriately there, and within a very short time, within minutes, that patient begins to feel the analgesic effect. Few contraindications: it should not be used in children less than 12 years old. It is contraindicated in children less than 12 years old. It should not be used on an open wound, and for people also that are hypersensitive to it. Now, the summary, next slide. So, Anofast gel is going to give you fast and effective relief to all forms of musculoskeletal pain. And as I said earlier, it is better than the diclofenac containing topical gel because the aceclofenac gives a longer relief to pain, while the capsaicin has the effect of desensitizing local pain nerves. So all of these makes Anophar's gel provide fast relief and effective relief for musculoskeletal pain. Next slide. So I would like to implore everyone here present, you should all adopt Anophar's gel in your prescription when handling patients with musculoskeletal pain. We have a stand and we are running a promo. Buy 10 packs and get 1 free. And the price is not expensive. Just with 700 naira, you get a pack. Then when you buy 10 packs, we give you 1 pack free. That's like 10% discount. So thank you all. We'll be expecting you in our stand. Thank you.
8 countries. Next slide, please. So, but despite these challenges, are there African countries that are using AI already to improve vaccination efforts? The answer is yes. We have different use cases in Ghana, Rwanda, even Nigeria, as well as South Africa, Botswana, and Kenya. A very remarkable example is Ghana, where the government actually powered with Zipline, which is an AI-powered drone delivery company. And what they do exactly is to ensure that vaccines are delivered to underserved areas in record time. And they've seen tremendous, remarkable increase in vaccination rates. In Nigeria as well, there's also another vaccination, there's also another AI model called the Advisor, developed by HelpMom. And what they do is to improve vaccination tracking and also help mothers comply more to vaccination usage. Next slide, please. Now that we know that AI is not running away, AI is here to stay. So what are future recommendations and directions? Well, when it comes to AI, the future is now. In the near future, starting now, AI will be used to predict coming waves of pandemics and epidemics. There is an AI model called recurrent neural network models, and they are suitable for this situation because they can analyze vast data sets and also provide warning systems. And what makes it important is these warning systems, they outperform existing statistical models for epidemiologists, right? Because they can analyze data, large amounts of data in record time. Another thing is that AI can be used to predict pandemic trends. For example, during the COVID-19 pandemics, there were a lot of unexpected COVID-19 pandemic waves. So AI can be used to predict these vaccination waves by considering different factors that otherwise would not have been considered by a single person or an epidemiologist. Next slide, please. Now, the conclusion and implications for private healthcare providers. I think this is more important. Now that we know that AI is evolving, how does this concern, the typical ANPMP member, right, and healthcare provider? Well, AI is here to stay. So the adoption of AI would position private care practitioners and also healthcare providers. What do I mean? For example, I gave an example of Zipline in Ghana. They partnered with the government and they were able to implement an AI model that actually helped them improve vaccination coverage. And I actually had the opportunity to speak with a physician here also that carried out a small trial in his hospital, and they actually saw improved effort. So what is my suggestion? What am I proposing? I'm proposing that more physicians should be open to actually adopting AI and actually helping these companies, helping these researchers that are improving AI to partner with them and also improve AI for specific use cases, especially in Africa. Like I said, when it comes to AI, the future is now. I will all be hearing of this. So let's be open-minded and ready to bring Africa to the next wave of healthcare innovation. Next slide. Thank you. Welcome questions from you.
A round of applause for Tobiloba Ajayi. That is looking into the future. That's great. He's actually the son of one of our members here seated. Thank you very much. We'll just take one question for him. The day is fast spent. Any question? Any question? I think everybody understands. The future is AI. Thank you very much. May I call on Dr. Oluniola to give us some announcements? It's been a very, very long day. After this session, please, you have to follow the national president to the exhibition stands. They partly paid for this conference, and it would be nice to make sure that we visit them formally with the president and other council members. Thank you very much. Dr. Lurian.
Yes, good evening, ladies and gentlemen. I want to thank you for your patience. Thank you for your attendance. And thank you for enduring whatever hardships you may have faced during the course of the registrations. I think that is all behind us now. But as we move forward, we know that for this evening by 6 p.m., we have the cultural program. At the cultural program, we will be entertained by the cultural group of Ogun State. One very important thing that we're also looking forward to doing during the cultural program, let's get our raffle tickets. It's been announced. And they are, sorry? No, get the raffle tickets today. Yes, you need to buy them today. The program, the raffle draw will be tomorrow. The more the tickets you buy, the higher your chances of winning. We all know that. Tomorrow, the program is extremely important. It starts very early, 9 a.m. And it's very important. We have the DG of NIH coming tomorrow morning. The meeting starts at 9 a.m. Buses will be, so we should be seated already by 8:30 at the latest. Buses will be at our hotels by 8 o'clock. Let's file out so that we can get here on time. Tomorrow is going to be an exciting day, starting with the presentation by the DGNIA. Then we have a scintillating session, a panel discussion. It's going to be very exciting. You don't want to miss it. Then we have other things, the japa syndrome, and many other things coming tomorrow. So please, let's get ourselves prepared and come on time tomorrow. And after now, we just follow the president to the exhibition stand. Thank you very much, and have a lovely evening. Thank you very much. The cultural night will be holding at the Cultural Center at Kuto. So again, once it's about 5:30, 5:45, sorry, let's be outside our hotel rooms, and there'll be buses to convey us to the Cultural Center. Thank you very much. Any other questions before? All right. Have a good evening.
Thank you very much, Dr. Oluniola. I think it's yours. Is it not yours? Please, the president just showed me a chart with the DGNHIA team. The advanced team is already in Abeokuta, and they have promised to keep to time. They have promised to keep to time. It will be very embarrassing for the team or the DGNHIA to be here and the hall is scanty. And we all know that is what we've been fighting for. That's our bread and butter. He will be here to answer all questions. Please take your friends along. Tell your friends 8:30 p.m. you should be here to prepare for the lecture for the DG. Thank you very much. The president will be leading to the exhibition stands, and those of us available here should please follow. Thank you for the long stay. Thank you for the cooperation. Thank you. Thank you. Thank you.